I'd like to call to order the Ramsey County Budget Committee of the Whole. And we'll start with doing introductions around the table. There's way too many people in the audience, but when you come up, you're going to introduce yourselves, just so you know. Okay, we'll start with Alex.
Good morning, Madam Chair. I'm the Interim Deputy County Manager for Health and Wellness, Alex Kutza.
Good morning, Ed Hauk, Research and Evaluation Supervisor in Community Corrections and one of the co-leads of our Health and Wellness Service Team, PMAT. Nice to be with you today.
Yes, thank you.
Joanna Berg, Deputy County Manager, Organizational Alignment.
Nicole Fretham, Ramsey County Commissioner, District 1.
Rena Moran, Ramsey County Commissioner, District 4, Vice Chair of Budget.
Lydia Gurma, Interim Policy and Planning Director.
Victoria Reinhardt, Ramsey County Commissioner, District 7. I'm Chair of the County Board and I'm Chair of the Budget Committee.
Ling Becker, County Manager.
Mai Chang-Shang, Commissioner for District 6. I use she, her pronouns.
Mary Jo McGuire, Commissioner for District 2.
Larry Timmerman, Performance Planning Manager, Policy and Planning.
Susan Earl, she, her pronouns, Interim CFO.
Thank you. I want to, at each of these hearings, want to make sure, or meeting agendas, we want to make sure that people know what we are doing here. So I will just do a brief introduction. First of all, good morning, and especially to those that are listening online. This is our Budget Committee of the Whole. And the budget itself was actually kicked off on August 27th. And it is the supplemental, 2025 supplemental budget and performance measure process, which is meaning we have a 2-year budget. In the first year, we focus primarily on the dollars. And in the second year, we focus primarily on the performance measures. The reason we went to a 2-year budget is because of the legislative calendar, where they have, basically they do kind of the same thing. And so in the second year, and primarily the supplemental budget part of it is based on what's happening there and in other places. So, but it is, again, really focusing in on the performance measures. The answer to, okay, we did that, so what? Is it working, is it not? Interim County Manager Joanna Berg and incoming County Manager, who is now the County Manager, Ling Becker, provided an overview of the proposed supplemental budget and the performance measurement process that led to the presentations to the board that day. Today, we are excited to continue the service team performance measure and the supplemental budget conversations. We really take great pride in ensuring the transparency of our performance measures and encourage all staff and residents to delve into service team and departmental measures by going to our Ramsey County website and entering the words Open Data Portal in the search bar. It will be the first search result that you will see. And this is something that we really do take great pride in. The Open Data Portal, anything that you would want to know about the budget and other issues as well, but the Open Data Portal is really meant to be there so that many of your questions, or it may raise questions for you so that we can actually get that information. Totally transparent. The purpose of these presentations is to take a deeper dive, as I said, into the performance of the organization, particularly at the service team level. The measures are tied directly to Ramsey County's 7 strategic priorities. Today, we will hear from Health and Wellness Service Team, the Safety and Justice Service Team, the County Attorney, and the County Sheriff. And given this is a different meeting, but the discussion that we had right before coming into this, I was thinking at the time, I was like, okay, this is going to be Commissioner Moran, the timing was right for this one. And because some of the questions and comments regarding light rail, I know that's the Regional Rail Authority, but the fact of the matter is, it's all part of what we do, and it's the county services that are going to make a difference there. Some of them. The transit has to do some stuff too. Anyhow, so we will start with the Health and Wellness team. So I will welcome Deputy County Manager Kutza.
Thank you, Madam Chair, County Manager Becker, and Commissioners. Thank you for having us here this morning. We are really excited to be here and have the opportunity to present from our service team performance measures for the Health and Wellness Service team. With me today is going to be Director Sophia Thompson. Unfortunately, Director Long is not able to make it, but we're nothing if not flexible, and Ed Hawk is going to be joining us to help, and then Michelle Finstad, Deputy Director in Corrections, will be online for questions as well. So we will tag team that. Jen Hamrick, the Integrated Health and Justice Administrator, will be doing part of this, as well as Dana DeMaster and Carissa Dillon. So I'm happy to be joined by all of them here, as well as many of our team members who have put in a lot of work to this effort. So this work represents work across all of the health and wellness departments, as well as work across the county, which some of you heard about yesterday in other presentations, and the many partners that we have. Let's see. Okay, so our service team, as you know, I'm new in this interim role, but it has been a really good learning experience for me to see the scope and the breadth of what this team does to serve our residents. We provide social services, financial assistance, public health, community corrections, veteran services departments, as well as the divisions of innovation and strategy and fiscal services. And we all work together to deliver programs and assistance that ensure residents can meet their basic needs. As some of my colleagues mentioned yesterday, this work isn't easy, and every day brings new challenges and opportunities for this team. And we are here for all of that. We are here as a team. And when I say team, I mean all of Ramsey County, right? We can't do our work alone in health and wellness, but this team in health and wellness is dedicated public servants who are here every day to serve our residents. Our great PMAT team. So who did all of this work? Well, Ed Houck, who's here to present and is our PMAT lead, as well as Sarah Mayat, we're the two PMAT leads for this team. Our controllers, Janelle White and Francis Odiambo. And then our PMAT members from Community Corrections, Adriana Arce, Claire Pillsbury. From Financial Assistance Services, Kamala Pereira, Kelly Nippenberg, Aronica Jackson. From Public Health, Cheryl Armstrong and Kim Closey. From Social Services, Lois Cheeseborough, Brianna Carey, Lola Oshodi, Fallon Wynn, David Herrera Santa Cruz, Arthur Harris. And then from Veteran Services, Christina Rost, Amarita Reyes, and Alexandra Fleming. These people dedicated their time and their expertise to this work, and for that we are very grateful. So today, this slide highlights the 5 measures that you're going to hear about this morning, and the 2 strategic priorities, both the putting well-being and community at the center of the justice system transformation and advancing a holistic approach to strengthening families. I want to highlight that this work helps support one Ramsey County model, right? Yesterday, during the IPR presentation, you heard about the navigators, that without them, we couldn't do all of the work that we do. You also heard in EGCI about the workforce programs, and we work so closely with them. Safety and justice is yet to come before us, but we also work with them. You'll see that in the justice transformation work that we're doing. We're all doing this together for the betterment of Ramsey County residents as one Ramsey County. So in this model, what we're trying to do and what we're going to show throughout this presentation is we're trying to break down silos, replicate strategies that are working for us, and operationalize work as we go. So it's not a one-off or a pilot. It becomes part of the work we do every single day to serve our residents. With that, I think I will turn it over to Director Sophia Thompson and Ed Houck to present our first measure.
And before you start, I would just like to say, Ed, don't worry, we're good. It's a very, we appreciate all of the work that has been done by this team, and the budget is a very difficult thing to pull together with the constraints that we have. And so even if we have, and I'm sure we will have questions, but we're all working on the same team here.
Good morning. My name is Sophia Thompson. I'm the Social Services Director, and I'll get us started on our talking about our first priority this morning. The Health and Wellness Service team chose to focus our efforts today on the strategic priority of putting well-being and community at the center of justice system transformation, as our first discussion with you this morning. We know the harm that our systems, and in this case, our public safety system, has caused to the community. We have plenty of data that shows the disparities that exist related to well-being services, employment opportunities, and housing. Creating change in this area requires system transformation with our community. In the next few slides, we will highlight how social services and public health teams work to be the preferred intervention to community need, and where justice system involvement is only used when these diversions are unsuccessful. We'll start by talking about our efforts with community. Before you have several different programs where we really focused our emphasis on engaging the community related to our race, equity, and community engagement action teams, fine and fee elimination, youth justice transformation, healing streets, appropriate response initiative, and our competency determination process. Some of the ways we engaged community, as you know, consist of surveys. We have a great way of surveying people, sometimes too much. We engage them and want them to come to us. So in our appropriate response, we have monthly dinners with our community members, where we're at a community location that rotates around the city around the county, and we're sitting and having conversation. And that is where we're getting a lot of our feedback about what's working and what's not working. So I just wanted to give that example of how we're engaging. The other important piece I want you to know about, or that we want you to know, is that we value our community as the experts. And as we are experts in our own subject areas, we want to make sure that we are compensating them for their time. And so we build that into the process whenever possible to make sure that community is being compensated. Next, we're going to have Jen Hamrick come up and give us some specific details on our measures.
Good morning, Commissioners, Chair, County Manager Becker, DCM Kutza. I'm Jen Hamrick, the Integrated Health and Justice Administrator. Very excited to be here this morning to talk with you all about the Appropriate Responses Initiative, ARI. So as some of you might know, the Appropriate Responses Initiative intends to create new dispatchable resources for when community members call 911, so that we have a robust system to be able to support the needs with the most appropriate response. We recognize that for some calls, police, fire, and medics is the most appropriate response, but the needs of our community is vast, and that there are other responses like our mental health crisis team and public health response teams and our coming community response team that can add additional options to make sure that we're sending the most appropriate resources. The Appropriate Responses Initiative has really been able to amplify existing partnerships between the Mental Health Crisis Team and the Emergency Communication Center, the ECC, which is the entity that takes all 911 and non-emergency calls for the county. These two teams have been partnering since 2016 to be sending mental health-related 911 calls to the crisis team. Through ARI beginning in 2023, we were able to amplify that system of having embedded social workers who sat in the Emergency Communication Center to be able to better triage calls related to mental health and to substance use. Later today, for the Safety and Justice presentation, we'll talk more about that triage process. What we really want to focus on in this performance measure is the number of responses coming through the ARI entry point that are getting in-person responses. What we know from decades of crisis work as well as research is that if a community member receives an in-person response, they have better outcomes, and that they have more access to other services, including stability services through the crisis team and other services throughout the county. We've been really intentional through ARI and the adding of additional staff people to the crisis team to allow for more capacity to be able to increase in-person visits. We do also recognize that individual choice continues to be a really important piece of mental health care, and that not all of our community members want or need an in-person visit. What we're seeing from data is both the embedded social workers in the ECC as well as the crisis team might be able to meet the needs over the phone by providing somebody a phone number or access to resources. But we do want to continue to work to increase in-person visits. And so the numbers that you're looking at the slide here is just from 2023, which really marks the time where we started changing how we collected data as well as added additional resources. And so 8.5% of the calls that went to the crisis team just through a transfer from the embedded social workers and 911, 8.5% of those received an in-person visit. What's really dynamic about the crisis team is 911 is just one entry point. So they take walk-ins as well as they have a separate crisis number as well. And so the team works to see kind of the calls, the walk-ins, the people that they have that need support right now. How can they manage and do the best they can to get the most appropriate resource to that person in that time? As you can see, we're going to continue to work to be able to increase the in-person visits for the crisis team over the next several years. Our public health response team launched in February of this year, and so we do not have any 2023 data. We're currently in 7 cities across the county and continue to work towards full county-wide implementation. With the public health response team, the 911 transfers is the only entry point for them, and that's one of the reasons that we anticipate that they will be able to meet in-person needs at a higher percentage rate than the crisis team, but also still recognizing that even with the public health response calls, that not everybody is going to want or need an in-person visit. We have seen with some of the calls now that embedded social workers have been able to provide people with the resources that they need that doesn't warrant a response going out. And so here's something that's potentially familiar to a lot of you. We talked about it a lot in our board workshop in June and have shown it other times. This is just for context, the full ARI call structure that shows those embedded social workers who get sent calls from the people who answer the phones, the telecommunicators in the call center. They get transferred any call that's related to substance use or mental health to be able to ask some additional questions to better understand whether a public health response or a crisis team response is most appropriate, or in some cases, the calls get sent back to traditional response as more information becomes available. We also have our community response team listed here, and that is anticipated to be beginning in 2025. And at the bottom, you can see we have started planning around our co-response model that right now is focusing on co-response between the mental health crisis team and the public health team. In the future, we will be looking at potential response capabilities with other responders and traditional responses, but initially, we're starting with building out that model with just the appropriate responses, ARI teams.
And I do think that it is important for people that are listening, or not that they can necessarily read all of the individual things there, but I think what's important is noting the timeline. Because some of this has just started. The appropriate response initiative is an incredible improvement. And people are actually getting the help that they need rather than going through an entire emergency call response. So, but again, I think the planning began for the co-response model in the spring of this year. The community response will be beginning next year. So this is something that is a work in progress, but really concentrating on the priorities, the priorities for Ramsey County in providing services that fit and that we can move to prevention. And there's so many different aspects of this And it's exciting that it is happening, but for people that expect, okay, you implemented this, so tomorrow it should be perfect, it's a rollout is really what it is. And I just want to make sure that people understand that we've already started something really great, but we're going to be moving even further.
Yeah, I appreciate that, Commissioner. And right now, the embedded social workers and the mental health crisis team are available countywide and fully rolled out. So it's the public health response team that we're working on getting countywide, and then community response next year.
Yes. Commissioner McGuire.
Thank you, Madam Chair. We do love this effort. It's not just a program, I mean, this whole effort that we have. And you had mentioned that we're in many communities, and I think we're in St. Paul, yeah, St. Paul and many suburban communities.
So not for our public health response team. Our crisis response team is responding.
The crisis response. Okay, so the public health response. Then maybe I need to know the difference, I think, a little bit more before I ask my question. But I'm just curious, what communities, are there communities that don't know about it so haven't asked about it, or are there communities that are waiting for it to happen? Or just give me a little better sense of that, because I know that I think half of the communities I represent have it, and I'm not sure if the others just think they don't need it, or just give me a little better, give me a better sense of what's going on.
Absolutely. So the public health response team responds to substance-related calls that are not a medical emergency, not an overdose, and not an unknown overdose. So that could be calls like, my uncle heavily uses alcohol and I haven't heard from him in a while. Can somebody go check on him? I see someone in a park who's actively using substances. Can somebody go out and support them? I found dirty needles on a parkway. Can somebody come out and deal with that? And so really focused in on harm reduction and substance use support. And right now we're in Falcon Heights, Little Canada, Maplewood, Mounds View, New Brighton, Shoreview, Vadnais Heights, and White Bear Township. So those are the cities that the public health response team is actively responding in. We are in conversations and partnerships with the other cities. Part of it is some cities are wanting to see kind of how this works and how this rolls out in other communities. And some of the cities that we have in the county already have alternative response type supports. And so we're doing some work to make sure that we can create a seamless process that's both understandable for the folks who are answering the 911 calls, that we can have a countywide response, but also take into account some of the nuances in specific cities. And most importantly, we want to make sure that we're aligned with those cities so that it's not confusing for community members what they can be expecting when they call 911 or need support in different cities or throughout the county.
Thank you. Thank you very much.
And that's one of the reasons that I wanted to point out that this is a work in progress, and you have to start somewhere, and it's going to be a proven, I believe it'll be proven successful, and the others will come on board as well. Did that answer your question, though? Because that was about the public health response. Did you, and you wanted to have more information about the difference?
Because obviously I was confused, because I do know there's two programs, but I do confuse the two. So.
And so the mental health crisis team goes out to mental health related calls. And so that could be things like people having ideations of self-harm, people who are known to have a mental illness, and somebody calling in and saying, my cousin has bipolar disorder, I haven't heard from them in a while, I'm concerned about them. And what can get tricky and a little nuanced here is we do know that mental health and substance use can be very closely aligned, and that a lot of people who have mental health needs might also be utilizing substances. And that's really the role of the embedded social worker in the emergency communication center, to really be able to suss out, is the presenting issue of this person in this call at this moment, is it about substance related support that the public health team has been trained to respond and support in? Or is there mental health components where we really need the trained clinician who can go out and provide a deeper level of support and a different access to resources, some of which may be substance related, but we're really looking at is the primary need at the moment mental health related, and then a crisis team member will go out.
Okay, so thank you, Madam Chair. And maybe I need just a meeting about this because I think I'm actually confusing them all with embedded social workers then.
Yeah.
So there's an embedded social worker, which is how they might access one of the other two, or with 911, they might access the public health response or the mental health response. So we've got a lot going on here, and I don't know that we want to spend all this time going over it, but it's great that we have a lot of opportunities, but
And
I can
Commissioner McGuire, that's the note that I've gotten.
Okay.
So that we will, I mean, it is something that is hard to understand, especially as you're trying to put the kind of the map in your head of who goes where. And we've got more. I mean, this is just the beginning. So we're going to have more added to this picture. But I neglected to say this at the beginning of this meeting, but what I do is I will take notes on what I want to come back, and sometimes it's in a workshop, and I think this one would qualify. I mean, because there's so many moving parts, and newly moving parts especially, and trying to figure out how we make sure that we do roll it out countywide. And so that's one of the things that I will, and we'll see what else comes up that I take notes on that we need to have something come back on. So we don't expect a full answer here today because, as you said, that would take most of the time.
And so we will be planning to bring an appropriate responses workshop early next year. Okay. But I can just quickly take a crack at answering this because I think it'll add some context to the next slide and what Director Thompson will talk about. So on the org chart that we're looking at here is the embedded social workers in the 911 center. These individuals sit in the ECC and take call transfers. So these individuals don't leave that building. Their role is that triage to better understand, is this substance use or is this mental health related? And where I think the confusion comes in is we also have embedded social workers in police departments, and that's a different role. So those individuals are working with police departments in the cities they're embedded in, and we may call on them to respond to 911 calls in Roseville or where it is that they're at, but it is a different role. We just use the title embedded to signify that that person sits somewhere other than the crisis team, either the ECC or a police department.
Thank you, Madam Chair. That's helpful. And I do look forward to a workshop because it is amazing work and my communities love it. And I think everybody loves it, the residents. Yeah, thank you.
Commissioner Jean.
And for the embedded social worker position at the ECC, is that fully staffed already throughout for like all hours?
So it's as fully staffed as we had planned at the moment. So we have 4 positions that accounts for about 20 hours of coverage. There are a few gaps specifically on Friday and Saturday. Some of that is intentional planning of we don't send our ARI teams out to calls involving weapons. And on the weekends, we do see a higher acuity of calls. There's also some workforce issues here in terms of the people that we need in these embedded roles as well as on the crisis team need to be pretty highly licensed, which means they can make a lot of money, a lot of places. And so some of those weekend and overnight hours are really challenging to staff. And so at the moment, we don't have active plans to add additional staffing to this team. That may change as we continue to work on some workforce development and other program pieces.
Thank you.
Thank you.
Thank you, Jen. Well done, as always. No one can get us into understanding the program much like Jen. I'm going to take us to the next section where we really look at our increased in-person response. So we want to ramp this up. We want to make sure that we are increasing our ability to meet the community need. And so when we think about how we are putting well-being and community at the center of justice system transformation, thank you. It's clear that we will need to increase our ability to respond in some areas while reevaluating in other spaces what is working and making shifts as needed. One of the things that we're getting at is different efforts of this program have rolled out at different times. And so where we had our embedded social workers in our police department starting a few years ago, ARI came behind it, and now we're trying to make sure it all makes sense together. And so there is some reevaluation we are doing as well as to what makes sense so that it's cohesive. I'd like to start by sharing that listening to our community partners at meetings, as I mentioned during our monthly community gatherings, it is clear our community is grateful that Ramsey County has taken this effort, and yet there's still changes to be made. We know that there are other jurisdictions looking at similar work, and we have taken the plunge. And so thank you for allowing us to construct a team that understands the work and is able to look at it very critically and start. In order to increase these responses, we must focus on our staff. We must prioritize our outreach and look at our partnerships and how we're providing support to one another. For example, within the crisis team, there has been change in how we're asking staff to do their work. Previously, there was more discretion of how an in-person response would take place versus now we're meeting the needs in a different way. Someone is telling you, I need you to go out on this call. In the past, the crisis worker would use their clinical skills and really work to determine whether or not an in-person response was needed. That's a culture shift. That is something that for 20 years has been happening one way, and now we need to shift. That takes time to change, as you all know. We've been very intentional in how we're supporting the team and providing them with opportunities for this intentional change management and consultation. What I'm getting at here is there's a lot of effort that goes into working with people on that change, helping them to understand the philosophy and the bigger picture while still dealing with the workforce challenges. And when someone says, hey, they didn't come out, what happened? And taking those very seriously, because we don't want any of our constituents to feel that they were not served. Social workers at the emergency communication centers, they are asking deeper questions in order to understand the need and if an in-person visit is desired. And we continue to leverage our police-embedded social workers, that other program, as they are being asked to go on calls in cities that they are supporting when available. So again, really trying to bring it into cohesion, even though they were different efforts that started at different times.
I don't see any questions, so we can move on to the next one.
Good morning, Commissioners. Again, my name is Ed Hauk, a Research and Evaluation Supervisor in Community Corrections and the co-lead of our Health and Wellness PMAT service team. I have the opportunity to speak to you today about our second measure around our strategic priority of justice system transformation. And before I start speaking about it, I just wanted to note that we're talking about the priority and really the emphasis and importance on social services and public health responses, right? Helping find off-ramps and trying to divert people out of the criminal justice system. The measure I'm going to talk to you a little bit about today, though, speaks to people who end up and wind up going through our criminal justice system and, making sure that we're still equipped to address the needs of those residents and communities. As we know, the issues of racial disparity, overrepresentation, mass incarceration remain huge issues about both the national and state level, and so really thinking about how we as a county continue to address those big issues and challenges in the criminal justice system. And so the measure that we are wanting to talk a little bit further with you today is about revocations. So percent of adults on felony level probation who are being revoked to prison. And just want to note that you might be like, well, let's talk what revocation is first before we, let's make sure we're clear on what a revocation is. So what we're looking at is someone who comes on to sentence to probation, in this case on a felony offense. They will have a they may have a sentence that's stayed, right? So they're being put on probation instead of being sent to prison. So we end up with So what we're ended up looking at here is what % of those adults who are on probation end up getting revoked. So they end up violating like a term or condition of their probation. That may be due to not remaining law-abiding. It may be due to reoffending, right? But it also could be due to other behaviors and non-compliance with conditions, failing to maintain contact with probation, right? Failure to complete certain types of programming, et cetera. So we call those kind of technical violations. But the idea here is that people are being on probation who are being, unsuccessful, right? I mean, it's a negative outcome to have someone sent to prison, right? So this is looking at that measure, and historically, and we'll talk about it a little bit further in a second, Ramsey County has had one of the highest revocation rates in the state. And we'll talk a little bit more about some of the work there, but we have been nationally recognized as being at the forefront of those reform efforts through an initiative. I think there's been a board workshop about reducing revocations challenge, or at least it's been talked about, I think, in a corrections board workshop in the past. So what we end up seeing here with our data is, in 2019, 13% of adults who are exiting felony level probation are being sent to prison. In 2023, it's 6%. We've been able to sustain the reductions that we've achieved through the pandemic as we've come out over the past couple of years. Okay, next slide. So going a little deeper into the data, we're actually going to go out a little further and just show you a little bit of this measure broken out. We're going back to 2016. The reason we're doing so is twofold. One, I mentioned in the last slide the statement that Ramsey County had historically had one of the higher revocation rates in the state. Well, in 2016, a report was published by the Minnesota Sentencing Guidelines Commission that showed just that we were the second highest of the 10 judicial districts in terms of revocation. We were at 22% revocation rate for adults on felony supervision. I also note that year 2016 because I mentioned the Reducing Revocations Challenge, which was a big national initiative. Ramsey County was one of 5 sites nationwide to be funded to support policy and practice reform efforts to not only to understand the research of why are revocations and violations happening, but what are the policy and practice changes that could be implemented to reduce them. So we've used 2016 very much as kind of our baseline year. When we did the research that informed the recommendations, 2016 was kind of the basis of that. So if you're like, why 2016? That's why. And you can see the graph on the left shows a 77% decrease of adults being revoked to prison since 2016. So you can see the kind of the raw numbers about how many people are we talking. And then you can kind of see the overall percentage trend on the right. So we said 22% in 2016, less than 10% since 2020.
Commissioner Moran.
I have a question in regards to the number of adults. This is in here. Why is that important? What did we learn from sending people on probation to prison?
Well, we learn when, so I think how I would answer it is there's the question of people when they come out of prison, are they doing better or are they doing worse? Part of it is that people go to prison, they return to their communities. So we also know that not everyone who goes for a stay in prison is necessarily going to get the programming and resources and treatment that they're going to need to reduce their likelihood of continued criminal activity. So by being able to keep people in the community, by being able to try to provide those services and resources, we think that we're going to be better positioned to, again, address and meet the needs and make our community safer.
And if I could, just so I want to note that Michelle Finstead is on the line. If there's something that she would like to respond to, I hope that she will just raise her hand so that you can then make sure that she can speak to it. And then I just also wanted to, as far as the numbers here, I think the fact that we recognize that we needed to make a change there, that people didn't necessarily have to have it revoked. They may have done the same things, but it was a matter of trying to make sure that we were making the right decisions as well. So part of this, and we'll hear more about it because there's other pages that I think are really critical to understanding, well, for example, who is being revoked. And just trying to figure out how to make this a fairer, impartial system so that if you get revoked, you really need to be revoked and go back to prison. County Manager or Deputy County Manager Kutza.
Madam Chair, Commissioner Moran, I just want to add here too, when we think about this is looking at felonies, right? So we're talking about there's significant harm when you're sent to prison and the collateral damages around an individual being sent to prison on a felony. That's why we're looking at this particular measure, because the consequences of that for the individual and for our community are significant. So keeping people out of prison and in the community in a way that is, they don't get revoked back to prison. That's why this is so important to us. That causes harm and long-term effects on those individuals in our community in ways that it is really important for us to focus on. When people don't need to have that happen, we should not have that happen for them. I don't know if that's helpful.
And I guess I just add a little bit to through the racial lens that Ramsey County have, is that a disproportionate number of African Americans, people of color, are finding themselves on probation. That's the pathway. And sometimes, even if it's a felony can be you wrote a bad check up to a certain amount, right? And the answer is not always that, well, you need to revoke that and send them to prison. But, connect them to the resources back in the community and do other things that we know shows a better, that has better outcomes for that individual, because we want people to be able to enter into the society and are contributing to the society, and often a prison is not that does not always do that. And so I'm just torn with the numbers because I like the fact that the numbers have gone down. Of course, they're not as far down as in 21 because we was coming out of a pandemic, and so that makes sense there. But just a disproportionate number of people who've been impacted by the system, and giving them a chance to be able to re-enter the community.
And Michelle Finstead does have her hand raised, so she has a comment on this. And obviously, we're moving to this slide about race as well that will help us with part of that.
Madam Chair, Committee, I just wanted to add that in addition to talking about the individuals and their felony offenses, we want to keep families intact. So when you pull a wage earner out of the family and send them away, it's very disruptive to the family as a whole. It's really disruptive to children if their mothers are removed from the home. So we really do take the whole family approach on this too. Can we keep the family intact? Can we keep wage earners in the community? And again, as both Alex Kutzka said and Ed Hauk said, there is good programming in the community, and quite often we can effectively help people rehabilitate, and that is the goal of our work, is to rehabilitate individuals and keep them safely in the community. Safety is always our bottom line.
So I think, thank you for that information. I think that's important that we say that out loud, because there will be people who were saying, well, send them away, lock them up, And so having a clear message about why we see these numbers, why they are important, is important to say out loud. Yeah. So thank you.
Thank you. Commissioner Ortega.
I just, on the previous slide, if you go to the previous slide, the number, I guess, what's the universe? These are just the numbers that went to prison. What was the 100%?
Yep. So that would be all felony probation cases exiting probation. So we're talking like the denominator, if you're like, what's the 100%, we're talking well over, 1,000 plus people in a given year. There's some year-to-year variation. We've also reduced it's hard to give you an exact answer just because we've also reduced we've seen reductions in our probation population overall from 2016 to 2023, but that's the idea. It's all felons leaving or exiting probation, and what percent of them are leaving to go to prison.
And that would be good information to have so that we can put it into context.
We can definitely get you that.
I can see another workshop, Madam Chair.
Commissioner Ortega's still got the floor.
No, thank you. Okay. I'm still processing these numbers.
Commissioner McGuire.
Thank you, Madam Chair. I can see another workshop, and of course, this is a field that we've been working on at AMC too, is all of the community corrections, the probation funding. Just to ask a smaller question, so there's probation and there's probation. I mean, there's different levels of probation too. There's intense probation, and then there's, not so intense. So we're talking really intense probation on the felony level. And so it's, when we ask, I'm curious when Commissioner Ortega asked how many we have on probation, is that on intense probation, or is it on, if that's the big number, I think there's levels, right, of probation. And so it's just a big question, and I think it's probably, good for another a workshop where we really understand, what are we really trying to do here. And I think it's really great work, and I appreciate Director Finstead, I think she's the director, giving us that background, and of course you giving us this background in this work. And I'm embedded in it, like I said, with public safety at AMC, because every county in the state and the country, quite frankly, is working on this and trying to reduce the prison population, as the state is trying to reduce their prison population, because it's not so good for them to be in prison. It's better for them to be rehabilitated out in the community. So we got to make sure they give us resources to do that. So that was a big topic of our conversation at the AMC Policy Committee this last week. Thank you.
Thank you. Commissioner Ortega.
Just real quick, I would like to have the same information for that graph that's in front of us now. So what is the universe in those graphs? Because what is 8% out of what?
Yeah, we definitely have the numbers behind the graph. I will say that, in terms of when we talk about our probation population, as we've talked about, there are significant racial disparities in composition. So when I don't have the denominators in front of you, but I know that our black, African-American probation population, that's our largest group of people on probation. So when thinking about these charts you're seeing in terms of who's more versus less, I would say that that's where some of the impact on these reductions is going to have we're going to see the biggest impact, just because that population is so over proportionate.
That's fine. Across the board, I just want to know.
Yep. And we can provide that to you, Commissioner.
Madam Chair, we'd be happy to get that back to you.
Okay.
All right. Thank you. And just quickly on this slide, we again, reducing utilization of probation revocation is a measure of our justice system transformation, but it's imperative to continue to look at the data by race and ethnicity to ensure that we're seeing progress across the residents and communities and populations we serve. And this, a lot of graphs on here, admittedly, but what you see are decreases in revocation rates by race, ethnicity for all the groups shown here. However, we are continuing to see comparatively higher rates for Black and Hispanic adults on probation. Again, so we're seeing progress, but there's clearly more work to do, and isn't just for those groups as well, continuing to work for all our communities to ensure we have the services and resources in place to minimize utilization of probation revocation.
County Manager Becker just commented that there's also a subset here that would be useful information for us to have, and that is, this is the universe. But you have the 18 to 24-year-olds. That is a subset, and there's additional funding that goes into that age group as well. And so I don't think that's part of this presentation, but I think that that is important for the county board members to have.
Thank you. Okay. Finally, we're showing you a map, and we're showing you a map for a couple of reasons. One, you're going to see some more maps today, and we want you to also kind of take a look at the map, and we're just going to sort of suggest there may be some commonalities and overlap as we go through our presentation today on the service team and our priorities around the maps. Second, I really want to note this is a map of what it is this is a map of individuals who are open on probation and community supervision, and we're just plotting where they live in our county. And so you can again kind of see where you see more kind of concentration of purple dots of where we see tend to see more of our clients residing. And we just note that this work that we're doing and this strategy around not just reducing revocations, but around some of our other justice system transformation work. I mean, these are the residents and communities where this is making a difference, right? Where we can not only reduce revocations but improve success for people on probation. This is this is kind of where where people live and where the work is really taking place.
So I'm curious, obviously it's going into other counties, so if they're it's a felony, and so, but if they committed the felony in Ramsey County, then they are part of our population as far as, regardless of where they live or move to, they're still under Ramsey County probation?
So I'll speak to this in generalities, and I think there probably is a more specific answer that we'll probably provide you after the workshop. But if you are sentenced in Ramsey and you live outside of Ramsey, but if you live in Hennepin County, generally the answer is no, that we will continue to provide the supervision. If you live outside of Ramsey or Hennepin but are convicted in Ramsey, there is some criteria and some rules in place, but generally their attempt is made to transfer you to the county where you live, so you receive your probation there.
So can I make the assumption then that since Hennepin County and Ramsey County both have high numbers, which is why we're not going to take somebody from Ramsey and say, hey, Hennepin County, you take that one on, because they've got a full caseload anyway. Does that same thing happen for Ramsey County, where other counties don't transfer to our county? Is it the same general model as Hennepin?
Yes, the general model is that you should receive, you should receive the probation service in the county you reside. Is kind of I think the rule of thumb in Minnesota. So if you lived in St. Louis County and came to Ramsey, but we can definitely come back and try to provide some more specifics about the kind of that the transfer policy and how that works.
Well, and specifically, I guess what I'm asking about is, it seems clear that Hennepin County has a policy of you keep it that they will do their own, but if we have a Ramsey County person that goes and lives in Hennepin County, that we're still going to service that case. And I want to know, does Ramsey County have the same with other surrounding counties, or how does that work? It sounds like it's something that is up to the county to decide?
So I think Ramsey and Hennepin kind of work the same way here. So if you're somebody that so as we said, if you live in Hennepin but were convicted in Ramsey, Ramsey will provide the probation supervision, and vice versa if you switched it around. So it's kind of reciprocal is my understanding.
Okay, so this is just between the two counties?
Correct.
Okay, thank you. Did I see?
Nope, I'm good. I'm good.
Okay. I did see a hand, but now it's not there anymore. Okay.
And we have our final slide here, and just talking about some of our strategies to, again, to continue reducing to reduce probation revocations. You know, there's kind of a lot of like strategies being pursued. So let me just highlight a few things.
Commissioner Ortega.
Excuse me, I didn't mean to interrupt. I just processing what you were just saying.
Okay.
So if we have an individual from Ramsey County who it would be a positive to move for whatever reason outside their community to Dakota, could we work it out so our probation people still deal with that individual versus, or is it mandated? I don't know if mandated is the correct word. Is it does it have to be transferred?
Again, I think I'm going to have to defer to, we'll have to get back to you with an answer on that. I don't think I'm best positioned to answer if it's mandated or not, unfortunately. So I think we will.
And it sounds to me also like this particular policy is just between Ramsey and Hennepin because of our volumes, I assume. So Dakota, I would think.
I understand all of that. I'm just thinking that our social workers, might think it's a good thing. For example, if an individual could find a job in Dakota County, okay, and they have good transportation and so forth, and it's good for them for a lot of reasons. Might be chemically dependent issues or whatever, to be outside of their community for a while. Or there is employment, do we still keep that case, or do we have to turn it over to Dakota County?
Madam Chair, Commissioner Ortega, so I'm just quick messaging with Deputy Director Finstad here. And the answer to that is it really depends. And so what we'd love to get back to you on is like the numbers of the people on probation, where they're transferred, why not, and the cost of supervision. So we'll, if that's all right with commissioners, that we'll follow up on that, because I think it's
by the ringing.
very dependent on the specific circumstances of both what county and the individual.
Okay, thank you.
Yep.
I was going to ask AV to see what they're ringing. I don't know if it was in here or in the room.
Okay.
I'll check.
Thank you. Okay, and I did put that down as far as the transfer policy coming back to us as well. Okay. Did anybody, Commissioner McGuire, did you get?
No, I'm good. I'll hold.
Okay, all right.
I see we've got corrections still coming up, so yeah, community corrections.
Okay.
Yes, and how are we doing for time?
Yeah.
Let's wrap up this section so we can
Yep.
Okay.
So
go
let me
ahead.
wrap up by again we sort of again, as you saw with the previous slide, really talking about how this with staffing, with outreach, and with partnerships and support is how we're kind of pursuing these strategies. And I just want to note that kind of what you see on here again, the role that community has sort of played in sort of the cultivation development of these sort of strategies around reducing probation revocations. I will note one that I think we're really excited about, this contract for community-based justice involved mentors was co-designed, and well, I should say co-designed, it was really designed by community through our Reducing Revocations Challenge work to design a service to really provide that kind of mentorship and guidance to people on probation and who might be struggling, to provide an additional resource above and beyond probation and some of just kind of the other community programming. So with that, I will pause for any final questions.
Commissioner Zhang and then Commissioner McGuire.
Not a question, but a comment on great work. These are the strategies that are laid out about prevention and supporting folks and whole family support. And I would just name again about our unsheltered population, that I'm glad that we started investing in that. And this speaks to the work that we are doing upstream. So thank you.
And,
Commissioner McGuire.
Just a couple comments also, and one question. Some of this is work that we're doing in conjunction. Is this with the Casey Fund? Is there a foundation that we've got a grant from that we're doing all this great work? I mean, I know a lot of it is us as well.
It was through Arnold Family Ventures. The grant has actually concluded, but the work continues.
Great, I appreciate that. And I would just say, I could say this when our Director of Corrections comes up, but you've heard me talk about this many times at this board meeting, the amazing work that the Minnesota Association of Community Corrections at Counties, or MACAC, at their conference that they do. And we talk about a lot of these strategies, and I know we're a big part of that conference, and it's coming up next week. But that's where I tell you, gives me hope all the time, because we get to hear about all of these amazing things that people are doing and we're doing to really reduce revocations and really enhance our probation. So thank you for all your work.
Okay, Commissioner Marion.
I too just want to say thank you for your leadership and the work that is happening in this area, and looking at second chances, and and looking at the support and services coming in from communities, and looking at the whole family. Good job.
So as we conclude this section, we do want to draw your attention to, as was mentioned, the current funding strategies. So we are using our American Rescue Plan dollars, variety of grant funding, our Community Corrections Act subsidies, some levy dollars, and our strategic priority funding. What's important for you to, what we want to share with you, or what we want you to think about, is that some of these funding streams are temporary. They are, some of them will be ending. We know that our ARPA funding will need to be completed by 2026, December 2026, and our grants have staggered ending dates. But we are not going to sit around and just let this fall off. We are planning for that. And so, as was mentioned earlier, our safety and justice team will connect some of these dots later in the day about how they are looking at sustainability, specifically to the American Rescue Plan, or specifically to our appropriate response initiative. But it's not lost on us with these other programs. How are we going to sustain? So as we look to our 2026, 2027 budget, you will start hearing us talk about this, and we're thinking about it as one of my colleagues calls it a bookend. Right? At the front end of the book, we have the prevention. We want to make sure that if you don't need to enter our system, you're not even coming through the door. But should you come through the door, we are going to support you in the middle with getting the right services at the right time in the right place, so that at the end, if you do have to come through the middle, through the end of our service delivery models that we offer, that we're also supporting you along that continuum. So we're not just looking at it in a silo again, and we're working together. And so we are going to move from our strategic priority and funding our American Rescue Act, and really looking at that sustainability, which you will be hearing more about in the near future. We want to make time for our next priority. So one moment while we transition.
And while they're transitioning, Madam Chair, so you can transition, I just want to remind this board, because I'm so passionate about this, is that the Community Corrections Act subsidy is a state-funded. We need money from the state, and we were deliberate about combining the 3 probation systems into one formula, and then we needed the formula to be fully funded, and it did not get fully funded. So we are fighting for fully funding the formula so that we get the Community Corrections Act subsidy from the state that we need to do this really important work. So when we vote at AMC, and this is always a big high priority for AMC, but when we're voting on these in our District 10 meetings on our priorities, probation funding is a really big deal, and that is the Community Corrections Act subsidy. And we need that formula to be fully funded. So and we are talking about that all the time at AMC Public Safety, but I just want this board to remember that, and I know our government relations team knows this, that we need that funding formula to be fully funded, and I talked to the commissioner last week about that. So,
thank you.
Anyway, good work.
And we'll turn it over to you.
Good morning, Chair Reinhardt, Commissioners, County Manager Becker. Our second strategic priority that we're focusing on is...
Introduce yourselves.
Oh, I'm sorry. I'm Dana DeMaster. I'm the Director of Innovation and Strategy.
I'm Carissa Dillon, Planning Manager for Health and Wellness Service Team and the Food Security Coordinator.
Thank you.
You're welcome. So the second strategic priority we're focusing on is advancing a holistic approach to families. Historically, and I think where some of this particular strategic priority is coming from, is that when people reach out to the county with a need, where they come through or who the first person or the program that they talk to can determine the other services that they end up receiving. And not necessarily intentionally, but because of the way that our programs are funded and siloed and staff being busy and not necessarily knowing of all the different services that are available, that really determined maybe what someone ended up knowing about or being able to access. And so at the heart of this strategic priority is the idea that families should only need to know their need and not our services. So what do we need to do on the back end so that wherever a family shows up at our door, whatever door that is, they're getting that array of services that they want and are eligible for. Also at the heart of this strategic priority is the idea of an entire family, right? Again, if someone came in and it was the mom coming in and she had these things going on, what about her partner? What about other children in the family? Maybe she's supporting an elder in her in her household. And so being able to look at that whole family need, because we all know from our own families that if one person is not doing well, it impacts the whole family system. And so how do we be aware of that, and how do we treat families holistically?
I would like to just note from that respect, a long time ago, the All Children Excel program, that was the model. It's the whole family. You've got one person, in this case it was for younger folks from, I'm trying to think, 6 to 10, I think it was, something like that. Anyhow, I should know it because I brought it forward. But regardless, the idea was, what's going on for mom? What's going on for dad? Are they incarcerated? I mean, the parents and the siblings and everyone. And so when services were provided, they were provided specifically to the child, but also if mom needed mental health services, they got it. And so this model is something that I think it's taken a long time to get us there, to really look at it as far as what do the members need, what do the family members need? Because if you've got a parent, especially that is incarcerated, the needs of that family are going to be very different than another where you've got the family intact, but it's not working the way it should and understanding what services are needed. Oftentimes that's the case. You know what? The child needs mental health services. The sibling needs chemical dependency services. Whatever it is, that you can deal with that so that it takes that stress off of the family. And so this is the approach that is harder to do because you're not just dealing with one person, but it's where we're really going to make progress. And I love the bookend, where you start when you open the book and going through it. And I think I was looking at Commissioner Moran, although she didn't know that, because I thought about all of the things that you've talked about as far as families, but also trying to, it's not about it's about punishment in some ways, but the justice system is really about making sure that it doesn't happen again. That you're giving the services that they need, and trying to help so that when they're not in jail anymore, if they end up in that system, obviously, that they've got the support that they need to be successful. So if it was only about punishment and you would expect a different result coming out than when they came in, you're being foolish, because it's not going to happen. There's reasons, and we need to figure out what those are and deal with those. So I am thrilled with the fact that we are truly looking at this in a holistic approach, even though I know that it's more difficult. But the outcomes are so much better for for that family, sure, but for entire community.
Thank you, Chair Reinhardt. And there are many places in the county where this work has long been happening. Not only the program you mentioned, but I think about FAST in Workforce Solutions, the CCBHC, the Community Behavioral Health Clinic and Social Services, Public Health Home Visiting. So this isn't new, and we're definitely building on the lessons learned and experiences of all of our colleagues in other areas in the county. We have 3 measures for a holistic approach that Carissa will be going into in more detail in a moment here. But I want to note that when we think about these measures, they're proxies and they all work together. And so we're looking at a more connected system. And because our system isn't connected yet, and our data systems are not connected yet, we're looking at them individually, but as a whole, right? And so they all should move together, and they're all windows into that house that we're trying to build. So what have we done around holistic approach to families? As I was listening to Ed and Director Thompson talk about their work and the work of the justice transformation, I remember sitting in the early juvenile detention alternatives initiative meetings and some of these, hearing about the revocation challenge when it first started and just feeling about how daunting and huge that felt at the time and how are we ever gonna do this? And now we're how many years later? 8 years later, and it's just the way they do business. It's an accepted thing, and not that there's not areas for improvement, but it's just this is what they do now. And when I look at where we are with holistic families and many of the things we're going to talk to you about today, we're in that spot of where we're listening to community, we're doing research, we're planning, we're doing strategic planning, building up our resources so we can then hopefully do what they did, and in 8 years from now, we'll be looking back, can you ever believe we functioned that way? And so we're definitely in that space, and I'm so excited that we have them that we are one county and we have this experience to draw from in that sense. But in board workshops back in December of 2022 and December of 2023, we presented on the holistic approach to families, both around food and the early childhood initiatives. So we'll give a very high-level, brief summary of some of the work we've done to date. And a lot of it is in that learn, do, act kind of mode, right? Like a lot of small pilots, testing things out. How is this going to look? Does this work for staff? How is community saying? And that's where a lot of the things we have been. We're going to talk about Family Coach, and that grew out of the Race Equity and Community Engagement Response Team during COVID, and the recognition that families were isolated. And how do we provide those coaching services to help families get out of that isolation and be building community, as well as work on their self-defined goals. Previously, we've worked with social services in the Children and Family Services area to partner on a grant with Department of Human Services that led to the creation of a specific kinship unit. We've long tried or focused on having, when a child needed foster care, to have them be with their family, right? But having a dedicated unit with dedicated resources in doing that research to find families, connect with them, and provide the support they need as they become licensed foster parents, as well as connect them to things like early childhood family education and Head Start, and the things where you're suddenly the mom of a toddler or the caregiver of a toddler. What are those things you need to know to be supported, and those early childhood resources? We've also worked with the Minnesota Family Investment Program, MFIP, their young adult program, in looking at what do employment counselors need and what do those young adults need in terms of information and support to get to early childhood resources. And we're very excited that this spring, once our early childhood coordinator actually returns from her own maternity leave, we'll be launching a training with both our contracted and our county employment counselors with ongoing support around connecting families to those resources. And then finally, I'm just going to say a word about human services modernization. We did a board workshop back in February. And I think when you think of that, early childhood or holistic families isn't the first thing that springs to mind. But a lot of the things we've been doing in partnership with our information services are helping us lean into automation and efficiency, rather than placing it solely on now you have this already complicated job, now you have to know all the resources and all of the things we're referring to. How do we lean into that automation? So a lot of the work we're doing there is really taking advantage of technology and retiring some old technology we had that put us in a position to really take off on some of the things Carissa's going to talk about. So I'll hand it over to Carissa to talk about food security, and then we'll get into the measures.
Thank you, Dana. So I wanted to just say why I'm at the table and not that Director Ali or Director Duffy, who runs WIC, is here, is because I'm trying to take, as a planning manager, like a satellite, 5,000 foot to see where the problems are, to create human-centered design and residents experience. Like, how do we get people through the whole system in the best way? The food security strategic plan also is one that I'm really tied to, and is really looking at system-wide solutions and how do we break down our own departments and our own systems. And then I'll also talk a little bit about this, the next slide, and go into our pilot. So back in December, I talked a little bit about this, I talked a bit about this pilot, but this strategic priority within the holistic approach to strengthen families is an extremely important proxy measure of how well we're linking our most vulnerable residents to services. And it involves those who are on medical assistance and also are categorically eligible for WIC because they're either pregnant or have children under 5. The system should be supporting this most vulnerable population because brains are developing, so both pregnant and for young babies and children. And we want to make sure that we can provide the necessary benefits, but also ease of access to these benefits. As you remember, in the board workshop in December, we spoke about the 2 different state agencies that run these different programs, and it's the Department of Human Services and the Minnesota Department of Health, and how Minnesota Benefits, which was a platform that rolled out, is a great comprehensive platform, but never asked about WIC to refer over to WIC. So if you were pregnant or have children under 5, there was no internal referral over to the MDH. So that's where it came to us as a county to start to try to do those co-referrals and co-enrollment in programs where people are categorically eligible. We want to make sure people are linked to these services and actually are aware of them. So you'll see on this slide, so we have some performance measures. So in 2019, 63% of people were co-enrolled. You'll see a slight dip, and now we're at 58%, and we're coming back up after COVID. And this means that the percentage of people that are eligible for WIC, because they're on MA and they're pregnant or have children under 5, are actually enrolled in WIC as well. We know that Ramsey County has the highest WIC enrollments in the state, and we do a really great job of reaching these vulnerable populations, but we still need a systems approach. Our pilot introduced the idea of how we were going to start cross-matching data. We sent postcards to those who may be eligible for WIC because they're on MA and they're pregnant or have children under 5. And then we were doing some follow-up calls. That was extremely staff-heavy to do. The postcards actually are pretty easy once we cross-matched the data, and 17% of those households that received a postcard ended up being on WIC. So it was a nice pilot to see that, but we still need a system-wide approach.
I do have a question regarding funding. We had, trying to think which secretary it was that came in. We went to one of the clinics, and there was funding that obviously was needed. And I don't remember, though, if the funding, the federal funding, if that was authorized for a longer period, or did they just do a short extension?
I believe it was for a longer period. I have to get back for
I think we would be hearing more about it if it was for a short extension.
Yeah, I think it was for the longer period.
Okay, because that was, I know, really critical.
Yes.
I mean, our work would not have been able to continue in the way it had, especially for pregnant women, had that funding not happened. Okay, thank you.
Yeah. So we've done a lot of number crunching.
Oh, excuse me, Commissioner Zhang.
Would you go back to the last slide, the previous slide? Okay, great. So can you also help me to understand these numbers that only 64%, so for the 2023 goals, 58% of the people who are eligible for WIC are enrolled only?
Eligible because they're categorically eligible because they're on MA, and they're either pregnant or have children under 5.
Okay.
And so
Wow.
58% of them are, and that's about
wrote down the number, I actually did the math right before. I think it's about 12,000 people are on WIC and MA.
Okay.
So we're really just pulling out those who are categorically eligible but not enrolled.
Okay.
The number, are you asking a little bit about why the number's at 64% goal
Yeah, well,
ultimately?
and it seems like it's like kind of plateaued, but it also like, I just wanted to like emphasize that there are a ton of people then who aren't taking advantage of WIC.
Exactly.
Yeah.
So I can talk a little bit about that. Is some of our people are aging out. So if children are 4 years old in 6 months, sometimes they just don't want to enroll. Sometimes to actually go into an appointment is a little bit more of a burden than just getting a SNAP card. So there are people that just don't want the services. So I don't think we'll ever reach 100%, but I do think that this is a good stepping stone goal to try to make sure we're supporting our most vulnerable populations. At least get the information to them in that way.
So can you so is everybody on WIC also on MA? Or,
Usually.
Okay, but you can go for WIC without being on MA?
You can, yeah, but I don't have the numbers in front of me, but I can show which ones I can send them to you later. Okay. We are trying to do some more work with the state, both state agencies to do more data sharing. So we're working with our county attorney's office and other people to try to do data management in a little bit easier way so we can kind of cross-share the data.
Okay, thank you. Did that.
Thank you.
Commissioner McGuire.
Thank you, Madam Chair. While we're still on this page, then, I was kind of reading ahead to see if we were going to get any more information on the technological approaches. And maybe you're going to get more into it, but just basically, because we did have a workshop on the need for modernization within our whole system. But is this for Ramsey County, or is it the state also, or is it probably both? I mean, maybe I'm confusing two different things, and I know that Commissioner Fretham is always talking about modernization at all levels, and so just help clarify for me. I'm just curious what we want to do. In fact, I just on an aside, because I was talking to some people who are really concerned about it at a statewide level. They said we think maybe we should just pay Hennepin County to do the whole system because the state's not doing it. And we should just get them to do it. And I was like, well, I'd be okay with that, because it's just taking so long for this system to be workable for all of us. So I'm not saying that that's going to happen, but that was just like, as someone in exasperation said, we need this to be changed. So I'm maybe confusing, state versus county systems, but just give me a little more context, and then we can put it into a longer workshop or something.
Okay, but I am curious, so does Hennepin County have a totally different system? I mean, why would it just be Hennepin County?
Well, because Hennepin, I think, has been working hard on doing better with this, and people happen to know that. I think we heard about it a little bit at our last workshop, that Hennepin County is doing better on this.
That's true.
And we were hoping, I think we were thinking we were on that track as well, and I think we found out that we weren't. And so someone also heard that Hennepin County, and being as big as they are, they said they would have the capacity to do something. But,
okay,
but that's like just an aside. Yes. But I would love to hear Commissioner
So
Fretham.
Hennepin County still uses the state systems we're required to use. The question is, do you build another system that helps you manage and navigate between all of those other systems? You still need to determine eligibility within, say, Maxis or MEC Squared or METS, but you might have another system that helps you track when someone is in one program or another, and manage the verification is a big piece of it, whether your electronic document management system is accessible to workers in all programs. And so it may be that Hennepin has created a better kind of on-top system that helps navigate that, which would make sense. They're much larger than any other county, and they have a higher need to have something like that. So whether, other counties contract with Hennepin to utilize their tech to help navigate internally until there can be improvements with the state, that's very interesting. The state is actively working on updates to systems. And one of the big challenges is that different approaches to how you update technology, and whether a lot of the state systems, you kind of have to do it all at once. So they've been slowly breaking off bits and pieces into newer technology systems using agile methods to, build little pieces to take it out of the older systems and make it more workable. But that also takes a very long time and can be bumpy.
Well, I think when we had the workshop, that one of the things that was discussed there was if it was updating a system, that's one thing, but what seemed to happen was that we had a system and they needed to do some more, so they developed another system to add on to it, and another system. They didn't get rid of what wasn't working.
Nope, those are still there.
Yeah, and that was the problem, because they didn't talk to each other, and so then when we get into it, we have to go to all these different ones. Anyhow, Commissioner
And I know
McGuire.
that they want to respond too, but I just want to say that this also came about because the state did give some money for some modernization. I don't know if I'm using the right word, but the state did give money to the department to do some renovation, some work on this. And then, so the legislature, bless them, said, okay, now we're done. But it totally isn't going to solve the whole problem. So they think they're helping solve the problem when it's a minute amount. It's not enough, and it's not really, we got to really hold them accountable to what they gave a sort of a
I
finite
think it was
number.
50 million that they gave to DHS.
Yeah.
Right, and so that's
Instead of trickling it down to
exactly,
the counties who
right,
need to modernize our
right.
equipment. Yeah.
So, but now,
okay,
we'll let you comment on
Chair
what-
Reinhardt and Commissioner McGuire.
Well, the chair will let you comment.
The first you said this, you said this is confusing or this can be confusing. And yes, this is super confusing. But let me just say first, with this measure, one of the reasons we specifically chose this area for a pilot is because medical assistance is a Department of Human Services program, and WIC is a Department of Public Health program. And so there's the discussion about modernization, and that Commissioner Fretham right on with where things are going and how the approach is. And what Hennepin has done previously doesn't impact WIC. It's a public health program. And so that's a different, when we're talking about silos, we have our silos, the state has their silos. And there are also different data privacy laws that govern who can see these data and when and for what reason. And so sharing these data, there are very narrow parameters in which that is allowed by law. And so not only is it difficult, technically to match, but also it's not difficult legally, but you have to be very careful, and there's only certain circumstances that can happen. And so the modernization that we're working on and the state's working on, when we came and talked to you about CaseWorks for financial assistance services and Northwoods Traverse and electronic case file management for social services, that's what Hennepin has developed on their own and is long used. The majority of other counties use a vendor like CaseWorks or Northwoods Traverse. And so what we're going to talk about on our next slide and what we're doing about this talks about resident relationship management and some of the things. There are still programs that the county runs that are not state programs. And so how do we connect for our residents from a holistic perspective, regardless of what government entity or may not be governing the program above it? And so we're going to talk about some of the solutions and leaning into that automation through eligibility benefits determination and through resident relationship management. And so I hope that addressed your question.
It does, but I do have to note the time here.
Yes,
and we really, and there are a number of strategic priorities that we're going to be going through. So I would ask that we try to hold our questions, but also, if you can speed it up a little bit, that would be helpful. And I know it's our fault. We're slowing you down. So notice I did that two ways here.
Yeah. Thank you. I do want to call out Jeffrey Moss from our IS department that made all these maps for us. He's been excellent. So I'll just say these maps, you'll start to see repeats. About 5 zip codes hold about 40% of those who are not co-enrolled. So we know where we need to focus. Go ahead, next slide. And so I'll talk a little bit about our strategies.
Just a moment.
Sorry, I just wanted to name because this is in my district, that it is very hard to even access the suburban WIC location. I looked on the Metro Transit trip planner, and if you miss the bus, it's going to take an hour for the next bus to take you there. Literally, the trip on the bus is going to be 1 hour just to get from down there to the suburban location. So I just wanted to just share that and name that many folks there are transit dependent, and that could be a barrier. And my other question is, do we have virtual options for the WIC appointments?
During COVID, they were able to do virtual visits, which I believe are still continuing as an option. But they still want people in because they can provide a lot more services and a little bit more personalized approaches.
Okay. Well, and I would just like to note that where there's a transit issue there is purple. And so we have, again, we talked about that earlier, but you need to have a way to get someplace, and especially when you've got, you don't have a car, or, it's just, so you're transit dependent. And there are a lot of people that are transit dependent. Okay.
Thank you. Go ahead, next slide. So I'll talk a little bit about our strategies to increase co-enrollment. So we know that WIC is doing a great job. They work with healthcare centers. They're trying to do some outreach in general. However, we know staffing can't solve this issue alone. And so we are trying to do more staffing, training, and awareness of resources, especially with enterprise and administrative services through our service center navigators and in our food shelves and other areas in the county and staff, but also with outreach. So we have this new pilot that we were working on, and we're trying to build into that a new screening tool. So we're working with a contractor now. It's not signed, but we are trying to determine every program that Ramsey County administers and some screening tools to just give people eligibility, a page where they can go and figure out what they may be eligible for staff and residents. And then we're going to be doing some internal building. So if people are interested in WIC and they may qualify, they will get referred over to WIC to have a phone call. So there's a big hope that we can start to work on trying to inform people and provide an ease of access to reach all the benefits that are possible. And then also, we're trying to do more basic needs addressed in more areas of the county and have more information handed out. And then we talked about the resident relationship management, and a lot of this work is through Residents First, as well as the holistic approach work in alignment. This next measure is really about the percentage of income guidelines or people within income guidelines who receive the SNAP benefit. I'll just say that this is also very imperative to supporting our families and helping people move upward out of poverty and get them to a place of stability to be able to thrive. It's one more step for us to reflect internally on how we're engaging our residents and building our services to be more reflective of their needs. But also these numbers are not absolutes. These are just based on income. There's a lot more factors, so these are all estimates and a proxy measure. So currently, you'll see in 2023, nearly 20% of our residents are on SNAP. And I like to always point this out. So when there's federal policy changes or local implementation changes, how much of our population would be affected. We also see a dip between when they changed in September 2022. Our state of Minnesota actually moved the federal poverty guideline eligibility up to 200% instead of 165%. So you'll see a dip between 2022 and 2023 measures. And overall, we're hoping with our outreach and alignment with our financial assistance services planner, as well as within our Residents First and enterprise administrative services, we're trying to align to provide potentially more staffing, provide more information to all people at all access points in the county, as well as put pressure on I guess I'm jumping ahead. If you want to go to the next slide, we are also looking at doing some really targeted focus groups in certain communities to find out why there are some barriers to accessing SNAP. There's some direct things we can do to focus on certain populations to help improve their eligibility and getting them enrolled. Go ahead, next slide. Again, a mapping to show where we're working in our communities. Very similar maps to the MA and WIC enrollment. And then the next slide. And then I'll quickly go through our outreach strategies, which I started to talk about. But we are partnering across the county. You'll see that we are doing some food bag distributions, and there's going to be a lot of links to services, so it's kind of an entry point. We're working really closely within our food shelf systems because that tends to be an entry point in other social services organizations. Again, training staff, talking about what kind of benefits they can help encourage our residents to apply for. And then again, trying to work on that eligibility screening tool. Another big part of what I've been working on is trying to encourage the Department of Human Services to align in a different way so that we can meet people when they're coming out of our correctional facilities. So when we are trying to work with our SNAP grantees, outreach grantees, which are external entities that receive funding to help people enroll in SNAP, how can we do some innovative strategies to get people kind of quickly enrolled into SNAP? And then again, really working on the database and the systems. I know I was flying through, so please let me know if you have questions.
For SNAP, is there outreach with the schools too? I feel like in St. Paul Public School, like we're always like forced to fill out not forced, but then they encourage everyone to fill out the forms, right, about eligibility for free and reduced lunch. Even though it is free now, they still encourage everyone to fill it out. You know.
Absolutely. The more students that fill it out will help take off the burden of the state paying for it and go back to the feds. So we definitely want to encourage more people to apply. But yes, there is a lot of alignment of trying to get, and that comes through the Minnesota Department of Education, which we haven't even talked about today, of making sure all the state agencies are talking and cross-enrolling and referring. But we are working with the schools and other big institutions as well.
Okay, great. Thank you.
Thank you. Okay, our final measure is the number of families who receive family coaching services. Right now, we're serving about 80 families, and we've talked a lot about family coach to this board, so in the interest of time, I won't go too much into what it is, but we're currently working with two agencies that primarily serve American Indians. That's the American Indian Family Center and the American Indian Montessori, and then Family Values for Life, which is focused on the African American community. When we're serving a family, it's a really flexible thing. This is meant to be driven by the family, and so it's not a strict, you're enrolled, not enrolled, but in terms of like what they're reporting to us, these are people the coaches feel are actively engaged, versus someone might come back kind of in and out of services, might be fine for a few months or not want the help and then come back. So these are families that are actively engaged. And by 2027, we'd like to double that number. So that's our goal, is to go from this kind of, we've been at this spot where we're stable, right? We started it, we got stable, and now we're looking to grow. Next slide, Alex.
Could you, on this slide, it's going to help to know what the universe is. That doesn't, I mean, I love the goal and doubling it, but I don't know.
The universe,
I can't put it into context.
Oh, I'm sorry, Chair Reinhardt. This isn't a percentage, this is the number. And so the universe of potential families to be served could be every African American family or every American Indian family in the county, but I don't know that that's what we've been aiming for. And so there isn't really a denominator in this sense. This is just where we've had the capacity.
Okay, so as we can to grow that, to provide more services, takes pressure off the rest of the system, or deeper end services. Okay.
I know.
Just a second. Okay,
I
I'll
know
go
we're
with
trying
Commissioner
not to ask
McGuire and then
questions,
Deputy
but
County Manager.
If this is too long, just put it off. The funding for this, was this an ARPA funding that we started with, or no? And then we're just continuing to budget for it now, right?
Chair Reinhardt and Commissioner McGuire, we're going to go into funding and how it's being served on a future slide. It has been partially ARPA and partially strategic priorities.
Yeah, great.
Okay, Deputy County Manager
Madam
Kutza.
Chair, Commissioners, thank you for that question. Yes, some of these, like this is what I think of as more of a pilot. How are we working on this? How does this impact when you're thinking forward? And we do have a little bit of time. I don't think we're getting towards the end of our slides here. But when you think forward is things like some of the work that Jen mentioned about ARI and how is that working. This is similar as like we're trying to see how this works, what works for families, what works for our community, and then think through that as we go into the 26, 27 and beyond budget of how those things become operationalized in our work because they reflect how we should be serving families moving forward.
Well, and it is very difficult to make that transition because the reality is not only are we going to be helping families and better citizens and contributors to the community, but ultimately we're also going to save money.
Mm-hmm.
Because if you don't have to do the deep end services, if you don't have somebody going back into jail, if you don't have someone reoffending or they're not taking drugs, I mean, all the different things that the holistic approach does ultimately saves money, but that's hard to measure.
Madam Chair, Commissioners, I like to think of it as shifting resources to prevent people from, I mean, also the CFO here, so always love to save money. But in this particular case, I think of it as shifting resources to where we want to be with people. The goal isn't necessarily to save money. The goal is to make sure we're spending our resources to keep people out of systems that are on the deeper end that, as we talked about previously when Commissioner Moran asked, like those have significant consequences for not only the individual, but for the family and the community. And so to shift that to we talked about the bookends to the front end of that is definitely a goal.
And I'm not saying that it's about the money, but I have stated that there are policymakers that make decisions based on what's the right thing to do and others that base it on totally how much is it going to cost. And what we have to do is bring it to the middle.
Yep.
How does it work? But when you're making a change like this, just as in juvenile crime prevention and other things, there's an overlap period where it costs more because this costs more, but ultimately it will improve people's lives, we'll have the benefits of that, and it will save money.
Yep.
So the positives are far outweigh the short period of time or whatever period of time that is, because you can't just say, well, we're not going to give the deep end services because we're going to move resources. Well, you still have to have those until you don't need them as much. So it's that in-between time that is the most difficult, I think, as far as funding. So the pilot project, and that does make sense. It's about ramping it up, but you've got to get it right before you can ramp it up. Okay.
Thank you, Chair Reinhardt, and that's exactly where we're going. And so we're going to get it right before we ramp it up. And so this year, our strategies to increase that family coaching programming going into the next budget really focuses on one, program evaluation, and understanding the outcomes, understanding what works for the families, how this impacts their lives, but also we're very cognizant that we're working with very small community organizations. And so the American Indian Montessori and Family Values for Life, they're partners in this, as well as the American Indian Family Center. And so we want to make sure we're understanding their experience and what they need to sustainably provide these services and grow themselves. And so what is the capacity building that we can partner on in those spaces? As well as we're looking at doing what I'm calling a smart growth plan. And so it's really reflecting on and not just reflecting, but doing the research, doing the interviewing, looking at the numbers about how do we grow in a way that's sustainable for us as a county, as well as for the organizations that we're partnering with. Which additional organizations or what populations should we be serving that we're not already serving? And so, we're thinking about, we've focused on African American and American Indian families, but where are those other areas that it makes sense to grow next? In talking with our family coaches and talking with these organizations, there's a time that really a family is ready for this. And it's not when they're in crisis.
Right.
It's oftentimes at transition points. And so while a family's in transitional housing but is stable, while someone's exiting the Ramsey County Correctional Facility, while their children are starting school, as they're coming into, their children are coming into high school, what are those transition points at which someone becomes reflective and is seeking to make changes in their lives. It just needs a good partner to help them get there. And so really thinking through that smart growth about where should we be, what communities or folks should we be focusing on, and then what organizations do we need to partner with to get there? And then how do we sustain the work? And so thinking really carefully about how do we integrate this into a department that's actually a service providing department. It's currently sitting with me. And we're an administrative department. And so that will be, where does it live long term, and what does that look like to sustain it?
County Manager Becker.
Yeah, thank you, Dana, for the information here. I do think that's exactly where we need to go next. I mean, where you're seeding something like this innovation, it can translate into, like in the Workforce Solutions, our MFIP RFP, as to an additive, a component that we should highly consider putting into, like a next model, right? So as you were talking about the whole ecosystem of all the families that maybe are Black or Native American, like we serve those in our systems. And we can take this model into existing programs and reprioritize maybe funding into different components of those programs to ensure that we're putting in things that we know are more innovative and have been community driven. So I do think this is not a standalone. This has to get more operationalized as you guys continue to work on that. So I do think that this is exactly where we need to go with it. So
Chair Reinhardt, County Manager Becker, absolutely. And I do want to note that the American Indian Family Center is currently supported through public health, and there's the other two that are through innovation and strategy. And so where does this live long term? And really being thoughtful and careful with that. Finally,
Moran.
oh, please.
Commissioner Moran.
Are we breaking at 12?
Yes.
Okay, I better get it in. All right, so I'm just going to throw this out here for us to just think about this. Because I've been hearing from a few people about, we talked about Hennepin County and the work they're doing in Hennepin County that is a little bit forward than we are. But they also purchased a building, a CVS. And so I've heard several people come to me and said, there's an empty building sitting on University and Snelling, the CVS building. And that maybe, I know I've heard some other conversation about real estate and what we're going to do and not do. But that is sitting there vacant. And I look at this because I experienced the system myself, right? And when I showed up for something, it was like, we give you this, but you need to go here, here, and here to get this, that, and the other. And looking at that location is like a one-stop location. Whether we are doing SNAP, WIC, FAS, support services, probation officers are there, family coaching, looking at this holistic approach. It is on a major street with transportation in all four directions. It is in an area that is high poverty level, it just has so many purposes as a location. Because what we have is people who need services going to 20 different spaces to try to get services. And they have to, often they are transit dependent, trying to get there. Often they are moving with children to get to where they need to get. And so I just wanted to put this out in the environment, because I had the opportunity to meet our former county manager at the Jazz Fest on Saturday, and had this conversation with Ryan. And one of the things that he shared with me is that currently the CVS is owned by CVS, the corporate location. But there is so much going on at that corner that we need to address. And I think it's another part of what we have to do is to come together and put some pressure on that corporation to do the right thing, find what they're going to do with that building, or sell it, so that we can see better outcomes on that corner. And so, I think the corporate CVS has a role, the city of St. Paul has a role, Ramsey County have a role. I think there's many, many entities come together and say, how can we put residents first? And what do that look like on that corner where there's a huge building just sitting there that can be really transformed into something that can serve community, families, and revitalize an area that right now, I'm sure the owner of the soccer stadium can see some value in us doing something too in partnership with him, as he's looking at the whole corner from Snelling to 3 or 4 blocks up of how he's going to revitalize that area. And so I just wanted to put that out in the environment as we're being creative, innovative, as we're thinking things through. There's something right there that could have a possibility of helping support the needs here in Ramsey County and St. Paul.
Okay, it is almost noon right now, and this is a big conversation, but I do want to add on to it actually, because at your first community conversation, it wasn't specifically about CVS, but that there are buildings that could be utilized that are empty.
Yes.
Some of them even tax forfeited, so, some of them public buildings that aren't being utilized fully. So, but this one is a very specific example, and I think the whole point here is that you get the services out into the community. It hasn't been that long that we've had service centers. And so that's something and we know it works. So trying to figure out what those locations are, especially in the areas where the highest need is a conversation that needs to take place.
I would love to say one thing about that, if that's okay.
Okay.
I think this is all a part of the ongoing conversation around our residents first strategic priority, Commissioner Moran. And there's an opportunity around our community-based sites that oftentimes we don't have to own or operate that building, but we're a good partner in those spaces. Along University, I know we're already at Keystone. We've been in conversations with Rondo Library. So it's an opportunity for us as we continue to work on that strategic priority in kind of a next phase as to think about in what spaces do we sort of, actually own that, if that's a service center, and other places where we're a partner and we can be there with resources. So thank you.
Okay. Deputy County Manager Kutze, you had your hand up for a long, okay. We got it covered?
Yep.
Okay. We need to move on because we are at noon. We're going to go a little bit, but not much over.
Our current funding for holistic approach to families, we have American Rescue Plan Act dollars, strategic priority funding from 3 different strategic priorities at different points in time, holistic approach, residents first, and intergenerational wealth, thanks to Workforce Solutions. We are using county levy primarily for staff salaries, and then we've also received community engagement funding for our community engagement work. So really, I think as noted earlier, these are all one time, they're special. We've had philanthropic dollars and grants from the state in the past. And so when we're thinking about our strategies going into the 26-27 budget, it is how do we start operationalizing these things? How do we make it sustainable? Planning for when these one-time dollars are no longer available. With the strategic priority dollars, it's really seed money, it's innovation money. And so how do we move that into operating? Really working on that strategic planning and coordination function that comes out of innovation and strategy. So how do we support the departments in this work and be that strategic partner, that accountability partner, and help them move this work along? And build on that coordination function of folks like Carissa and some of the other coordinator roles to really tie those strategic priorities to the core work of the departments. And that's a large part of it too, is how do we do our core functions better and excellently while weaving in those strategic priorities. And so that's where we're thinking and where the frame we're coming from on this is when I said at the beginning, sitting in those early JDAI meetings, that revocation challenge, and we're doing that listening and learning right now, right? And we're doing that planning. And so now is the time where we're gonna start all that action. And move to the next slide, Alex. We've referenced maps a lot, but I think they're more powerful when they're next to each other. And whenever you look at these maps, they're all the same map. Whether it's climate vulnerability, whether it's who doesn't have health insurance, whether it's transit access, whether it's people in poverty or people on probation, or even which alleys get plowed in St. Paul. It's all the same map. And so that is just to say that this is systems change that has to happen at a systems level. It's not about Family Coach, it's not about WIC, it's not about MA, it's not about any of those things. It's about how do we change ourselves to be more responsive and to meet the needs of these communities, which overall benefits everybody. And so really, I mean, our last slide before I turn it over to Alex is just really thinking about those fundamental shifts that corrections already did, right? Those fundamental shifts in how we provide services to families, and so that we can really get and change that map. And so when people come to me and they're like, oh, can I get a map of this? I'm like, no, because this hasn't changed. It's the same time as last time I made you that map. And so how do we get to a point where we can say, yes, it's different now? And so that's where we're trying to go, and we're laying the groundwork for that shift. So I want to turn it over to Alex and any questions you all have.
Just to close out, thank you, Madam Chair. Thank you for commissioners and to the entire team for doing all this work today. I just want to close by kind of highlighting, as you've watched this presentation today, we're really thinking about the entire continuum of care and services that we provide from the front end to the back end and from prevention to deep end, and so supporting the people through all of that in partnership with the other service teams and across Ramsey County. I think you saw that, we're thinking about entire families, everything from how do they get involved in SNAP, how do they get involved in WIC, how maybe they're the right people for Family Coach, and also how do we support people who are already in our system and making it not worse than it already is, harm reduction, and thinking about those families as well. So this is a slice of our work, and it's really important work. I also encourage you to look at our open data portal. We have a lot of things that we're doing. This team is impressive, and they're doing a lot of different things in that same vein. So I appreciate your time today and the extra time at the end.
Okay, I'm going to go very quickly through the things that we need to follow up on. And I'm sure Lydia's looking over here, but how can she possibly read this? Sometimes I have a little trouble with that. Okay, so the appropriate response initiative. That was the first thing that we had a number of questions on. The roles and responsibilities between public health response and the mental health crisis team, and how they differ, and just getting an overview of that, knowing that there will be a workshop on that, but still getting some of that basic information is going to be important. Regarding revocations, we need a denominator there. The numbers on probation and the level of felony and the level of probation and how all of those fit into it. But we do need to know the numbers themselves or the percentages don't tell us what the universe is. So just getting a denominator there. Also in the by race information that we had. Specifically called out the 18 to 24-year-olds because there's more funding and different things going on there, and I think it's good to break that out between them. The transfer policy specifically related to Hennepin and Ramsey counties. The MA and WIC numbers. So if you're on MA and WIC and where are we missing folks? And I know the map that they had just gave us that information. And then finally, the residents first and being a partner. The CVS was given as an opportunity. I was going to say example, but it's an opportunity. And so that's not part of what we're adopting in our budget, our supplemental budget, but it is something that I didn't want to lose. And so looking at, okay, that happens to be one that is available. It's an opportunity right now. But how do we do more of that within the community so that the services are provided locally, especially for those that are transit dependent? And with that, we are recessed.
Wow. Thank you all.
Okay. We're done. Hearing at 5 o'clock today, so hopefully we won't run this right up until 5 o'clock because having a little decompression time doesn't hurt anything as we're moving forward. So I'll get my comments here. So I just want to do a few just opening remarks. I try to do this at the beginning of sessions, and anyhow, so that we can move forward. So this is the budget, the supplemental budget that's being presented today was presented to the county board on August 27th, and we had a review of that. That's when we kicked it off. The supplemental budget and performance measures process. Now, our budget process is a biennial process to be more in line with the state legislature, and in the first year we focus primarily on the funding aspects of it. As the following year, which is this year of the 2-year budget, we focus primarily on the performance measures. So what happens with the funding that we have allocated? What are the outcomes? Did they work? If they didn't, what do we need to change? And so we're moving forward on that, and just wanted people, especially those that are listening, to hear what this basic process is about. So today we are excited. We already heard from the Health and Wellness Service team this morning. This afternoon we've got Safety and Justice Service team first, and then the County Attorney's Office and the County Sheriff. And so we will just go ahead and take a deeper dive into the performance measures of the organization, the service team level, and move forward with our budget process.
Great.
Thank you. Welcome.
Great, thank you. Thank you, Madam
wait,
Chair.
Just one moment. I do want to do introductions around the table.
Okay.
So we'll start over there.
Good afternoon, Susan Earl, she, her pronouns, interim CFO for the county.
Larry Timmerman, Performance Planning Manager, Policy and Planning.
Rafael Ortega, Commissioner of District 5.
Mary Jo McGuire, Commissioner, District 2.
Mai Chang Jean, Commissioner for District 6. I use she, her pronouns.
Ling Becker, County Manager.
Victoria Reinhardt, County Commissioner, District 7. I chair the county board, and I also chair the budget committee.
Lydia Gurma, Interim Policy and Planning Director.
Rena Moran, Ramsey County Commissioner, District 4, Vice Chair of the Budget Committee.
Nicole Fretham, Ramsey County Commissioner, District 1, she, her.
Joanna Berg, Deputy County Manager, Organizational Alignment.
Gloria Reyes, Deputy County Manager for Safety and Justice Service Team.
Richard Stevens, Planner for the Safety and Justice Service Team, and also the PMAT Lead.
Great. Okay, and as people come up, we would ask them to introduce themselves, and we will get started. I'll
Great.
turn it over to you.
Thank you, Madam Chair, Commissioners, and County Manager Becker for this opportunity to share our Safety and Justice Service Team performance measures. Again, my name is Gloria Reyes, Deputy County Manager for Safety and Justice Service Team. As I move into my 4th month as Deputy County Manager for Safety and Justice Service Team, I want to express my gratitude for the support from the Ramsey County team, and just extreme gratitude for the support and welcoming environment that I have been giving. A special thanks to our service team, Richard Stevens, Holly Pratt, Kay Ward for preparing me, and the Safety and Justice Service team for our presentation today. So as the chair mentioned, this is our agenda. We will do our service team performance measures, move over, start with the county attorney's office, and then move to the sheriff's department. As I mentioned, although here at Ramsey County for a short time, I have spent my days visiting the Safety and Justice Service Team departments that include the Sheriff's Department, County Attorney's Office, Emergency Communication Center, Medical Examiner's Office, and Emergency Management. Also learning about all the innovative work around justice transformation, meeting with staff, and attending community events. Every space and individuals that I have met are amazing, dedicated public servants who strive to serve our residents well. The Safety and Justice Service Team are excited to deliver our performance measures that are in alignment with our county strategic priorities. Talent, attraction, retention, and promotion, and putting well-being and county and community at the center of justice system transformation are the strategic priorities focused on enhancing the well-being of Ramsey County residents through effective public safety and justice services that keep Ramsey County residents and visitors safe. We are at a critical time in Ramsey County
Excuse me. I'm going to
sorry, go
interrupt you
ahead.
because you need to move the slides forward.
Oh,
One more.
no, this is my opening comments.
Oh, you aren't doing the service team description?
I will be getting there, yep. I'm doing the service.
Okay.
Yep.
Sorry.
No problem. We are at a critical time in Ramsey County where talent, retention, and promotion are essential to ensure that our public safety agencies are reflective of the residents they serve, and an acknowledgement that new talent often brings fresh perspectives and ideas. Fostering a culture of innovation and adaptability in a rapidly changing environment while keeping the expertise in the public safety fields are also critical. While managing the challenges of a competitive market and recruitment challenges in the public safety fields, our team is focused on ways to respond to those challenges that involve developing community partnerships, community engagement, and striving to provide staff with competitive salaries. You will hear the many innovative ways our team is striving to meet our strategic goals around talent, attraction, retention, and promotion. Putting well-being and community at the center of justice system transformation is another key strategic priority. We know that addressing the root causes of crime leads to more sustainable solutions, focusing on social determinants of health, and providing supportive services can prevent crime. Trust and legitimacy is also an important component. When communities see that the justice system prioritizes well-being, trust in the system increases, leading to better outcomes. The Safety and Justice Service Team, working closely with the Health and Wellness Service Team, are working on several initiatives that align with this priority. With support of ARPA funds, grants, collaboration with other service teams, and levy, much work is occurring in justice transformation. We have established strong partnerships with the community, co-designing initiatives such as our Appropriate Response Initiative, bail reform, youth and adult justice transformation. Decreasing jail population are some of the initiatives you will hear about today. Our investments on innovative strategies that transform our justice systems require sustainable solutions that include budget sustainability, consistent evaluation of data, metrics to determine if what we are doing is working, evaluating and aligning institutional practices, policies, and procedures that will reimagine our approach to transformative justice. I was fortunate enough to attend the recent NACO conference. I attended the MacArthur Foundation Safety and Justice Challenge and Youth Justice System Transformation sessions. In both sessions, counties shared their ability to utilize one-time funding to initiate many innovative solutions, making significant impact on outcomes to public safety and justice transformation. However, a theme throughout the table discussions were how counties and their communities are able to sustain this work. In 2025, our Safety and Justice Administration team will begin strategic planning sessions, quality improvement processes, and strategic budgeting focused on our justice system transformation teams to ensure sustainability while also ensuring that we can continue to operationalize the work so that we are not reliant solely on one-time funding and develop a sustainable roadmap. Next slide. So I went through this slide pretty quick. Service team description. I went through that slide. Next slide. I want to acknowledge our service team leadership today. You'll hear from our Ramsey County Attorney, John Choi, our Ramsey County Sheriff, Bob Fletcher. Director of Emergency Communications, Nancy Pass, will not be present here today, but we will have, Laura Espy will be coming up and presenting appropriate response. Director of Emergency Management and Homeland Security, Judd, and sorry, I'm out of place here. Judd Freed and Dr. Kelly Mills from the Ramsey County Medical Examiner's Office, Holly Pratt, our controller, and Richard Stevens sitting next to me. So these three are our performance measures. We will be focusing on turnover rate. We will also focus on transferred calls for service and reduce the number of pretrial days. Our turnover rate, the turnover rate is a critical indicator of organizational health, stability, and efficiency. Through monitoring and managing turnover effectively, we can enhance operational continuity, maintain service excellence, and foster employee morale. This aligns with our strategic priority, aligns with talent, attraction, and retention, and promotion. Next, transferred calls for service is our second performance measure. Transferring calls for service through appropriate response is critical to reducing criminalization of calls that involve mental health and social issues or crisis. Appropriate response seeks to address underlying issues through supportive interventions rather than punitive measures, reducing the likelihood of arrest. Appropriate response represents a proactive shift towards a more holistic, compassionate, and community-centered approach and justice transformation. This performance measure aligns with our putting well-being and community at the center of justice system transformation. Our third performance measure is reducing the number of pretrial days in the Adult Detention Center. Lengthy pretrial detention can result in individuals spending extended periods of time in jail before their guilt of innocence is determined. This can have a significant impact on the lives, such as job loss. Reducing pretrial days, individuals are likely to face undue hardship. Are less likely to face undue hardship. Shortening pretrial days brings us cost savings, as it costs us over $200 a day to keep an individual in jail detention. This aligns with our full performance, reducing the number of pretrial days in adult detention center, and it aligns with our well-being and community at the center of justice system transformation.
I do have a question on that one.
Sure.
Reducing
we'll be going through these in detail as, yeah.
Okay, well, I'll still ask the question now, and you
Sure.
can answer it then if you'd like. Reducing the number of pretrial days, isn't that actually in the judiciary? I mean, we don't have a control over releasing someone without, or how long they're there, do we? I'm just trying to figure out, of these, basically it's a question for all of these, how much control do we have over it? In some of our other areas at the county, we have a lot of control over who comes in and who doesn't. It's on, so don't worry about that. I know you're having trouble with that. So I'm just trying to figure out what we actually have control over.
So once we get to the performance measures, we will outline the items that we can control.
Okay,
The
thank you.
pretrial process that we can't control.
Okay.
So as I mentioned, diverse and inclusive workforce that reflects the communities we serve is essential in building trust, particularly in public safety fields. Retention is critically important and directly impacts an organization's stability, performance, and overall organizational success. So here is our performance measure for our turnover rate. So as you see on the screen here, this is the percentage of turnover rate, and this is for the entire service team. The Safety and Justice Service Team consists of 906 employees, which represents 24% of the county's workforce. 53% of the safety and justice positions are in the law enforcement protective service field. And new hires for the service team, the Safety and Justice had 111 of the 406 new hires at Ramsey County, which is about 23%. Safety and Justice had, 50% of the new hires in Safety and Justice were racially and ethnically diverse employees. Also, the separations within our service team, Safety and Justice had 121 of 510 separations within Ramsey County. The service team overall turnover rate for 2023 was 24%. 46% of the separations in Safety and Justice were racially and ethnically diverse employees. Promotions. Safety and Justice led 58 of the 239 promotions of Ramsey County, at Ramsey County, so about 24%. And 41% of the promotions in Safety and Justice were racially and ethnically diverse employees. So,
were there any questions on the first measure?
any questions on
Commissioner
the
Frethel?
data itself, and then we're going to move on to the strategies to
Commissioner
improve
Frethel.
performance? Go ahead.
Yeah. So, I mean, we talked a bit yesterday on recruitment and the need for additional HR capacity to be supporting departments in that recruitment. So I just want to emphasize that I think that's something that should be done at an organizational level. We should have the appropriate staffing in HR so that we can be reaching out. I guess, and this is, it's always a challenge to look at, well, what data do we have that can help us find problems, and what is the data telling us? And it's really hard to say what the data is telling us here, because we don't know if these are, if the turnover is, voluntary or involuntary separation. And we don't know where folks are going after that. It could be that we are doing a good job of recruiting and onboarding and training new employees who are people of color, and they are then using that opportunity to launch into higher paying jobs in other organizations or in another field. And awesome, that supports intergenerational prosperity if that's what we're doing. Or it could be that we have not reconciled our internal cultures and climates, and folks don't feel comfortable and supported in these spaces. And this data doesn't tell us anything about it. And I know that we may not have that. So just reiterating that it's really hard to base performance measures tying that to data when we're not even really sure like what it would mean if we reach these goals. Right? If we lower the turnover for Black and Hispanic employees, does that mean that we're supporting them better and they're wanting to stay here, or they're not getting opportunities to move to better paying jobs in other locations? And so it's just knowing that there's probably nothing you can do about it, but continuing to push for all of us as we think about these performance measures to what does this data actually tell us, and how do we keep digging to get more useful information? Because sometimes it's just the data just says there's something different, there's a disparity, what's that about? And we need to be curious about it rather than saying let's close the disparity, because we don't really know what it's about. Maybe it's a good thing and folks are getting better jobs. And so and maybe it's not, they're obvious, where there's smoke, there's fire. It could be something else. But understanding what is driving the disparity is going to help us address it, which then would help us reach our goals. And I don't know that I see anything here that tells us why is there a difference.
Yeah, exactly. I think the last thing on the next slide here, is we want to explore the usage of exit surveys. And having the support of HR to do those, right? To really gain an understanding and really provide a narrative of what is really occurring in our environment, to ensure that we are tracking trends throughout our departments within the Safety and Justice Service team, that will really tell the story of what's going on, and rather than just the percentages and the numerical. And so, yeah, totally, I agree that we needed to do better to tell the story of what's going on.
So as a follow-up actually to Commissioner Fretham, so we are doing these things right now, correct?
Except that the last one, we want to explore the usage of exit surveys. We don't do those right now, from my understanding.
So that's a big part of what you were asking for, Commissioner Fretham.
Yeah.
But I do think that, going back to the other slide, please. I think that even the information that you have right now would help this slide make more sense to us, because it doesn't, honestly, it doesn't, to me anyhow, it's hard to understand how it's relevant, because if you just set a goal, we don't have anything about the diversity in our population and so forth. And so to do a straight goal of 10% in all categories, I don't know how that really helps. And this is just turnover rate, I get that. But if you have, I don't understand how it can just be a straight 10% on each of them. It's difficult to see. I do not see the story in this slide.
Mm-hmm.
So, Commissioner Zhang, maybe you can help her.
Yeah,
you have more questions.
Yeah, that's what I'm trying to help understand too, is in my reading of this, is that we're breaking down the turnover rates by race. And so the disparity may actually exist if, so say for example in 2019, white was only 6%, but then Asians were 13%. That's the disparity, that gap between the 6% and the 13%. And so that's why your goal is trying to like make it same across. Is that it? All right, great. I'm glad we're on that point. So my next point is this 46% of separations in safety and justice were racially and ethnically diverse employees. I would say like what would help even more is just by departments, because you know it's a big service team as well. There are many departments, and I was just looking at the other departments, their demographics, and the BIPOC population is just about 30%. Oh, BIPOC percentage is about 30% who identify as BIPOC. So I would say that's alarming. That is alarming, because your workforces that are diverse are about like 35%, but then separation rate is 46% among them that identify as people of color. So that's alarming.
Commissioner Frother.
Yeah, and I think that's the question. I think the idea that there shouldn't be disparities in turnover rate, right? And that's where the 10% comes from, that there shouldn't be a disparity. But until we know what's causing that disparity, right, there's a lot, but we don't know the reasons for it. And so I think it may be possible to break this down into data about voluntary and involuntary, and I think that might be useful into understanding what might be driving some of this turnover. But I think for sure exit surveys would be really important so that we can identify the reasons for leaving. If it is some internal culture, if it is, sometimes you can look at, where are the turnovers happening. A lot of people, the reason why they leave a job is generally because of their supervisor. If they don't have as long as everything else is going well, if they're like, I got to get out of here, it's probably their supervisors. So are there supervisors that need more training in how to supervise staff so that we're not losing people? And I say that as someone who is a supervisor, so it's not like anti-supervisor. And we already know I've lost 3 aides. One came back though. See, it's not me. But all the people who have left my area have left for better jobs, right? Everyone that's left me, and that's what I want for them. When I bring people on, my goal is to, I want them to work for me and do well, but I want them to go on and do even better things. That's what I like. And so it's unclear from this where that disparity is, which is what I was saying. And how do we know that the work that we're doing to, eliminate disparities in turnover is the right work? Well, we don't know that unless we have more information.
Commissioner
Thank you for that. I think that really splitting this up by departments, even more so to get sort of a feel of what is going on within those departments is also important. I think just telling the numbers is what we have is really the beginning, right? We have to really dig down deeper on, again, telling the narrative, really figuring out what the trends are within the different departments. And we have to have the tools within HR to really help support not only the Safety and Justice Service team, but other departments across the county. But many great things are happening right now to really help and strategize around what we have going, what is occurring. We have proactive outreach and recruitment with community partners that focuses on creating a workforce that looks like the communities that we serve. We are creating pathways for career development and advancement, increasing staff development with a focus on leadership skills, employee wellness and cultural sensitivity, and we have ongoing mentorship programs. Some examples are, the Ramsey County Attorney's Office has a law clerk and college internship opportunity to grow our own workforce and law clerk recruitment receptions designed to welcome students of color. We have the Emergency Communications Center, who is doing targeted recruitment events within Ramsey communities. We have Ramsey County Sheriff's Office, who has expanded their employee wellness program to support staff and law enforcement officers to ensure that they are taking care of themselves and being able to retain the officers that we do have. Department leadership continues to support staff development and offer different training opportunities. So, and we'll continue to focus on leadership skills using the Ramsey County Leadership Academy. So those are just some of the things that we're currently doing.
Commissioner
and
Moran.
so there's a question, yep.
Thank you, Madam Chair. Yeah, so, when I looked at the...
Go back to the...
Yeah.
Go back one.
So when I looked at this here screen here, I really got excited about 50% of the 111 new employees were racially and ethnically diverse. I think that is an awesome thing. But I think if we're losing them as high as we are hiring them, there's a problem. There's a deep embedded problem around, I would say race, maybe, and, I think it would be helpful if, if we did have like a breakdown in what department we're seeing the highest rate. We are hearing, and I know I have heard that we don't have competitive wages, right? And maybe that's it. But if only the individuals of color are leaving at a high number and the white ones not leaving, then we have to dig a little bit deeper to really see what is really happening within those spaces. I would definitely say that to versus explore an exit survey, to do an exit survey. Clearly, it'd probably be helpful to know why individuals are leaving. And sometimes it's hard to hear, but, I think it may be helpful. Because otherwise we can't get to creating a pathway. I like that idea, of creating those pathways and bringing on interns, or, we did a lot of things like that would do some introductions into the field. I think that is a great way of developing leaders who are there and want to be there, and also get to have a feel for what the culture is like also. Because, we can continue to do outreach in our communities, into diverse community, but if folks don't feel comfortable in the environment that they're coming into and they're leaving, then again, it's just a big issue. So I definitely would be helpful to do some exit interviews if at all possible. And I see that's hard for many departments to do, that we just, for some reason, are not doing exit interviews. And I think exit interviews can really inform a department of how they can do better, be better, and keep some longevity within these departments. But for sure, we know that competitive wages is one, but we want to have a greater number of one population leaving at a higher number than others.
Yeah, I mean, if we're really committed to racial equity, we have to identify. I agree. Really tell the story and really targeted, option, a survey that really gets to why our employees are leaving, and break that down by demographics.
I do think one of the things with this particular chart or table is that I think probably every other table we have, the goal is something that's higher. We're trying to achieve that. In this case, it's something that's lower in some cases, but just basically equal across the board. It also makes it more difficult to see this picture because when you talk about, for example, 13% of 30, it's different than the 6% of 400. It's just, so it's difficult to see what we're trying to, we know what we're trying to accomplish, but in a numbers format, this one is hard to read. And I do think as far as the exit survey, I thought that was standard HR practice. And if it's not, especially in this area, it has to be done. especially here where you're looking at turnover rates that just don't make a whole lot of sense. And knowing why, and as Commissioner Fretham has said, if it's for a good reason, for them personally, then that's great. If there's more, we need to know the numbers that are voluntary and involuntary. Are those numbers significantly different by race? And if so, then again, why is that? So there's a lot that can be cultivated here as far as how can we use these numbers to make the improvements that we're hoping to make? Yeah, the goal, I understand, is a very positive one, but I found it difficult to put together as far as the numbers and the goals and what they really mean. I think Commissioner Ortega this morning talked about sometimes we need denominators to see what that really means. That number doesn't mean anything unless I know what the total is. In this case, you've got 906 employees, so we got that. But in some of the other areas, especially doing them by department or area of focus, I think would tell us a much more detailed story as far as what can we do, because maybe some areas are doing better than others, and if they are, then why? So,
Definitely.
okay.
No, thanks for that feedback. We need to really look at these numbers more carefully. Tell the story is what I'm hearing. I definitely agree. Yeah.
And I didn't say at the beginning of this that what I do is I take notes on what we want to come back, but since this one is in sections, I just gave my overview. So, if there is something else because I know that you have a comment to make, but if there's something else, then I just ask commissioners to tell me if I missed something. County Manager Becker.
Yeah, Madam Chair, so a couple of points here. The first one is, and I'll have Larry send out the link to the commissioners, we do have some of this data by department on the open data portal already, so that is readily available, and we'll get that link over to you for your own perusing, and if you want to discuss further, we certainly can do that. In terms of the bigger picture around exit interviews, different strategies, this is a point in time and change of the organization. I feel one of the things that I'm bringing as the county manager is I was the workforce director for this organization, right? And same as we were supporting large and small employers throughout our region, we have some of the same challenges, and yet we have to push ourselves around many different factors, some including more nimbleness around the way we can compensate and work with our employees. Certainly exit interviews, as you've discussed, should be the gold standard. HR brought forth yesterday a measure, and I will be working with our exec team to ensure that we are not only meeting the marks that they had set, but actually exceeding those. It really should be something that everyone is doing so that we can know that deeper story. But the bigger picture, though, is that we have this talent priority, and this needs some strategic rework on behalf of me and the exec team, and we are committed to doing that, and I'm excited to do that. So I hope to be able to bring back with you, in partnership with HR, both things that they're doing right now, but also what that vision is as we move into a climate where we have to be a leading public sector employer. And so everything from renewing our passion for public service to ensuring that we're compensating employees, ensuring that we have a good work culture. I mean, there are a lot of things that make a good workplace, and it is not just one single facet, but we have to look at all of it. And so under that talent priority, that is a great opportunity for us to do that in partnership with across the whole county. So I look forward to having more of those conversations with all of you. So thank you.
Okay, any other comments on this first measure, the turnover? Then we'll move on. Commissioner McGuire.
Thank you, Madam Chair. Just to say thanks, this is your first time in front of us as a budget hearing, so we have a lot of questions. And, I think it just occurs to me, of course, that we're asking our departments to come before us with their performance measures, and there's different ways that people are, reflecting the work that we want to see, and it's always tough with numbers. And so I'm glad we've got it disaggregated by race, because that's one of the things we've been really pushing on, and many of the departments haven't actually given us by department. Many of the other service teams haven't given us the by the department numbers either. So I think it would be really helpful, though, in this particular one, that we see that. But it's not it's not all that, I mean, it would be interesting to see that in other service teams as well. It's just some of the, if there's a certain department where there's a, there's a real big difference in the race, because we've been really asking for that disaggregation. And just want to say, thanks for pulling this, for this effort that you've made in this, and we'll just keep working on letting you know what we need to know on what we need to do. So thank you.
No, this is great. It's a work in progress, and
Yeah.
I think we're all in alignment of how we need to really show this, right? And show our community that we are making efforts, and really to tell the story to our community and the efforts that we're doing.
Well, and one of the things that we're doing, and this is not about turnover, but as far as hiring, we are going to have an RBA that will come back to us that deals with experience versus a degree, where licensure or where it's not required to have a degree. In some of the jobs in yours, obviously, there is that requirement. But where it's not a requirement, trying to soften that so that we get people in positions that they're qualified for. They just don't necessarily have the degree attached to their name.
Yeah.
So that's hopefully that's I think is going to be really important.
Those transferable skills are so important.
Yeah.
Particularly when we're talking about equity and trying to promote and hire, people of color and a diverse workforce.
Yes.
Yep.
Great.
Thanks. Okay. I'm just trying to figure out how you
So
want me to.
The next
to do
slide,
this.
the next slide focuses on how our strategies to improve our talent priority is affected by our current budget. That's the next slide. And then how will this performance measure and strategies improve outcomes and inform our 2026 and 2027 request, or budget request. So we have worked with our departments to sustain and support staffing adjustments and their needs. For example, in 2024, the service team added FTEs and centralization of some accounting duties for 5 departments to maximize resources and created capacity across training and collaboration. How will this performance measure and strategies improve outcomes in our 26-27 budget? We're going to continue to strategize with our departments to budget and implement plans to assist in staffing needs. The service team will also purposefully budget to support our employees' retention and morale by devoting time and funds in diversity and equity trainings, creating opportunities for community engagement, and investing in individual professional development. Some of the cost pressures that we are aware of and are considering are the medical examiner's office. We don't have enough staff to run a 24/7 operations. Plus the addition of an additional pathologist will increase cost. The Emergency Communication Center focus on retaining staffing, looking at our Emergency Communication Center, try not to use acronyms, and how we can help lower turnover rates there. And we want to continue to invest in the capital of people. People really provide the services and makes up the majority of our budget. Any questions on that slide?
Just a comment to that, with the direction that you're going is absolutely correct, and the focus on the ECC as well. The turnover rate is really high. It's like 34%. Yes, and so I'm glad we're putting time and attention to that.
Exactly. Yep. It really is hard, and we see these numbers in 24/7 operations, right? It's really challenging work, and so it really is trying to improve and support an environment that is supportive and that we're taking care of our employees to keep them. It's not all about salary all the time. It really is about providing a supportive environment. So.
Very true.
So our second performance measure is aligned with putting our well-being and community at the center of justice system transformation performance measure. We are fortunate to have a solid team and collaboration with Health and Wellness, led by Jen Hamrick and Nancy Pass, who has moved us along to ensuring that we have the infrastructure to transfer calls for service to an appropriate response. And so I know you heard from Health and Wellness. This is really an opportunity to hear again, but from our side and the work that we do. And so I'll pass it over to Laura Espy, our Emergency Communications Manager.
Thank you, DCM Reyes. Madam Chair, Commissioners, and County Manager Becker. Laura Espy, Manager at the Emergency Communications Center. I've been working with the Appropriate Response Initiative in order to get appropriate responses to calls that come into 911. So on this slide, you'll see, as we previously presented at the June 4th board meeting and as you heard earlier this morning with Health and Wellness, this is the current triage into the calls for the 911 center. So telecommunicators answer the call, and part of their key questions are asking whether it's substance related or mental health related. If it is, then we will get it over to our embedded social worker or put it in their queue for additional triage and assessment. It's important to note that active overdoses are not, while substance related, are not sent through the embedded social worker. They are a traditional medical response. The embedded social worker will conduct a further assessment to determine the appropriate response. And based on that assessment, they will either put the call for a public health response, they will provide additional information to the mental health crisis response teams, or they may handle the call themselves by giving referrals and resources to the caller. It be noted that sometimes embedded social workers may ask a team to respond with law enforcement if they cannot definitively rule out safety concerns. This is to help clear the scene. Next slide. On this slide, you'll see some call types that can fall under an appropriate response initiative. These call types were discussed and developed during co-design with community, and consensus was reached surrounding the different call types and which responders would be most appropriate to respond. Note that public health calls relate specifically to substance use-related calls, and mental health calls specifically to mental health, and for future community response, that can be a range of calls that can include neighbor disputes, supporting kids unhoused, and provide location-specific support. There will be a future board meeting with our board workshop, related to ARI that will be diving deeper into these types of things. Next slide. And as highlighted this morning during the health and wellness presentation.
I'm just going to stop you for a moment.
Yeah.
I love this, the slide on the call types, because we had, when we were talking about it this morning, we were really having a lot of trouble lining up those arrows. This is perfect, letting us know, okay, this comes in, this is, and trying to separate it between the public health response and the mental health crisis team. And so, well done. I just wanted to say that.
It can be confusing. There's a lot of different areas of who's going to what, so yeah. So ECC, Emergency Communications Center, and Ramsey County Crisis Teams have worked in partnership since 2016 to transfer calls to the most appropriate response into the mental health crisis response teams. But through appropriate response initiatives in 2023, we began tracking data differently as we built a more robust call and response network. That's why on this slide, we're only showing the 2023 data for these key areas. By the end of 2023, we were fully staffed with the 4 embedded social workers in the Emergency Communications Center, and they were key part in ensuring that the calls get transferred to the most appropriate response. And this is reflected in the goals for 2025. As more calls are transferred through the embedded social workers, we are seeing and anticipate that less calls will be directly transferred to the crisis response teams in itself.
Commissioner McGuire.
Yeah, thank you, Madam Chair. So now we've added one more component to what my questions have been on social workers, public health, mental health, and now community response. So this is great. So just, and maybe we just add this to the workshop, but trained community members, are they all over in all of our communities, or just a little bit more on trained community members?
So, yep, community is going to be a community-based organization. and that is currently in a negotiation process. An RFP had gone out for organizations to be community responders within the communities. And so we're in those negotiation process right now, so more to come on those.
Okay, so
Contract.
they're not, yeah, and they're not sort of out there yet. So
Not
we'll
out there
kind of
yet.
know, excuse me, we'll kind of know what organizations are going to be out in our own communities.
Correct,
when-
after-
When they get determined. Okay, great. That would be good. Thank you.
Yes. So public health response began in early 2024 and are currently active in about half the cities in Ramsey County. Falcon Heights, Little Canada, Maplewood, Mounds View, New Brighton, Shoreview, Vadnais Heights, and White Bear Township. I know that was talked about a little bit earlier in the day, but for those listening at this point. So public health response goes specifically to substance use-related calls, so it is a smaller subset of calls. Again, they do not respond on active overdoses. So this is going to continue to be a nuanced set of calls, as is shown by the goals, and could increase as this becomes a county-wide response. When public health responders are not responding to calls, they are engaging with communities and building relationships with traditional responders. And to speak a little with the community response, it's going to be run by a community-based organization, and much of the next year will be spent ramping up for that response to be live. And we anticipate that response going live in 2025. Therefore, it will not be an available response for the entire calendar year. And I'll hand you over to Jen Hammer.
I would like to ask a question on here, though. So as this gets more mature, we're going to have more calls without a police, a fire response, that it's a social worker issue. We'll have more calls a lot more calls coming in, because in 2023 it was 1373. There weren't as many out there either. So going from 5,000 to 6,000 for 2027. But the Ramsey County crisis, I guess I'm trying to figure out why that would go down.
So as we ramped up, prior to us having embedded social workers in the communication center, any mental health related call would get directly transferred to Ramsey County Crisis, their adult and mental and juvenile teams.
Okay.
So as we implemented the embedded social workers, the calls routed through them first rather than going straight to crisis. So that number is going to go down as we continue to filter
Okay.
through the embedded social workers.
So the community, well, I mean, I know it's not a straight up transfer of the calls that are coming in, but so Ramsey County Crisis goes down because community response goes up, correct?
Not necessarily.
Okay.
It's more just the calls getting routed through the embedded social worker. So we're still receiving those calls. We're just going to triage them through the embedded social worker versus directly sending them to the crisis team.
Okay, so that balances out then from the first two, but why does the community response then go from 75 to 1,000?
So community response is not going to go live until 2025, so we're not going to have a full year worth of. So
okay.
we're starting with a smaller number, and ideally by the time we get to 2027, we'll have a lot more calls that are.
I just
being-
thought it was
going
very
through
ambitious, but I get it. It has to be fully developed first. Okay, thank you. I appreciate that.
Go to the next slide.
Oh, just,
I'm sorry.
Commissioner McGuire.
Gosh, I have a lot of good questions on this one, so maybe we should wait. But the community response, we have a lot of our fire departments now are using, fire department members to firefighters to do wellness checks and things, and so will these community response members will they be trained to do like wellness checks and things like that, which will totally take a burden off our local law enforcement and fire departments, I'm guessing. Is that what you imagine will happen as well?
Yeah, correct. I think it's really going to depend on what the concern is and why we're checking the welfare. But yes, I anticipate community and medical response or even public health response crisis teams to be doing those more often.
Right. Thank you, Madam Chair.
And just one other question, and maybe this goes to the sheriff, I'm not sure, but so when an officer or a firefighter, well, a firefighter has to have more than one, but is there more than one person with the sheriff's office or with the fire department And are the social workers, if they go out, because some of these are in-person responses, did they go out by themselves? I'm trying to figure out if there's a difference between the security, because they're going out at all times of the day and night as well, and how we are caring for our employees' safety. So is there always some sort of, you're going into people's homes and you don't know who's there, and you don't know exactly how bad it is or concerned you should be, and at all times of the day and night. So do we have the same mechanisms or some sort of security in place for those folks?
Yeah, so for public health response, if they're going into a private residence, they're going to respond as a pair.
In a pair,
versus
okay.
if they're in public. They also, the public health responders, carry a radio and they have a laptop. So they have direct connection to the dispatcher. So if there were a need for police or medics to come out to a scene that they are at, they have direct access to get someone out there to assist them.
And they could use that for their own security and safety as well.
Yes. And then I believe, and I guess I don't, for mental health, I believe they do respond in pairs, and maybe Jen can.
That's correct. Jen Hamrick, the Integrated Health and Justice Administrator. Good to be here with you again today. So the crisis team does use similar protocol to the public health response team of if they're going to a private residence, they respond in pairs. And if they are not able to respond in a pair to a private residence, they will not do an in-person response. That's one of the factors that goes into what we had talked about this morning about in-person responses and sometimes not being feasible if there is not two of them to go together. There are many instances where police departments or the sheriff's office does call the crisis team directly and ask for support in a specific call that they're on, or for them to do follow-up with a call that they have been on. So there is also that pathway to support if police are going out to something or come across the situation that thinks somebody needs mental health support, that they have direct access to those teams.
Okay. Thank you. Did you have more, Mary Jo?
Oh, no, thank you, Madam Chair. I'm good.
Okay.
Yes, we can go to the next slide here where we'll look a little bit at some of the strategies that we're using to really increase performance here of increasing the number of calls that are being transferred to those different appropriate responses. And as we had talked about a little bit earlier, we want to make sure that it's going to the most appropriate response, which in some cases still is police, fire, and medical support. So one of the things that we're currently doing is having staff do spot checks around calls that are classified in ways that could have been a potential response for public health or for the crisis team to ensure that that call was triaged correctly. So for example, people are looking at substance-related calls and looking at the specifics of that call to see, was this triaged correctly in terms of how it was routed, or is there some additional training and support that we need to be providing staff? This is an ongoing thing, and as we continue to support our friends in the Emergency Communication Center who take over 1 million calls a year, and this is an extra thing for them to really be asking these questions. So to be looking at what are ways we can make sure not only calls are getting directed the correct way from the telecommunicators and the embedded social workers, but to also make sure that we have mechanisms in place to support all of those staff people. So some of the things in the Emergency Communication Center, so Manager Espy and Director Pass had worked really hard to create in the Emergency Communication Center a peer support network so that individuals who are struggling with a specifically challenging call or having a hard time with the work could connect with their peers. And this has been running successfully for over 5 years now. We're adding on to that through appropriate responses and some of the work that Whitney Moore has been leading to really be looking at all of the staff connected to appropriate responses and how can we ensure that they have access to wellness support. And so we have some contracts executed and close to executing the rest to ensure that staff in the Emergency Communication Center, on the crisis team, and our public health response team have access to county paid for therapy sessions as well as team debriefing. Earlier when we were talking about one of the ways that we're supporting crisis staff with some of the culture change pieces of responding more in person with some of the additional consultation sessions, and that's through these contracts of allowing space for teams to be able to come together, talk about the challenges of the work, and get support as they're continuing to process through. We're also building up a more robust quality assurance program to ensure that we can continue to make sure that calls are not only being triaged correctly, but also receiving the response that they need in terms of kind of those outcomes, whether they're getting in-person responses, and also within that creating the mechanisms to check in with people about, did they feel that they got the most appropriate response? Were their needs met? Did they get the services that they needed? As well as a mechanism to be taking in any complaints or challenges that people have with ARI, so that we can address that and be responsive to the community members that we're working hard to serve.
I have a question about, okay, so the call comes into 911, it's triaged, they say mental health crisis is the way to go, the person gets automatically routed there. Would it ever happen where, when you got to, let's say it's the mental health crisis team, and they're talking to the person and go, okay, this is not what we thought, and can they transfer it back, I guess is what I'm trying to, I don't know that that would happen, but I could see where if a person is in crisis, that it could escalate pretty quickly, and suddenly it's not something that a social worker, or, you know, that it needs to go back and it needs to have some sort of action that is more immediate.
So there's absolutely several different parts in the process where that can happen. One is the social workers who are embedded in the ECC, where when they're on the phone with people, if the situation changes and it turns out a medic or fire or police need to go out, that they're sitting in the call center and can push some buttons to be able to transfer that to the dispatchers to be able to get those resources out. Once a call leaves the building to the public health response team, they have their radios, so if they are on scene, they can use their radios to connect with dispatch to say, things actually look a little bit different, we could use some support, we need EMS, we need whatever the support might be. And the crisis team can either connect with the embedded social workers or call it into 911 to get some additional support. Sometimes they also leverage the connections that they have with city police departments and with the sheriff's office to call people directly to come and support them at the scene.
I can see why the taking care of the employees and the stress level that they must have every minute that they're on calls. I'm really glad to hear that there are mechanisms in place, opportunities, support in place that is obviously very comfortable to say, okay, yes, I need to do that, or I need to step away, or whatever it is, because the stress level must just be crazy.
And some of the pieces we're trying to be mindful of is these are stressful jobs to begin with, answering 911 calls, doing crisis response, doing public health response. And for the Emergency Communication Center and Crisis Team, we're adding some additional changes. We're saying, here's appropriate responses. We're asking you to do your work differently, to ask questions differently. So we want to be really mindful around those change management pieces and to make sure people not only have support for doing their really challenging jobs, but that we also are able to support them with the changes that we're asking them to make. So we can go to the next slide then. And so this was talked about a little bit earlier. So right now, the Appropriate Responses Initiative, ARI, is funded through American Rescue Plan Act funding through 2026. We're going to be working, starting the end of this year and the beginning of next year, to really be thoughtful around the strategies to ensure that there's sustainable funding for this work. And this sustainable funding piece really goes hand in hand with our evaluation strategy. So Ed Hawk, who was here earlier with health and wellness, him and Ivory Love lead the evaluation for ARI. We also have a partnership with the Office of Evaluation Science out of the federal government that's helping to look at our program to ensure that we're meeting the long-term outcomes that we're striving for. So for us, it's really a partnership of the evaluation pieces to ensure that we're doing what we set out to do, that we're meeting the needs in the community that we're intending to, and then how can we follow that with sustainable funding strategies to ensure that we're able to not only continue to fund the staff that we've hired to be able to do this work, but also the community contracts, specifically with our community response agency. How can we ensure that we're being really thoughtful and strategic about continuing work that's proven to be effective in reaching our long-term outcomes of better well-being for Black and American Indian communities, less people arrested, less people incarcerated, and less people financially indebted to the criminal justice system. So more to come on that, but we want to be really thoughtful and to ensure that if things are working well, that we are strategically finding the funding to be able to continue them.
And I do know we've had questions in the past about, because of the ARPA funds. And the we're working on that as far as making sure that the services don't stop, but how it's funded, or what we have done in the meantime since we've gotten the ARPA funds and tried to build up a way to keep it going, and we're definitely keeping it going. Just wanted you to know that.
And Madam Chair, maybe at this point, for the viewing public, we would just reiterate that the ARPA funds is the American Rescue Plan funds, and those were funds that were given to every county directly, thank heavens, to do to really be flexible and address the needs that each county had. It was one-time money, and so we were all careful that we use it to try things, and then if we think they're going good, we have to fund them ourselves. But it was federally, those are federal dollars that we got during the pandemic to help us with all of our issues. Just to remind people what those were.
Commissioner Ortega?
Madam Chair, maybe it's possible, and not just you, but you've been in a couple of presentations, if we could get the total number of ARPA funds that we use for pilot programs, because quite a few of them have been very good and they change the way we do business. And number two, I know all the departments say we gotta look at how we're gonna sustain it. And I think the board expects them to do that. But somewhere, if I know what that total number is, then I could see how realistic sustaining is.
And I know that we are.
Does that make sense?
It does, and I know that there's a lot that's been happening in that area. But we will definitely come back with that so that you can, we have to come back. We have to make sure that we are continuing the work that we need to continue. So, thank you. That's a good one. I unfortunately didn't look close enough at my agenda here, and we are supposed to be on the county attorneys right now. And you have one more strategy priority listed. So if we could really just present it, and if there are any questions, we'll come back to it, I guess.
Thank you.
Because we need to keep on schedule. Okay?
Thank you. That would be me.
Okay. Pressure.
Reducing the number of pretrial days in an adult detention center, also known as the ADC, is a new measure for the service team. The service team chose this measure due to our work with the Bail Reform Working Group, town halls with individuals with lived experience, and the review of past pretrial data. A common theme from the community and those who participate in the town halls is the amount of time spent going through the pretrial process and the amount of time individuals spent at the ADC waiting for a final adjudication of charges. Pretrial days include intake, booking, first appearance, second appearance, and pretrial conference. Pretrial process ends when the charges are adjudicated or the start of a trial. In the data set shown, pretrial days do not include individuals on hold status, for example, judicial hold status, Department of Corrections status, or hold for another law enforcement agency. In 2022, Ramsey County pretrial days reached its peak. This peak was due to increased bookings and numerous COVID-related challenges. The county and system partners and the Second Judicial Court District noticed the increase, and additional resources were applied from all parties. Thus, in 2023, we start to see a decrease in the pretrial days due to those additional resources. Now, COVID-related challenges are no longer an issue, but bookings remain constant. So, how are we going to continue this downward trend of lowering the amount of pretrial days detention. The service team identified the following initiatives that can assist with the reduction of the number of pretrial days in the ADC. The Ramsey County Attorney's Adult Diversion Program, also known as Resolving Adult Cases in an Alternative Way. The county attorney will speak to the board shortly regarding this program, so I'm definitely not going to steal his thunder. The Pretrial Release Pilot Program is a partnership with the Ramsey County Attorney's Office, the St. Paul Attorney's Office, the St. Paul Police Department, Ramsey County Sheriff's Office, Public Defender's Office, the county's pretrial diversion vendor, and the county's community navigator. Under this pilot program, an individual is booked into the ADC. During the booking process, the pretrial diversion vendor conducts a risk assessment. Based off the risk assessment and no active warrants and the type of charges that the individual could be released after booking is complete. The list of offenses that qualify for release under this program are misdemeanors, gross misdemeanors, and some felonies. I will provide, or we can provide, the board with a list of the offenses that are qualifying underneath this program because it's a lot of lists. It's a long list. Upon release, after booking, the individual will receive additional information from the Second Judicial Court if they are charged, and a summons if they need to return to court. The individual can also volunteer to work with the community navigator who can assist them with the court process as well. I'll talk about the community navigators here shortly. Another initiative is the warrant resolution. This is handled by the Second Judicial Court, which offers individuals who miss court or who have an outstanding warrant to resolve the warrant by either calling a designated number or by filling out an online form. The Second Judicial, and of course, we also advocate for individuals to use this process. In the past, we did warrant resolution days, but those have not occurred in many years now. The sequential bail review is the process of reviewing the status of pretrial detained individuals held in custody at the ADC on a regular ongoing basis. The purpose of this review is to determine if any changes in eligibility for release or to highlight additional circumstances that may warrant a second look at by the courts. The Safety and Justice Service Team provides data on a weekly basis to the Ramsey County Attorney's Office, Ramsey County Sheriff's Office, Public Defender's Office, and the court administration to assist them with this review process. To keep reducing the number of pretrial days in an adult detention center, the service team must continue to work with our community members and system stakeholders, which means we will continue to work with our pretrial diversion vendor who provides services for individuals referred by the Ramsey County Attorney's Office for pre-charge and post-charge felony cases. And on 1 August, the vendor also took on the responsibility of conducting a risk assessment for the pretrial release program and providing referrals to the community navigator when appropriate. Our new vendor for the community navigator program will start serving individuals on 1 October. The community navigator works with each individual to identify and alleviate barriers that hinder them from appearing for their scheduled court dates. Any Ramsey County resident released from the ADC may volunteer to work with the navigator services at any time during the pretrial period. Some supportive services the navigator will assist with are providing transportation costs to and from court, clothing for their first appearance, costs of childcare for the day of court appearance, a prepaid phone or prepaid phone card to allow the capability of contacting a court, the navigator, or legal representation. Lastly, the Bail Reform Work Group, which consists of community members, community organizations, and system stakeholders, will also continue to play a part in the pretrial process. The group met on 4 September and are now refocusing its efforts by working to establish a new strategic plan to include a new vision, mission, and goals. The group will now operate with tri-chairs that consist of two community members and Commissioner Moran.
All right.
Next slide would be handled by DCM Reyes.
So any question? I mean, the next slide is about our budget, and I can go over that quickly. We got funding through the Public Safety Aid Funds that will continue this program through 2026, I'm sorry. Our team is proactively and strategically planning for both fiscal and programmatic continuation after 2026 with consideration of the impact to community justice systems and budget. So any questions about this?
I did have one thing to add. Okay. So on October 8th, we have a board workshop. On that board workshop date, we're going to go into data detail on the number of bookings and the types of offenses and the number of pre-trial days broken down by race that individuals are serving in an adult detention center. We did not want to put all that data here because it would have been a long presentation. So we scheduled a board workshop. Also, we'll be able to discuss in detail a little bit more about the pretrial process and about the sequential bail review on that day as well.
If you could, when we do that, did you want to make closing comments? And because I'm going to...
No, that's fine.
Okay.
Yep.
Then, so I want to... The question that I have is basically around specialty courts and how that works. Doesn't have to be answered here today, but when you come in...
I'm sorry, ma'am, I didn't hear the
Specialty
question.
courts?
Specialty courts?
Courts, yes, so
Substance
drug
abuse.
treatment courts, yes.
Yes, and how that fits into it. I would like to have that covered when we have our workshop.
Sure.
Commissioner Moran.
Madam Chair, so I don't know, that's it. So we made some comments around the pre-trial days, but I also would like to just share that we're also have worked on, that I didn't speak on this morning on my check-in, about the work we're doing to prevent individuals from even going within the system. Right. So there's a lot of work that's happening around that also, because if we can keep people out of detention, so they can get back to their jobs and their families and their homes, that's even better outcomes for the individuals. So hopefully we can hear a little bit more about that too in that work.
Well, and that's one of the reasons I was asking about the specialty courts, because that's a way to not only provide support, but it goes into the future and pays it forward. So, okay, then very quickly, I already did the turnover one. We do have a board workshop coming up on appropriate response, and so obviously you would be part of that discussion as well. You mentioned already the October 8th workshop and looking at things that are ways to keep people out of the system as part of that as well. And then we do have the ARPA funds plan will be coming, not that you have to worry about that, but that we will have that coming back to the county board as well. Okay, we will move on then to the county attorney's office. Sorry, we're running a little bit late. I'll try to do better here. Not that I'm reading it correctly.
Well, as Rich is getting the slides prepared, I suppose I could just begin. So first of all, Madam Chair and members of the board, it is my pleasure to be here today to talk a little bit about the performance measures that we've agreed on to present to the board. And but before I begin my remarks on the specific performance indicators, I do want to give you my heartfelt sentiment and appreciation. Remember I don't know if you remember, but at the last budget hearing, I asked if there's one thing that you hear from me, I really need your help And what that was is that at that moment, about a year ago when we were going through our budget, I was forecasting for you some of the competitive marketplace issues that were happening. And we were just losing a lot of attorneys, and you'll see some of the data that shows that in 22 and 23 it was really bad. And I asked this board to prioritize, along with the county manager at that time and HR, to look at and evaluate the salaries for my attorneys. And finally, over a lot of work that happened, by late spring, we got to a place where we were, in July, able to make that salary adjustment. And so I just want to say thank you for that, because I felt very heard on that. And you're going to hear me continue on this issue of competitive wages. Now that we've kind of addressed the attorney issue, we've got all of you're going to go into labor negotiations. Obviously, we're not going to talk about that today. And I know that where your commitments are is to try to do our best, as County Manager Ling Becker said, that we want to be the best in terms of our workplace and our competitiveness around salary. And that's just a really key issue, and you're going to hear that throughout my presentation as I go through these performance indicators. And so, Rich, how do I, you're going to do it for me. Thank you so much. So let's just go on real quickly. So I think I just gave you the opening comments. So let's go right into it. And so just really broadly, I wanted to make sure that you understand how we in the county attorney's office is organized. I have two direct reports, my first assistant, John Kelly, and Sam Clark, who is my chief deputy. And underneath of those individuals are a number of units. So under John Kelly would be the administration and budget, but also we're unique in Minnesota where we organize ourselves in various parts of kind of the criminal legal system. So we have our pretrial justice division, and that is where like the charging decisions are made, the diversions decisions are made. We house our attorney that does the alternative or specialty courts there. We're handling the first and the second appearances. So the things that happen very much at the early stage where we're thinking about pretrial custody status. And then we have one of our largest divisions, which is the trial division, and that's comprised of prosecutors who get these cases once the date has been set, and we're working on those particular cases. And then we also have our civil division, and I'm glad that our county manager and Jada Lewis, our civil division director, are meeting regularly. That relationship and the way that we show up is, and I want you to hold me to this, is that we are client-centric. Our job is to find solutions for you and to be that partner in the work that you need to do, as well as all of the departments. And then, of course, we have our child support program, and then also our human services legal, which is comprised of our child protection function, our civil commitment function, and then we also have our victim witness post-conviction justice division. You'll hear about some of the data points there. And of course, our youth justice and wellness division. And many of the managers who do the day-to-day work are here with me today, and I couldn't do it without them. So thank you very much for all the dedication that you have to this office and to this great community. So if we go to the next slide, those are just some of those names, and we're going to continue on and get right into, now, I don't know who made this slide. I know these are the things that I'm supposed to talk about. And someone put, like, on the measure type, better off. I don't know that I agree with that. And I don't know that I agree with, like, the previous presentation that we're better off. We're actually at the precipice of, like, great risk. And I just the conversation that you had before about looking at some of the diversity issues and the retention issues, thank you, because we need to pay attention to that. I think right now we are at the precipice of a crisis that we just need to really work together, pull together, and I know we're going to get through it, and we're going to meet the challenges that we have in this rapidly changing climate and marketplace that we find ourselves in. And I know that all of you are committed to doing that, so I thank you for that partnership. So let's go right into all of these. There we go. So the first one, staff diversity, leadership diversity, and staff turnover. And just for reference and for the public, if anybody ever wants to look this up, they can do it in real time. We have a Ramsey County Attorney's Office data dashboard, and it will show all of our workforce equity goals and et cetera. So as you can see, we've maintained our BIPOC staff numbers. I do think in 2024 it's gone down a little bit, but we want to raise it back up, and a big part of that, and I'll talk about that. But as you can see, in 22 and 23, we had staff turnover like we never had before. We typically are like at 4 or 5% historically, and struggling through the 22, 23. It just takes so much time and effort to go through the interview process. And all of that, and it's been a real struggle. But I know, at least for the attorneys, the adjustment that you made has made a difference. And we could admire this data, but I just encourage all of you to recognize that you guys are way up here, and there's stuff that's happening down at the ground level. And the solutions and the answers about what's going on, we do exit interviews. And I think if the county wants to do exit interviews after we do them, that's great. But I can tell you what you're going to find out right now. We're in the midst of a rapidly changing marketplace. Our salaries, we need to improve on those for employees across the board, not just in my agency, but just across the board. And, a lot of it, when I talk to people, it's kind of like I am so overworked and I feel underpaid. And if I go to another county and bring my experience and expertise, I get to start with a workload of 0 on day one and then build up from there. And somebody else has to pick up those pieces. So it's been, and the work that we're doing around I can tell that the county is really focusing on like wellness and some of those types of strategies, just very, very critical. And so as you can see, we're struggling a little bit on the turnover rate in our office, but I know that working together collaboratively with this board and the work that we'll do with our HR department moving forward, we will be able to turn that around. So if you can go to the next slide. And so some of the strategies, and Gloria talked a little bit about, we've done historically, even before my time with the county attorney, but we've done a lot of work around our summer law clerk program. We go into the law schools. We're very intentional about recruiting for diversity. And we have a very robust summer and a summer college intern as well as a law school intern program. And I very much appreciate the program that we put into place, working together with finance and all of you to have a Pathways program. I think that was like 6 or 7 years ago. And there's a person sitting in this room who is now a manager, the director of our Youth Justice and Wellness program, who was one of our first Pathways fellows back in the day. And so that strategy has proven very well. And again, we do a lot of work with our law schools and our colleges. We've found great employees and staff with our student interns, working with Metro State and all of these other great post-secondary institutions that we have in Ramsey County. Moving on to the next slide. So I think one of the things too is just I know that I have a partner in our county manager and you, Commissioner Reinhardt, for the rest of this year, and we're going to try to do our best to manage 24, and then there'll be a new chair and some new commissioners. I will continue that collaboration and partnership so that we can make sure that we have typically we use budget savings to do a lot of this recruiting type of work, and I know that we can focus when we get to the 2026, 2027 budget. We will be looking for just more stability. And I know that we're going to find it as we work together in partnership. But a big part of that really relies on all of you and just supporting the financial budgetary needs of us being able to do that work around diversity, equity, and inclusion and the staff recruiting and the retention. So moving on to the next slide. This is a slide that I don't like it because the number is so small. But I guess, in many ways, the type of contractual spending that we do is it's not a lot of money. In fact, a big part of maybe what we would spend would be in like our diversion provider. That's like a $600,000 to $800,000 contract. We have other diversion contracts for youth justice, but none of them are certified minority-owned businesses. Or when we hire a trial expert to come in and testify about some issue, and we have to pay them, and we have to have a contract. A lot of times they don't even live in the state. We have to fly them in. But they're not necessarily certified businesses through our CERT program. But maybe if there's a way to better reflect that in future years, because it is a priority for us. I mean, whenever we have an opportunity to utilize, and it's usually like when we're using like food services and things like that, we're always intentional about trying to find a minority-owned or women-owned, BIPOC-owned small business. But if there's ways to work with our finance department to try to capture some of the work that we're doing to really connect with our community, because a big part of what we're trying to do, especially in our youth justice diversion area, is to find culturally specific vendors who provide that alternative programming and diversion services. And so all of our services in that area are very diverse, but they're not for-profit, they're not necessarily certified, they're more non-profit. So maybe if we could move on to the next slide.
Just a moment.
Yeah.
I know that Commissioner McGuire has a question, but I was going to ask mine also. Because the CERT program, I mean, you have to have the data on that. But would you be able to pull the data on the rest of it, even so that you could have two lines here? One is that the certified folks, and then those that are small businesses that meet that standard but are not certified?
Yeah, the question is, what is that standard?
That would maybe help make an argument for why it could be.
Right. I mean, I think our list of vendors should be public, and I'd like people to scrutinize it.
Madam Chair, I was just going to make a similar comment that, in the past, we've heard about how getting certified is taking a long time. And so I'm sure that there's vendors that would be certified if it was a better, maybe a faster, maybe more condensed process. So I think we made that point already, that we're working on that so that it would be easier to keep track of that. And then, Madam Chair, while I've got the floor, I was just going to ask, just so I'm in the right frame of mind here. When you said, County Attorney, that who put these performance measures together, why they matter, I thought you did, but you didn't do this sheet? I mean, you didn't do this?
I didn't do the better off narrative, no.
Yeah.
The question was on the better off.
Yeah.
Because it's not something you can quantify with numbers.
Right,
And
okay.
better off was, he didn't, Larry's raising his hand.
I mean, I want you to be judging yourself on the measures you wanted to judge yourself on, and with help from others, I guess.
All departments were asked are expected to deliver on those measures. So the diversity of staff and leadership, turnover, and procurement spend. And so each of those are expected. And that's not the same for service team. They have different instructions for service teams. And then the other piece of that is the better off, quantitative or qualitative. Those are results-based accountability terms. And so it's not saying that we're currently better off than we were. It's saying it's a measure of being better off if we do it well. So, I think just a distinction.
Well, qualitative is very difficult to come up with. But, so is that consistent throughout we saw it earlier.
Yeah.
So it is consistent across.
It is.
And is that some official or designation, or is that just, it's okay if you just thought of it.
No, it's part of the framework for our performance measurement process.
Okay, so it's in line with, so that we can compare one area to another. And what if, pardon me? I'm sorry, did you?
Yeah, I can add to what Larry said. This was helpful in terms of the conversations that were happening at the PMAT levels as we talked about what measures to lift up and why are we measuring this? What is this really telling us? Is it telling us whether we're better off or not? What is the goal? And recognize that it can be a little confusing when it's on a slide and you're not able to understand the full context of what it means to see it on a slide. So we fully recognize that, but that was the purpose of those conversations around better off or not.
Yeah, and then the qualitative is provided by the people that are up here, right?
Okay, Commissioner Ortega.
Maybe this is even broader, but it's stimulated by what's going. Are we just then going to be measuring? It's a good point, though. What's certified? What are we missing when we just do certified?
And that's what I think, because
Not just
that's
here.
I know.
Across the board.
And so I'm wondering if there is a way that, and just thinking out loud here, that we could have two different categories. One that fits the literal definition as far as BIPOC, women-owned, and one that is for certified. And because I mean, we do have measures that we have to meet in other areas and goals, but it does seem like we'd be missing a lot of the one-person businesses that going through a certification process doesn't make sense. Plus, you mentioned there's also folks that are, in your case anyhow, that are coming from out of state. And so why would they go through the Minnesota procedure for one day? But if they are BIPOC, then we could at least show that we made that effort.
Madam Chair, and I won't take away from John's time, but I've had a lot of small businesses tell me they do not even bother doing business with Ramsey County, and these are businesses of color, because it's not, the certification process is not worth it to them. In this economy anyway, they're doing well, and why should they go? They actually, some have said, we actually lose money to go through your process.
Well, and there, it's a case-by-case basis.
I'm just saying that.
But if you get certified, you're not just
Yeah,
certified
because
in.
if they're spending time going through our process, that's time they're not spending making money somewhere else.
But the certified list is something that is statewide, is my understanding. If once they get certified, it's not. I thought we had.
Our program was with the City of St. Paul and Hennepin
City of
County.
St. Paul, okay.
And I think the CFO could kind of speak a little more.
Okay.
Sure.
And I'm just bringing, go ahead.
Okay, thank you, Madam Chair, and County Manager Becker. I just also want to note, just in terms of what, I think it's a great question of what's here and what's missing. Some other just information that's out there. All of our vendors are public online, and all of our spending is already out on the open data portal. So just because it doesn't show up in this specific measure, that information is out there. It doesn't pick up nonprofits, and so that's another piece that's missing, to the point of how are we thinking about this data. The nonprofits are not included in that certification process. And just thinking about the disparity study coming, that will help us get better information, and working through the PAC process of making the process easier to sort of get to the concerns, Commissioner Ortega, that you're raising about being able to participate in the program in the first place. That's a lot of what's driving the PACT work and trying to get us to a place where we can have a different level of data and be able to use that disparity study to further inform how we get to the overall goal of improving our spending, not just in the county attorney's office, but across the department.
I'm telling you what I'm hearing from community business people, people of color. But I don't want to take away from John's presentation.
Madam Chair and Commissioner Ortega, I think you're raising a really important point, and it's a little bit off of this is not my swim lane, but how we spend money, the public's money, really, really matters. So anything, we'll be partners with you to do whatever we can. And I think I would also add, as we think about the work that we do, and none of this is in the PowerPoint, but we do a lot of work because you appropriated some resources for us to do wage theft investigations, enforcing our prevailing wage ordinance. All of those things are just really critical. And so how we spend the taxpayer dollar and how we invest in equity in our community is an important thing. So I will be there to brainstorm with you about how we could measure things in our office, because I do think what gets measured does change. So moving on, not a little ahead of me there. So moving on. So the next part, the next data point is to recognize and to talk a little bit about the work that's happening in our post conviction justice unit of our victim witness post-conviction justice division, led by Tammy McConkey. And that division has been really busy with just all of the changes that the legislature has made. And when they make these changes, they oftentimes make them retroactive. But I'm really proud of the work that they have done specifically, and this is the data point that we started measuring back about when we launched our helpstealmyrecord.org. That was in October of 2019. It was a pilot program with Washington County and Ramsey County. That website, by the way, has now been handed over to our Attorney General. And so now we do prosecutor-initiated expungement for the entire state. Of course, we just do our own county, but it's very popular, and it's just very heartwarming to know that when people come forward, like a lot of times we can't help them because they're just simply not eligible yet, maybe for the expungement, or the offense is not one of those eligible offenses. But it's very rewarding work to actually help somebody be able to seal their record. For a lot of people, this actually is the final step in their redemption and rehabilitation. But I stopped talking about this program about 2 years ago. And the reason why is every time we do a public announcement, we develop this enormous backlog of people coming into the helpstealmyrecord.org. So I let the Attorney General just talk about that website. And of course, if you go to that website, there's a direct link to Ramsey County. And so we just get our daily applications that come in. And so this is an area that, as we think about our future, we need help in some investments in this particular area if we want to continue this. The legislature has also taken a huge interest in this, where they've developed a clean slate bill that will actually automatically expunge some cases moving forward. And I think there's going to be some work that's going to be retroactive, but it's not going to necessarily capture everybody. So this is something that is near and dear to me, because I started this work about getting the prosecutor involved in this work. Instead of passively waiting for applicants to do it themselves, and it's just really complicated to do it by yourself. And oftentimes people get an attorney, and nobody, I mean, if we're trying to think about equity, we have to serve that population that actually can't afford to hire an attorney to help them expunge their records. So back in 2019, I felt like it should be the prosecutor's role to expand, and it's just great to know that it's now becoming a more normalized thing. The person also benefits because they don't have to pay a filing fee. We are exempt if the prosecutor actually files that fee. So this work has been really developed. It's gone statewide, but we just struggle sometimes with the backlog that we create for ourselves when we promote this too much. So if we go to the next slide, I think we have some strategies. Yes.
County Attorney, let me see here. So we do it statewide? Is that what you're saying?
Yeah, we purchased the county purchased the domain name helpstealmyrecord.org, and it was a place that anybody could go to for Ramsey and Washington counties.
Just the two counties?
It's just the two counties.
Okay.
But then I think it was October of 2021, Keith Ellison took on helpstealmyrecord.org for the entire state of Minnesota. So if you go onto that website, it'll just give you a bunch of buttons that you can press, like where was your crime committed. And so if it was Ramsey County, it just comes to our portal. If it was Goodhue County, there's a place where I think
So
you could
Goodhue
navigate.
County
Yeah,
handles it.
yeah.
Okay, so it started here, but
indeed
it's
it did.
expanded. I thought you were saying we were doing it for the whole state, and was like, whoa,
No,
that's a
we wouldn't
lot.
do that. That would be irresponsible for the taxpayers of Ramsey County.
But it is, the numbers show just how important that is.
We played a good role in the genesis of this for the whole state, though.
Commissioner Moran? Okay, go ahead.
So moving on, one of the things I would ask this board and county manager to think about is to look at some of the cannabis revenue that could be a source of funding, maybe for future growth in this particular program. There is funding available, I believe, for local units of government, as they recognize that as they do the retroactive cannabis conviction expungements, and they have to go backwards. There is a board that has been set up. They have an executive director. They have an attorney who they stole from our office. And they are now doing that work. But there is some money that I think comes to the county and the cities, if I'm not mistaken. So I'm just looking for more resources and trying to be thoughtful about how we can continue this work. And more importantly, I just think this is the prosecutor's role, about trying to help people after they have done everything that they have asked them to do. And this is, by the way, just a small sliver of the work that we do around collateral consequences. We have a policy in our office. We have an immigration attorney who has, we don't talk about this too publicly, but we've probably helped hundreds of people be in a better position so that they will not be removed from this country because of their status, because they're not United States citizens.
Commissioner Jean.
County Attorney Choi, I think you're spot on when you mention about, who we're trying to help get to, because as I'm looking at the previous slide about sealing records, and broken down by race, we're 44% white, 40% black, 4% Native American, 3% Asian, 2% Hispanic. It is very telling because we know the demographics that show up in our justice system already too. And, I would say we need to do more work in Native, Asian, and Hispanic communities to let them know about this.
I don't have the benefit of that slide. Was that? Did we break that? Oh, there we go. Thank you. Yeah, thank you. Comparatively, though, I'll tell you, yes, these numbers should increase more, but I'm also very happy about the work that we see for our African American community. If you look at just criminal justice data, that's an outlier.
Commissioner Moran.
So you're asking for more staff, more dollars for more staff. Would the staff that you get, would they be prioritizing these issues here or the work that needs to be done here?
Yeah, there's so many things that have happened around collateral consequences, and as they have, they, meaning the legislature, have done reforms, they have done these things retroactively. So we spend a lot of time right now on reviewing past felony murder convictions to make sure that they actually meet the standard of the current law. And if they don't, we have to go backwards and vacate those convictions or modify those convictions. Some of that work also, and by the way, this board has stepped up and helped me with the review involving Dr. McGee. That's also a part of this kind of post-conviction work that we are kind of building a body of work around, and that we hired a vendor in that particular instance. But just those resources really help. But I would like to be able to expand in this area of this prosecutor role of being around justice, because our duty and our work is around justice. It's not just solely to get people convicted. It is also about ensuring that the quality of justice is good for all people. And one of those areas is that we have to stop punishing people who have done everything that we have asked them to do after they have served their time on probation, or whatever it might be. Many people struggle with the after effects of a felony record.
Just for the purposes of staff, what would that look like?
We'd have to think about what that work would look like. But I mean, I'm just forecasting something for the 26-27 budget process.
Okay.
Yeah.
Okay. And I'm guessing the legislation that passed at the legislature was unfunded?
I can't remember if the retroactive marijuana conviction review process was funded, and I think I was pointing to the possibility that some of that could be used instead of tax levy dollars.
All right, thank you.
Commissioner Ortega.
Thank you, Madam Chair. John, you know what, and it seems to be common, and maybe it's not you I need to ask, but we need a denominator for this also. What's the universe that we're talking about? So it's 3% Asian, 3% of what?
That I don't know off the top of my head, but I would imagine it would be, it says residents who benefited, so those would be the numbers involving the number of criminal records sealed for residents through Help Seal My Record, and you see those numbers below. Those are the people that we found to be eligible, and we actually filed a petition on their behalf.
And I think he's just talking about the denominator. What does it mean? But Commissioner Fretham, and then
Yeah, to Commissioner Ortega's point, and I think there are a few in future slides that I had pegged with this same question, if this is just the overall pool. It doesn't tell us if, if of the 100 people, I know that's not the right number, who put them, if 44 were white, 40 were black, 44 were Native American, that doesn't tell us much. What would tell us is if there is a discrepancy in here's how many folks who identify as black, submitted to have things reviewed, and here's how many were sealed, and are there discrepancies by race in who submits and who actually gets it sealed? And so that's where sometimes we're just getting sort of a general demographic of who's participated in it, but that doesn't necessarily tell us if there are discrepancies in the work that's being done. And we're having some more clarity when we have percentages, what those percentages mean. And I don't even think, not even in this, but anytime we have a percentage, is what are the numbers contributing to that percentage to make sure it's actually telling us something meaningful, or what is it supposed to be telling us?
Hey, Commissioner Fretham, Madam Chair, if I could just respond to that too. In this context, I think you're talking about maybe like a racial equity analysis. In this context, to measure you would want to measure like human discretion. In this context, there isn't much human discretion. It's really about whether or not they're eligible, and it's just kind of figuring that out and going through the paperwork of actually serving all these people so that they have the opportunity to object to it. That's where a lot of the work goes into. So I really think these numbers are reflective of people who literally go on helpsealmyrecord.org. So obviously we're doing, I think, a pretty good job of getting the word out to, let's say, the African American community. I mean, that is a higher number than usual that I see in criminal justice data.
So this is maybe an outreach night flag for us. If there are folks from some of these communities who are eligible, if the eligibility within the Hispanic community is higher than 2%, which I would expect it is based on other numbers we've seen, then maybe we need more outreach with that community so they know this is an opportunity.
Madam Chair?
Go ahead.
And that's what I was trying to get to, whether it's the Asian, Hispanic, or the Native. And that is, the numbers are so low that, and I get what you're saying, John, but my point is if the universe for Hispanics are 300, but only 25 apply, and 15 get expunged, you reflect that. But then we can't be helpful by saying, how do we do more outreach and get more information out there? Because there are a lot of Hispanic organizations, for example, that could be part of your effort, and they're not being enlisted in this support.
Right, and I would love to do that, but again, I just stopped talking about this publicly about 2 years ago, because just every time we did that, it would create this enormous backlog that it just was difficult for our staff. And I think the AG has even stopped talking about it a little bit too. It's been a while since he's done a public thing.
Well, I think it makes sense in some ways, but it's there for a reason. We want people to be able to use it, and if they don't know it's there, then they're not going to be able to use it, and then it won't cost staff time to do it, but it's kind of backwards, I think. I think we should be. And maybe it's not doing a big press release or something like that, but at least making sure that, like on our county website, the main website, to say that this is available. If people go there, they can see it. So I can see a full court
And
press would be
there's a
difficult.
lot of legal clinics and organizations that promote this. So believe me, there's a daily trickle.
Okay.
It just, when you do a big announcement or something like that, what ends up happening is that you end up getting like hundreds of people. And then I don't feel good about the fact that it just takes us a long time to get to the individual, et cetera.
I believe Commissioner Ortega still had the floor.
I understand what you're saying, but something's then wrong. I mean, 3% Asian and 2% Hispanic, something's wrong. And quite frankly, my friend, that answer is not good enough.
Well, I mean, I think that's one of the things we could do is be more specific about the recruiting. I think Commissioner Fretham is actually, when you look at the data, I think that's what it points to, is things that we could do to increase the diversity of people who are using helpsealmyrecord.org. And that just goes down to some partnerships and working with communities. And what I'm flagging for you is just the need for staff, because right now we're very taxed.
Well, and I've got lots of hands up here, but I do want to just point out that then we have to figure that out within the system, because it just seems wrong to have something that's available and to not let people know clearly. Again, you pointed it out yourself. The Black, African-American community, they're getting the message out, but not the others. And so it seems like there has to be some middle ground here, because getting a trickle in doesn't really achieve the goal of this, and it's an incredible effort, but it has to be utilized. And to say that we don't have the staff to do it, then we have to look at how, you have to look at your budget to figure out how you can do this, because it was brought up here. Okay, I have Commissioner Fretham on this point, and then I have Commissioner Zhang and Commissioner Moran.
Just noting, I hope the County Attorney's Office can partner with our comms team and the new pilot we have with different communities and our community connectors to help get information out to more targeted communities.
Well,
I don't think it always has to be done within the department. We're setting stuff up organization-wide, just like the last presentation talked about HR. We don't need every department to come up with HR recruitment. We have that. We're doing that with comms. Let's connect. I hope comms folks are here.
Well, and it also sounds like we have partners in the community that are doing this, and it doesn't all have to come through the County Attorney's Office. Commissioner Zhang and then Commissioner Moran.
Yes, ditto what Commissioner Fretham said. That's exactly what I wanted to mention, because County Attorney Choi, if you didn't know, the county invested in 2 positions for communications, one specific to the Hmong language, one specific for the Spanish language as a pilot. And that is a way where we are going to get key information out about some of the county services available. So Deputy County Manager Francois is over there, so I hope that this connection could be made.
Okay, I'm going to go to Commissioner Moran and then McGuire. We've got 15 minutes left, and you're not halfway through.
No.
So we need to end, and yes, we got started a little bit late, but we need to move this a little bit quicker, and if we have questions, again, we can go back and do that. Commissioner Moran, did you want to make a comment?
So one of the things I was looking at was trying to find the number of the rate of diverse communities coming into the criminal justice system, because that would be also an indicator of who needs the services too. We do know that Black communities disproportionately impacted by the system, so I can understand having a larger number of them coming forth. But I think if we can also see the rate of the Asian and the Latino community coming in the system, that will also tell a story.
Okay, Commissioner.
But we don't have that.
No, maybe he don't have to. Maybe he doesn't have it.
No,
but
I
someone
agree
has
with
it.
you. That's why I was asking for the same information.
Well, we did have, you mean as far as people coming into,
It's somewhere. Yeah, it's there.
We
It's
had
all right.
information on the jail population, adult detention center, I guess I should call it. We had information on that by race. And so there should be some way to be able to correlate that to, and the deputy county manager is shaking her head yes. So I believe we have the data. We have to pull it together so that it gives us the picture or what we want to know here. You got it?
Yep,
All
got
right.
it.
Thanks, Madam Chair. I'm just going to quick say that
I get it, that you're not gonna put it all out there, because then people are just gonna have to wait in long lines and not get their, I don't know, do we tell them about a service we can't provide to them in a timely manner? I mean, do we keep putting it out there? I get frustrated when I hear about a program and I call and they say, oh, sorry, we're 2 or 3 months from letting you know. I mean, it's not like we gotta hide it, but we gotta give him resources. I mean, he's gotta get resources to be able to do this program. I mean, this is a time-consuming program. So I'm just giving support for the staff that we can help provide if we're going to keep putting these out. I think it's with any program that the county has. We don't always put out a lot of information. We should be on all the programs that are available, but then we also have to be able to deal with it when we get the people. When people call us, I just get so frustrated when we don't.
And my point here is that if we've got something that's a good thing, and it's a service that's really needed, if we're not going to let people know about it, then we shouldn't be doing it at all, and that's not the answer.
Right.
So there's got to be a way to balance this within the office, within the county, within the budgeting, because if we've got it, it should be a service that is available, and to not let people know about it seems like a disservice to me.
And Madam Chair, just so you know, I mean, it's not like that we don't let people know about it. I mean, we do talk about this, but we don't do a full-scale press conference or some major event. In fact, we have a town or a community meeting coming up on October 17th that will be talking about some of the work in this division around conviction review and sentencing review, but we will announce as a part of that community meeting that we will have a very specific conversation, community conversation, around expungement. Because for a lot of people, though, the work that we do, we also have to recognize that expungement is very limited. It only just seals someone's record. And there's a problem with that, too. And the problem is that with all of the private databases that exist, and when someone does a criminal background check for rental housing or for employment, even though your record might be expunged, it still shows up. And so we're going to have a community conversation around that particular issue and start talking about how we can improve some of these processes, and some legislators will be invited to that as well.
So expunged doesn't mean expunged.
Well, in reality, for a lot of people who are in this situation, it does not. Because we have, over the past decades, we've had an influx of private databases. They go into our public systems, they take a snapshot, and they are allowed to use that for criminal background checks.
So if they had it before it was expunged, it's there.
It could be, yeah, possibly. So those are improvements need to be considered, and I think that those are conversations that we need to have with other state lawmakers as well. So I just want to make sure that people understand, though, too, that I do think we're talking about our helpsealmyrecord.org. I mean, we are very proud of that. It just, there is another part of this, and Commissioner McGuire just said it very clearly.
Yes.
And there's some numbers in here about who's been detained and who's been arrested that can be helpful.
And I think that's what we were,
it's some here.
Deputy County Manager Reyes was saying that is noted and will be done. Okay.
Okay,
we've got
so moving
less than
on.
15
So
minutes
Rich,
now.
if we get to the child support slide, so we had a very in-depth board workshop on our child support program, and again, I very much appreciate the two board workshops that we had and the conversations that were there, but this is the number that we have historically reported to the board. And obviously there's a downtick in the pandemic that we talked about in the board workshop, and we're working on with the plan to improve that number. The next slide will show the race data so that you can see that. And of course, we still have a lot more work to do in making sure that we're trying to have equalized numbers here. Maybe we go to the solutions. And this again was talked about at the board workshop. We went in deep on this. But this is a program and division that right now there's a 24% vacancy. It's been a real struggle to hire and retain workers. I feel like just from the data that I've done, our workers are at the bottom, along with Hennepin County, but Hennepin has actually been taking a lot of our people. And I think a big part of that is because they're just very flexibly matching salaries and increasing them. And so that's just a challenge that I want to, but we're working in partnership with Human Resources. Our county manager has definitely heard us about our concerns. And we just hired a new cohort of new people. And in child support, the training is extensive. And it just hurts when you lose somebody after 2 or 3 years. So everything we can do to keep that new cohort, and then we have another, we're right now in the process to hire that second cohort. So we're working on trying to fill that vacancy, and I know all of you are working on competitive wages.
I do want to make a comment, and it's not just about the county attorney's presentation here, but we have been compared to Hennepin County and how they can do more and so forth. And I do think it's important to understand that we're not Hennepin County. We do not have an expanding tax base. We are fully developed, which means any development that happens is redevelopment. And so even though we're the two largest, well, not largest because we're the smallest in the state, but as far as population, we do not have a way to, I mean, they can raise their budget and lower taxes at the same time because of the expanding tax base. And so, and it's nothing to do with the county attorney's office, but it has come up a few times, and I think that it's important for people to understand that.
Yeah, and so
Commissioner Ortega?
Just a quick question, John. How long do you have currently 24% vacancy?
As of when we put the slide together,
Yeah.
I don't know if it reflects the new cohort that we
Okay,
hired.
but that's fine. How long let me put it this way, how long has it been in double digits? Last year, were you in double digits in vacancy in this area?
Is that a yes, Trish, or you want to come up here, or I don't know the answer to that question, Commissioner.
Okay.
I don't want to take a lot of your time. Go.
Okay, what I'm going to suggest, because
Yeah.
we are running out of
No,
time
that-
here,
yeah.
we can get the answer, if it's a very short answer, we'll do this one, but then I'm going to have a suggestion as how we finish up this one.
Okay.
Thank you, Commissioner, Madam Chair and Commissioners. We have been in double-digit vacancies probably since COVID. Since the beginning of COVID, we started to see large numbers of resignations and retirements.
Okay, thank you.
Okay, what I would like to do now, since we don't have a lot of time, you still have a number of performance measures. If you could just basically just run through the slides, and what we're not, just the slides that are dealing with the performance measure, so that we have it on record as far as what they are. Then what we're going to do is we will take that portion of this presentation, and we will put that into a workshop setting. So we will get through all of it, but we can't do it here today.
And we'll hold questions then, because we
Yes.
won't get through it if we ask questions.
That's right.
I won't ask
But we will still have the opportunity. That's what I'm trying to say. We'll still have the opportunity, but we'll do it in a workshop setting. If that's acceptable to everyone? Okay, John.
Okay, so Rich, you're going to help me get to the resolving youth cases in an alternative way. This is a slide that I am very proud of, because if you go into the data, you know, one of the things that is really critical is how we lean into this issue of addressing racial disparity. And I used to be a prosecutor that believed that there was not much that I could do about it. But through the work that we're doing around our Reimagining Justice for Youth and building out a collaborative review team, you will see some really remarkable numbers. And if you just go to the next slide, this will show you, you know, our RJY efforts and our collaborative review. There once was a headline that said crime but no punishment. And this, when we launched this program, it was very controversial. But as you can see from these numbers, some really significant things have dramatically changed. So these are the numbers broken out by race of youth who have been offered an alternative. And so you can see 2017 and 18 is our baseline. First year of RJY, second year of RJY. And you can see that we have reduced those disparities that we saw in young people being offered some alternative, a different way. And I think a big part of that is because when you have a very intentional approach to understanding kids and their needs and their families and getting them actually engaged in the services, you can make a difference. go to the next slide.
Okay.
One of the things, yep.
Is this the last one on this particular subject? Okay, go ahead and do that, and then I'm gonna take it over.
And the next slide is those who have been successful.
Yes.
And as you can see, we had a negative disparity of 24%. And now that is at a positive 2 over the first, second, and third. And we'll have a third-year report coming out shortly. But these are youth who are succeeding with regard to our restorative justice and community-based accountability. And so if we can move on to the next slide. And I think you wanted me to just talk about the numbers, so I'll continue if you go to the next slide.
Could we move on to page 24, because we literally have like a minute and a half.
But he started 20 minutes late, but you're
Well-
going to cut him down.
And again.
Okay, we'll give you a little more time, and then we're taking it away from the sheriff, and so we'll just be very.
Well, I don't want to take any time away from the sheriff.
We started at 2:20. Well, we started like 2:20 or whenever.
On every presentation that we have workshops, I think, in every single one of them, so that we will get more information. We've only got a certain amount of time because, granted, we can give you more time now, but we have a public hearing that starts promptly at 5 o'clock. And so we don't have a lot of time to flex between. And so I'm trying to make sure that we're staying on track.
I agree, Madam Chair, but it's not his fault. I mean, we've been asking
I didn't say it was
questions,
his
and
fault.
he started late. Right.
In fact, I said that at the beginning. It wasn't your fault that we started late. But we still have that end timeline.
So, Madam Chair, as you instructed, we are now on slide 24.
Yes.
And so I will try to quickly go through this as well. And so these are the numbers in terms of the percentage of people that have been able to take advantage of our pre-charge or post-charge diversion program. And you can see that we have divided or segregated out some of the race data so that all of you can see that. And I am really glad that we've got some of these numbers, but we need to work on some of the other groups as well. But I think in terms of the disproportionality, you see a lot of African American in our justice system. And so getting that number up has been, I think, an important thing. If we just go to the next slide, and I think it'll be really quick. And all of you have funded youth diversion as well as adult diversion. This just gives you an idea of how those dollars are being spent in terms of jurisdictions, because the $600,000 to $800,000 amount that you have put aside for adult diversion not only goes to help the diversion cases in the county attorney's office, but it also provides diversion services for city attorneys across. That was a policy decision that this board made. But if you're curious about your city, about how they're utilizing diversion, you will see that here. It's nice to see that our numbers we're using more than anybody else. And then at the next slide, we'll break that number down by race, I believe, or by what type of cases that they're diverting. And so you'll see our office, city attorney in St. Paul, Roseville, and Maple, which are the 3 largest users. So I felt that that would be important information for you to know how your money is being spent. I think that might be is that it for the, well, and that's information broken down by race. So
Okay.
I can end there.
I'm sorry that I have rushed you through the last slides, because I have to tell you, when you first stood up here to start your presentation, I put an asterisk and diversion next to it, because I know from day one of you being elected that diversion was one of the most important things that you could do, other than prevention, and that takes the whole county. But the last few slides that I did rush you through are honestly probably some of the most important, because it stops people from entering our system. Okay, they did something that, is what it is, but the diversion and being able to help people get back on the right path is incredible work. Because it's not just, as you point out, it's not just about prosecuting and punishing, it's about changing people's lives and the trajectory of what happens with them and their family, and that's what diversion does. And so even though we ran out of time, I think honestly, even if we hadn't, I think it's worth a workshop anyway, so that we can really dig deeper into what those programs are. I know that you've tried some things that you didn't necessarily think were the best, so you went to something else. And you work with the community. I've seen you in action, working with the community, working with your staff, working with service providers to say, what is the best thing that we can do here? If something isn't working right, how do we make it better? And so kudos to you for that, and I apologize for having to rush through this. But we will have a workshop. The other thing that I have noted here is regarding the CERT process and getting information on that. And then I know that Deputy County Manager Reyes is getting the information on trying to pull all these things together to get the race issues defined, to get it defined.
Definitely.
Anything that I missed?
Well, I just want to say, I want to add my appreciation for your proactivity, for you really looking ahead and saying, well, how can we change this? How can we make it different? How can we do diversion better? How can we do all these things better? I do appreciate that you're really helping us look forward. So thank you for that. And you and your whole team.
You truly are residents first.
Yeah.
Thank you, Madam Chair and Board. It's a pleasure to work with all of you. We have a great partnership. Thank you.
Maybe it's good to be cut off a little bit. That way we just give him all the praise. You know? Yeah.
Early.
Okay. That's what I've got on my agenda. I'm just trying to keep us on track.
Yeah, we're on track. Well, we started at 20 minutes.
Well, we went 20 minutes over. And now we're on time. That's all we did.
Thank you, Madam Chair. It's
What?
a really hard
Doing the
job.
best you can.
Yeah. Yeah.
Okay.
I don't.
Probably do need a break.
It's okay to play.
Oh my God. It's a lot to manage.
Okay. I guess I don't need my gavel.
You need more water.
I've got water and I've got coffee. Okay, I needed caffeine.
Both sides are.
Okay, next up we have, actually this is the last one, is the Sheriff's Office within the Safety and Justice team. And so I will turn it over to Gloria, or Deputy County Manager Reyes. Do you want to make any comments?
No, just pass
Okay.
it on to the sheriff.
Then Sheriff Bob Fletcher.
Thank you.
Welcome.
We will try to keep you on schedule so you get to that 5 o'clock hearing. Hopefully a little break in there for you before you start. I'm going to introduce our team. I think some of you have not met the entire team, but I also just put a one-page handout there in your hands in terms of what the statutes say about the sheriff's duties. And the reason I mention that, in addition to the county's performance measures, we try to measure our performance on what the statute expects out of us as well. And those are just simply straightforward statutes from there. And you'll see the first one is keep and preserve the peace of the county. And I think John might have left, but I wanted to tell you that we have had amazing success the last 3 years. Carjackings are down 70%. Auto thefts down 40%, robberies down 40%, and I attribute a lot of that to the partnership we have with the County Attorney's Office on having navigators from the African American Leadership Council help us work with these kids and divert them to more successful lives. So very excited about statute number 1. Pursue and apprehend all felons. We have 3,100 felony warrants right now in Ramsey County. Now, probably 1,000 people that actually have warrants because some of them have multiple, but we have the most effective and efficient apprehension unit in the state of Minnesota. But it still doesn't mean we can arrest all of them, of course. Execute all processes. A lot of civil work goes in executing documents and delivering them. It may not show up as a county performance measure, but day in, day out, our deputies, so far this year, 4,300 civil process papers have been
Fletcher.
served. I'm going to be very brief.
Well, I'm sorry, but we only have a certain amount of time, and this is a
Yeah,
budget
I'm going to be very brief. But I did want to, when I get to you'll see there, number 5 is attend to the terms of the district court. Chinu Lee, please stand up. He won't be talking today. Kyle Meested's going to do most of our presentation, but Chinu is in charge of our courts division, both the civil papers that are being delivered, et cetera. And of course, on the next thing you'll see, the county jail, probably our most important function really is making sure that the jail is run safely and that people that are in our custody are treated well and have some opportunity. And Ashley Bryant is here. She's going to talk about that topic, and I think you'll be very impressed with some of the creative ideas that she's come up with in terms of working in the jail. So let me just say that there's a lot of great things going on, and I don't want to burden you with this, but you got my letter about staffing. And the problem is, without proper staffing, this can't continue. You're 7 times more likely to get carjacked in Minneapolis because they're 40% down on their staffing. And our staff are leaving for higher paid jobs. One of our staff just left yesterday to go to Roseville, neighboring city, for a $5 an hour raise and a $10,000 bonus. So as we work through this next few months, I hope you'll help us address that staffing issue. With that, I'm going to introduce Kyle Meestead, Undersheriff Kyle Meestead, to come on up here and walk you through our performance measures slide. And I told him, talk fast. Talk fast.
How much time is that?
Thank you. Thank you, Sheriff Fletcher.
Next slide, please.
And welcome, Kyle.
Thank you, Madam Chair, Commissioners. The Sheriff touched on what we did, so we can skip past this slide. I think we'll just hop right into our performance measures. Next slide, Rich, please. So this table here, the measures in the red color aligns with the county's overall performance measurement plan and what we report as part of that work. The measures in the gray are what we report as an office, in addition to what the sheriff touched on. Under Sheriff Ashley Bryant, we'll talk about the jail in greater detail. The county attorney's office did talk on expungements. We'll talk a little bit about that. Hand it over to our chief deputy to unpack that topic a little bit more. And then we try and be intentional about having some of our performance measures align with some of the broader work of the county, especially on the work on bail reform, pretrial justice, those sorts of pieces. I've been part of that work for quite a while now. So has Ashley Bryant. Laura's been on board now, and that's been awesome to help move some of that work along. So Rich, next slide, please. And again, next slide. And so this slide talks about diversity in the sheriff's office in terms of staff who identify as Black, Indigenous, or people of color. Overall, we can see a constant rate of growth year over year. In terms of our diversity, that same trend continues in staff who become formal leaders, supervisors, sergeants, lieutenants, commanders, and so forth. So as an office, we're committed to building a more reflective workforce, not just among the sworn ranks, but correctional, office support staff, professional staff, and so forth. And so I know there's a topic around HR, talking about diversity, talking about recruitment and those efforts. We operate very good, robust recruitment programs as well. Next slide. Turnover rate in recent years has trended upward. 2 reasons for that. 1, post-traumatic stress, and 2, as the sheriff touched on, and as the county attorney touched on, staff are leaving our office, our county, for better high-paying jobs. And so that has resulted in some higher than average turnover than we've seen in previous years. Traditionally, when you get a law enforcement job, you'll work for that agency for 20, 30 years and retire. It's a more common trend, like the sheriff touched on, with our deputy going over to Roseville. Different now than it was, when I started or when the sheriff started. You usually would have tenure. But again, hopefully more competitive wages would help address turnover, would help address retention as well as overall recruitment strategies. Next slide,
Do you
please.
have, I know you've got staff diversity coming up, but do we have, and maybe there's numbers in here, as far as we've had this issue come up before as far as the diversity within the turnover. And do you have that in here or not?
Madam Chair, we don't. We followed the instructions provided by the county for this, but I think, if we want to do a deeper dive, we can work with policy planning, HR, and pull that.
Okay.
It's a good, to have that denominator like you talked about would be, I think, helpful than just the percentage.
Yeah, and you know, each one is a little bit different, and so we've got having the performance measure is great, but kind of knowing, okay, what do those numbers mean?
The baseline, yeah.
We can get that.
Is it one or is it two? I mean, it's, yeah.
Yeah.
Next slide, Rich, please. So again, efforts on diversity, leadership diversity and turnover, again, really centers on the idea of more competitive wages, pay structures. We've also leveraged so far to date one Pathways policing grant for her Vang to help use some state funding to help her become a help her go from the correctional officer job series to a deputy job series. And so as the state opens up more funding opportunities for Pathways to Policing, we'll probably be submitting a couple applications. Go ahead, Rich. Again, this slide really touches on the themes the sheriff touched on. I did also note on employee wellness. Our deputy county manager talked on that in terms of our work to expand employee wellness programming in the sheriff's office. That's been done in part by some public safety aid and has been very helpful, so thank you for that. We're also leveraging a federal grant for law enforcement mental health to support that work as well.
You really don't have to rush through, you know, we do have until 4:30. Because we don't even have time to formulate our questions here. Okay.
That might be the strategy, I don't know. If
Honestly. Sorry.
Those logic models. That gambling connection always comes back.
That was good.
So, as we look at small business spend in the sheriff's office, we would know, you know, the county attorney's office had points in front of their numbers. We don't. So we've seen a growth in our procurement spend over the last few years. That's primarily been concentrated on the fact that the vendor that we're using to construct suicide prevention barriers in the jail is a certified vendor. I believe it's a woman-owned business. Our contract manager would know more about this, but it's a certified vendor through the program that we've been able to connect with somebody local to help construct all the safety barriers that we're doing in the jail. So the jail has 2 tiers. The top tier is open. Unfortunately, sometimes people will attempt self-harm by jumping over. We're in the process of constructing physical barriers year over year. It's been a multi-year project funded by capital improvement funds. And so that's why our spending has gone up in that category.
Commissioner Zhang.
Thank you. I was just kind of looking through the slides ahead too, and you had said like mental health is a key one of like the overrepresentation in the jail. I'm wondering if there have been a lot of like partnerships with mental health workers in that area, because and I'm just tying it to this because it's like we're spending money on like suicide prevention, and it really we shouldn't be holding people with like who are suicidal. Yeah.
Madam Chair, Commissioner, I think Ashley, if you want to join, we can save some of this to the jail population conversation. But in terms of, you know, Ramsey County Correctional Health does provide correctional health services to the jail. Social Services does have mental health providers. I don't know if you want to touch on that now or wait till your part.
Go ahead. You can go ahead. Yeah.
We do have mental health on site. We also have medical on site. And so they are reaching out daily to our population to serve them with their mental health needs. Unfortunately, many individuals in our jail have mental health needs. Our jail is not meant for that. Our jail was designed, I would say 20 years ago. I think the idea of incarceration was to be punitive, and we are working to humanize incarceration. It is difficult to do that with the architecture of our facility. There is no fresh air, there is no sunlight that these individuals see, and some individuals with mental health issues have been there in upwards of 3 years. So imagine not having sunlight or fresh air for 3 years. And so I think we can do better, and that is what we're working towards.
Okay, Commissioner Fretham.
Well, and it's my understanding this really intersects with the challenges we're having finding that mental health care in the community or in secured facilities for folks who aren't competent to stand trial, and then they end up just languishing at the ADC because there isn't an appropriate place for them to be in the community. So this is part of that larger picture that we're seeing, and some of the similar issues with the JDC and people being there for longer than they should because we don't have an appropriate placement for them. And so that's that balance of how do we house folks in a way that is humane and doesn't do more harm, but also we need to move up and get those places in the community as well.
Absolutely.
And I think to some extent, too, the physical plant of the jail was designed for a stay of 5 to 7 days, whereas as a pretrial facility, the correctional facility, by contrast, open dormitory style, outdoor space, very different intents from construction. And I think some of this dovetails to the Rule 20s, folks in the state laws there and those provisions that have changed with human services, folks waiting in custody longer than they probably ought to, in hopes they can secure a state bed at some point.
And I can tell you with a new online jail roster that's available, I ran those numbers this morning, and we have 203 individuals who have been in custody over 30 days, and of those, 69 of them are over 100 days. And so you look at the population in custody, I know it's kind of a tenuous issue, but the workhouse is empty. They have sunlight, they have fresh air, and I know there's a kind of a idea to make that more juvenile based, but in the meantime, allowing us to utilize that for mental health would be phenomenal. And those are just some ideas that we're kind of throwing forward, working collaboratively with different entities and just seeing what we can do with the resources we already have.
Well, and I do think, I mean, the Adult Detention Center is supposed to be pretrial. It is not a correctional facility. And so I don't know what we need to work with there because I don't know how someone could be there for 3 years and not have a trial. I mean, they've been charged with something, right?
Yep.
That doesn't, I mean, regardless of where they are, it's not related to anything that you have any control over. But I thought there was something on due process and a timely trial and all those things. And so what could possibly keep somebody there for 3 years?
Madam Chair, the individual in custody who is there for 3 years has been deemed incompetent to stand trial and is waiting for a bed at St. Peter. Unfortunately, individuals at St. Peter do not leave, and we've been told in upwards of 5 to 7 years for that individual to remain in our custody.
Okay, so there hasn't been a trial because he's not competent, or she is, or he, I guess, not competent to stand trial.
Correct. But we do have other people in custody that are criminally charged, and due to delays in the courts, or let's say they fire their attorney multiple times, it delays the process.
Okay, I think that's data that would be helpful for us to know who's the, not who, but numbers of who is there, the length of time, and just to have that broken down, that I think would be helpful.
I think what we have right now
is that
there's a dashboard.
What we have right now, the number is 1,011 days in jail.
I can't hear you, I'm sorry.
1,011 days in jail is, he's been in jail for 1,011 days for second degree with an intent. Not premeditated, so 111 days in jail he's been in.
Well, he's been in the Adult Detention Center.
Yes.
Which is pretrial.
Pretrial.
And so, and is that the one that has the incompetent?
I don't think that is the one.
No, that isn't.
No, it is not.
So why?
It says on
Oh,
both
it's-
for,
Okay.
you have another one for 943 days.
Correct,
You have
yes.
another one for 670 days.
We.
You have another for
Yeah.
560 days. You have another one.
Okay, and that's information that would be helpful for us. And for those that are there for that long, there's got to be a reason, because legally, I can't imagine that you could charge
I
somebody
think-
with something
yeah.
and not take them to trial and do it legally without some extenuating circumstance that allows that.
Yeah,
So-
we have to really review the whole system, from, the prosecutor side, the court side. I mean, we have to evaluate the whole system, and because the whole system really is a barrier, from the pretrial, from, courts, backlog, and there's just a lot of challenges. We don't have places to refer people who really need the help. That's an
that-
alternative.
And that analysis starts, of course, with the data.
Yeah.
So, yes, we do need that. I had two hands up, and I'm just going to go Commissioner Moran and Commissioner McGuire, because I don't remember who had their hand up first.
Okay, so it is a big issue around mental health right now, right? Because if someone is deemed incompetent, they can't stand trial, but at the same time, there's no place for them to go. But isn't it also, believe I heard that those who are being deemed incompetent are sometimes also released back into the community? Is that also a practice?
It is a practice. They usually go to a treatment facility prior to that.
So they usually go to a facility versus just released back into the community?
Correct, and they're waiting for beds. For the Rule 20s, we hover around 35 to 40 Rule 20s pending. We have, as of today, 11 individuals that are waiting for beds.
And you might, for the people that are watching, to just, if you could briefly describe what Rule 20 is?
I'm sorry, it's whether to show if they are competent or not to stand trial.
And the problem is we just don't have enough spaces. And the way the prisons are built today, it's not easy to provide those type of services safely within the jail system.
Correct. We do provide them safely because mental health is on site. The services, but as far as what they really need, the extensive, exhaustive treatment to be able to get them and reintegrated back in the community, we do not have those.
Commissioner McGuire.
Thank you, Madam Chair. And just to remind everyone here, yes, this is a huge issue. And as we get the numbers, I'd love to know how many are waiting for a mental health facility, intense mental health facility, and how many are waiting for this and how many are waiting for that. That would be really helpful. But just to let you all know, every county in the state and the country is faced with this, and that's why we had this resolution that was passed out of Human Services at AMC and then passed also by Public Safety, is that we need a task force to look at with the state, getting some facilities for these people, because every county is faced with where do we put these people that need more intense services than each jail can provide on its own. And so Anoka's full and all the different facilities, the few facilities that are available are full and they're not getting open very, very fast. So every county is faced with this. It's why AMC is being tasked now with this task force. It's something we all, and we're going to band with our other counties in the state to say, what can we come up with to help? Because the county doesn't need to do it by themselves. We should be with other counties and the state should, quite frankly, do this. So we really want the state to provide.
Well, and I believe that the work that is going to be done, that Deputy County Manager Reyes talked about, as far as that system analysis and getting that data, then we can take that to the table for AMC to say, okay, this is the issue, because right now we're talking about it in a more, general way, and when you have the data to back it up, and I think it's a great idea to do that full system analysis and not just take parts of it, so that the legislators, AMC, that we've got data that they can look at and say, this is a real problem, and this is why. Is going to be helpful. We also have more slides in here about the Adult Detention Center, so, but this is more system-wide. I think Commissioner Zhang, you had your hand up, and then if there's, but we do have more slides on the Adult Detention Center.
I'm okay, thank you.
Okay, then we'll move on.
Okay, so back with respect to procurement spending and whatnot, we are going to continue upgrading, adding suicide prevention barriers throughout the jail. We are going to have to return to the county board with a sole source request to continue that. We've exceeded the contract dollar amount. It doesn't make sense to put it out for bid because we have a contractor that's already done several projects for us. We want to continue that, and so you'll see that in the coming weeks. Is
it a contract that's already in place? Why wouldn't we just extend it?
I think we've reached the extension of it and the dollar amount at the time, so I'm guessing when...
Well, I'll let the county manager and you work that out.
Perfect. So you'll see a single sole source request coming forward for some construction work for the jail. Just know that that's to continue the suicide prevention barriers.
Okay.
Next slide, please.
Gender diversity, on a positive note. The sheriff's office is 36% female for sworn. Nationally, women represent 12% for sworn and 3% for leadership of women in policing. There's an initiative out there, it's called 30 by 30, and the idea of that is to increase representation of women to 30% by 2030. We have already hit that for the sworn side. We are at, for our entire office, we are at 23 or 26% last year. I believe we're at 27% this year as of now. We're trying to stay at that number or go above that. Just in seeing, coming into the detention center, if you don't understand how it kind of works, is correctional officers generally start their career in the ADC, and a lot of them go to school to become law enforcement officers. In the past, many of those correctional officers have transitioned to become Ramsey County deputies. Unfortunately, we're now seeing those correctional officers leave to other departments, and so that investment of that employee is now leaving, and we're not gaining that. Just when I came in, we had 2 female correctional officers leave. I believe they went to Washington County. The person that they spoke of that went to Roseville is a person of color. So just anecdotally, we are losing the women and people of color because it is so competitive out there. As far as correctional officer hiring, this is the 5th hiring cycle. We're doing interviews today, and we have not been able to fill all of our vacancies as far as we hire and then people leave. We hire, people leave, and it's becoming where I have so many big ideas. There's so many correctional officers there that want to do other things, but we can only focus on the safety and security of the facility at this time because we're so understaffed. And unfortunately, we don't really see any end in sight because the people who are coming in as candidates are in simultaneous hiring processes. And so they might go to our academy, and then the next week they get an offer to a different county and they leave. So the intangible costs are that we are wasting our time training these individuals to be a part of Ramsey County, and they're just leaving. So they're leaving very well trained, and we would like to retain them. And so that's why when we look at the gender diversity, because it is a lot of females and people of color that are leaving, we want to try and get a hold on that before it gets too bad.
It would seem to me that we could do something as far as if you take our training, or we train you, and you leave before you even start the job. I mean, I don't know what HR can do, but I know if you're going into different professions where the employer is training, you have a commitment for, it doesn't have to be a long time, but at least so that you can get your money's worth out of it. But having somebody, I don't know how often that happens, so I guess maybe we need the information. I also, I thought I heard you say something that I hope you didn't say, and that was that you couldn't guarantee safety within the...
No, we have programming that we'd like to do, but we can't do that because we're only focusing on the safety and security of the facility.
Okay.
Yes.
No. It was like I said, I was like, no, they couldn't have said that and just kept going. So, okay.
Yes.
So it's, you have to trade off to make sure the safety is first, obviously.
Correct.
And then programming and some other things that you're not able to do as much of that as you'd like. It's not that you can't do it at all.
Right.
Okay.
Before COVID, the majority of our programming was done by volunteers. After COVID, they didn't want to come back. A lot of those volunteers are elderly. The jail is a large population, a small area. And so we saw a lot of those volunteers that we had depended on for years not want to come back. And so the thought process is to get more correctional officer-led programming in order to facilitate a more robust idea of humanizing incarceration, so it's not just the uniform that we're the villain all the time. We do help these individuals who are in custody, and we want to work towards reintegrating them into the community versus just kicking them out the door and hoping for the best.
Well, and again, with that would be for the correctional facility.
They're pretrial, though.
Pretrial detention, you shouldn't have a whole lot of time to rehabilitate someone there, but I guess in some cases you do. But there's a line there as far as programming. There's a lot more programming to rehabilitate people at I would think anyhow, at the correctional facility.
The early intervention piece too, I think, is key.
Yeah. So a lot of times there's so many different hearings that an individual has to go through before jury trial. So and that each one of those hearings is many days out. And so they do end up staying for a long time. They have idle time in the jail, so why not utilize that time? And I think a lot of them are also looking for that because, I mean, this is one of those places that you can learn anything you want because you have all the time in the world. No responsibility except to get up and eat and behave yourself. And so we have actually created some really great units now. We call them G units, and those are basically they're very well behaved. We provide incentive based towards their behavior. We're providing them, the individual who has been there 3 years was an art teacher, and so we've provided art supplies and things like that. And so we're trying to tailor their needs based on what is important to them. And I think we can do more on that. It is just more doing a self-inventory assessment of each individual and taking that time, and then figuring out where their triggers are, what they need in the community, and getting them aligned with those services prior to being released. Because if you're coming in addicted to drugs, you have 6 days to sober up, why not then get them into something instead of just kicking them out the door? And a lot of times, because we just let them out, they go back to their old habits, and then we see them again. And so interrupting that cycle with services and not having them have to wait 2 weeks to go get an appointment somewhere, because once we release them, that's where they need the help. So.
Well, I can see where it would be more difficult in the pre-trial detention center also, because hopefully they're not there that long before they have the trial and see what's happening there. But in the correctional facility, you know how long, or pretty much how long they're going to be there. So, and it's our correctional facility is what is it? Is it up to 18 months, or what is it?
Should be a year.
A year. Okay.
Yeah.
So they could have been in prison, and then the last year can come to us, or if it's a year, then they can just come to us.
So usually if it's a year or less, people will serve local time.
Okay.
And then if it's a year or D, it's a commitment to the Commissioner of Corrections at the state level. And then under sentencing guidelines, there's different criteria, but it's presumed, I think, a portion of that then is on supervised release, depending on how whatever the court orders.
I thought there was something where when you got to the end, if you were in the state prison, or federal, I suppose it's even more, but that you could be released to finish your term.
Yeah.
At ours. Okay.
Supervised release or intensive, it's a community corrections function.
Okay.
A 1/3, 2/3 split or something. I don't remember the name.
The commissioner tried to push their inmates on us for the last year, but that really didn't get legs ultimately.
Okay. Okay. Thank you. Chung, did I call on you, Commissioner Moran?
I don't think
Commissioner Jean, Commissioner Moran. I think you both had your hands up, and I don't remember.
I don't think so. I'm fine.
Okay.
Thank you.
Commissioner Moran.
So first, I just want to say thank you for humanizing this work that has not always been humanized, and talk about going, I want to say, a little bit upstream and try to provide services. Because people are coming in with, mental health issues, along with substance use disorder. And so having a pathway for services would be great if that could happen. I know you also mentioned that you're wasting your time training, but not only are you wasting your time training, but you also are wasting dollars. It costs money to do that. And not only are people leaving because often because of the rate of pay within this system, but within Ramsey County other system, I mean, we are training a lot of people who are turning over and leaving. And a big part of that is within our FAST our frontline workers, right? Because got that green screen that they're working with that often, in competitive wages. So I do understand that the necessity to get more competitive with wages. I don't think I saw here, did you disaggregate the data around the diversity of your workforce? I saw you had here, you just said a percentage of staff who identify as Black Indigenous. Is there a way for you to disaggregate the data?
I think, Larry, I'm going to put you on the spot, but I think from policy and planning, there's the 2 standard categories, but we can do the deeper dive and report back what that looks like.
We've asked for that from others as well, so we can get that data.
I think this should be on the open data portal too by race.
Yes, Madam Chair, Commissioner, it is on the workforce statistics report, at least for the major race and ethnic.
I don't think you have your microphone on because I can't hear you.
Apologies. Madam Chair, Commissioner Moran, yes, it is in our workforce statistics report, and it's broken down by service team and then department. So I'm not sure if this is working yet.
If you can get that to us, that would be awesome.
Yes. Thank you.
Okay. Okay, we can move on now.
So the next performance measure touches on the adult detention center average daily population.
Right. And this kind of goes back to what we're talking about with the bail reform and other partnerships regarding pretrial services and just different pilot programs. Our hope is to get that number down and figure out pretrial diversion even more so. We can't control who comes in our doors. We can't control the crimes that are committed, and we can't control the release factor because they're there by the order of the court. What we may be able to, my philosophy is that the jail population is a report card for our community, and the higher it goes, the more somebody's not receiving services, somebody's not getting the help that they need, or they're being triggered by something that they shouldn't be triggered by, and they haven't sought help because they don't know where it is. And so being able to get the transparency of where those resources are, reduce a waiting time for those kind of things that maybe it will prevent people from coming into custody. And so also, the jail has always had a mysterious air to it. Nobody really knows what goes on in there. And I appreciate all the individuals who have been wanting to take a tour and see what it's like, because it is eye-opening when you come and look at our jail. But understanding that we also get to know those individuals when they're there long-term. We know the individuals when they've been here over and over again. To be able to give some of that information to community partnerships and say, this person is having issues with substance abuse. Here you go. This person is having issues with domestic violence. Here you go. We're able to do that because they are there with us for long periods of time. And I hope to create more programming and collaboration with community partners, the county attorney, and figuring out how to reduce that pretrial stay. So.
You can do next slide, Rich. I think we covered this a little bit. I don't know if you want to touch about tablets and CO-led programming.
Yeah. So again, I had already touched on the CO-led programming. I would love to get our staffing up so we do have individuals, correctional officers, be able to do the programming. Not only is it important for the people in custody, but I also think it's very important for correctional officers to have other opportunities. It is a very negative space to work in for 30 years. There's a lot of trauma that they go through, and to be able to give different opportunities under the job class of correctional officer, rather than saying you have to give up your pension and everything to go do X, Y, or Z. It would be nice to be able to get out of the box for options, or just provide other opportunities within that gives them a break from the daily grind of tours and verbal abuse and just, we have a lot of emergency, they call them A-team responses. So whenever somebody has a behavioral issue, we have those daily, sometimes multiple times a day, and it does wear on a correctional officer. So to give them a break, what that looks like, I don't know. But I think that is also good for our population, because that negativity, if there's that break, there's not the kind of the conflict of somebody who can't control, well, not control, who somebody is having a hard time with their stressors. And so I'd like to be able to have those in place. We're also hiring for an administrative planning assistant who is going to help with bail reform, and that will be super helpful and provide a bridge between our data and the data that the county would like. As far as,
Oh, I'm sorry, I could wait till you finish. I'm still on this slide, so if you want to finish this, then I can ask a question.
No, go ahead.
So you mentioned something about when people are in there for a long time that you can assess if they need mental health or if they need domestic violence, support, counseling. Do you have any ongoing program at the ADC, for people that are there short term, even just a week? There's nothing ongoing. I guess I'm thinking of our I don't know. I thought we had some ongoing program. Maybe I'm thinking of the workhouse. I don't know. For our people that are there, even just for a week or so, if they could do something with their time, like art class or, I don't know, reading. I don't know.
I know that they're just hiring navigators, which I believe will also be kind of a bridge to that. As far as when they are released, there's the pretrial justice that I believe provides them with services as well. But when they're in our custody, there is no formalized programming. Yep.
Except the mental health support,
yes,
right?
of course,
You got
the mental health. But what we are hoping, though, is we're currently doing a solicitation for our communications. We have selected a vendor, and they're going through contract negotiations. With that, tablets will be implemented into our facility. And with the vendor that we selected, there are robust programming options available. Yes, absolutely. You could get your GED. Yes. And we are also working on getting more and more programming in there and trying to push that. We just come up against being short-staffed.
I appreciate that too. Madam Chair, just one more quick. So you probably said it already, but remind me, what's the average length of stay in our jail for people? I know we have the really long-termers and we have the short-termers, but what's the average?
Yeah, it is case dependent.
Right, I get that, but sort of the average.
For a felony, you're going to be there a lot longer than someone who's there on a misdemeanor, gross misdemeanor, which should average between 42 to 47, no, 27 to 42 days for a gross misdemeanor, and you can't pay the bond. That's what we forget to add in there, because everyone has a bond per the statute, but most individuals can't pay the bond, so they have to
I get that, yeah. So that's a month, so I'm glad you're doing tablets. I'm glad you're thinking about some programs, because there's enough time there to at least get them thinking about doing something. So thank you.
I know when
And
we were
you do have the data on that. I believe it said on the dashboard that there's information about.
Thank you, I just didn't have it right.
And so what I wrote down was there's different reports and things that are on the dashboard, so that if we could pull those together so that we can bring them back to the board, that would be helpful.
I would say it would be very rare for a misdemeanor or gross misdemeanor to be there past that 10-day frame, because there has been so much work towards that. The individuals who are there 30 days plus are going to be the felons.
Thank you.
Okay, County Manager Becker.
Yeah, I do think that the idea of investing in some opportunity for folks that are at the detention center is generally a good idea. In Workforce Solutions, we were working with the JDC on something very similar, knowing that some of those kids were there longer than we'd like. We were actually toying with, and they still are probably talking about, we're trying to name a program, but we were calling it kind of Familiar Faces. I know that's a COC program, so we want to be careful with the continuum of care, but just kind of recognizing that people don't have that social capital of resources, and so even if they can meet somebody while they're detained, that's a familiar face, that when they become released, that they could reconnect with them, right? And so I think it is a thing we should continue to work through, even on short-term detentions, both at the JDC and the ADC, because it is a chance that we have someone's captive attention to have them learn about programs. So I do appreciate the intentionality for this conversation. So thank you for that.
And it sounds like the navigators will help with that. It's not the only answer, though.
Correct. I would love to partner with felon-friendly employment. If they need a week training, we can do a week training if they give us that training program because they are in our custody. Of course, it would need the staffing to do
That's a
that,
good idea.
but just think of what it does for the community to have somebody released from jail and start a job.
I think as we transition from adult detention center to the court functions, we should also note that you started as a correctional officer.
Yes, I did.
And then the population day was, the population yesterday morning was sitting at 458.
458, yeah.
So we're back high again. All the more need for some of these services and work to continue.
What is the maximum?
Go about 495, but then you have the state rule
Okay, so
there.
we're not over
that's-
the maximum anyway. Okay.
That's one max we don't want to hit, you know?
No, we do not. Thank you.
Maybe we'll go to the next slide, Rich, please. This will transition into the functions the sheriff talked about with respect to court services. Our chief deputy will be up to speak a little bit more about it in greater detail. But we do provide 2 performance measures as it relates to our mandates for court services, number of expungements processed. So as the county attorney touched on, expungements and that process, his office will lead that work. Ultimately, the expungement comes to us to take care of the data entry, and the clerk will work around that. So, because we're the arresting repository for the county, different agencies have different access to different databases and whatnot. So we have to go and physically remove the expungements, handle the record side. We do know that expungements, as the county attorney touched on, you know, that the criminal conviction, that record can be a barrier to housing, employment, education, so forth. So if the courts determine that a person's record can be expunged, we will process that, and that helps provide for a higher quality of life. The other piece of performance measures that we report on is the percentage of emergency papers served within 5 days. So when there's an order for protection or harassment restraining order or domestic violence no contact order, the court will issue it. It comes to the sheriff's office civil process unit. We have deputies that will go serve the respondent in that matter and say, you're no longer allowed to have contact with this person because they're a victim of harassment, stalking, domestic violence, so forth. We try and serve all of the papers as quickly and as fast as possible, provide that extra layer of protection for victims of crime in those particular situations. Our service rates tend to be relatively high, which means we're having a positive impact there.
I suspect that it's about as high as it can get because it's not as if the person you're serving doesn't know they're being, in most cases, they know they're being served.
Yes.
And so they're going to hide out. They don't want to be served, even though they know it's on the record.
And they'll go and hide, they'll
Yeah.
run. There's some new statutory mandates the chief will talk about that talks about how we process them differently than we have historically before, just to help improve the service rate. So Dave, I think if you're...
I
I'm
do
trying.
think before you move off of this slide, there's really a drastic difference between the expungements processed goal for you and for the county attorney's office, because the county attorney's office doesn't want to handle 2,900. And so, well, yeah, and so just know that even within our budget between the two, that the county attorney's office and the sheriff's office who handle this, that's a partnership. It has to be.
Absolutely.
So there's a little discrepancy there, which is not your fault or his. So just wanted to point it out.
We'll unpack that too.
All right, can we go to the last slide? The timeline, is this on, Kyle?
Yep, it should be.
All right. Okay, good afternoon, Madam Chair, Commissioners. Dave Methuselah, Chief Deputy of the Sheriff's Office. I just wanted to start, so this is not, some people I've had conversations with think this is kind of a surprise and bad timing that we're talking about this issue. And just so you know, this was in our budget book last year. And a couple of things that have occurred since then. Scott Williams called me last August and to talk about staffing implications. We both realized there were going to be those implications. So I cited Under Sheriff Tina McNamara at the time, and she came back doing significant work on it and came back with a request for 7 FTEs in the fall. But I was not comfortable that we had enough data to make a big ask like that. So we had, in conversations with Scott, decided let's experience the first quarter of this year. And then the goal was to, in the spring, get to a workshop with you, so that would have come long before this. But there's a variety of turnover, a variety of things, no one's fault that we end up presenting this here today. My assumption is you may want to have a workshop on it to do a deeper dive than we could do today. But what I wanted to talk about first is...
Could I just ask a question? Because I thought this came in last night, this slide. So this was in our last year's...
The timeline was not, Madam Chair. Just the issue.
Oh, okay,
the issue.
gotcha.
So the timeline is not what was...
How did I miss this last time?
No, Madam
Okay.
Chair, what was happening with all the turnover, I was having various conversations with people that thought we were popping a big surprise on them of something that's a big deal, and this has really been in the pipeline since July, August of last year. So at any rate, as the first quarter, we're able to, call that request down to identifying 4 FTEs that were needed for these issues. And they really are separated into 2 categories. I'm going to start with what I think is the most important one, and that's the domestic abuse orders, harassment orders, things of that nature. And the background on that is what happened is the FBI audited the Bureau of Criminal Apprehension. They said the process you're using is all wrong, and they have a much better process that then the state required that we use. And so that creates about an hour extra administrative work per order. Let me just look at my notes here quick. So basically, staff are handling these things with much more, data entry and work required searching databases. The overarching goal of this is by searching all these databases and having all that data entry in portals, those people you're talking about that are trying to hide out, that don't want to get served, the data that our deputies and police officers on the streets will have is more known addresses, more known employers, more known cell phone numbers, possibly more known associates. So the overarching goal is to get this rather thin safety net, if you have some experience in this area, to be a much stronger safety net for victims. So the more data, the more likely the person will be served, and the more likely the order will be enforced. Because as we know, if we don't serve the person and they go violate an order that exists, if they haven't been served, police officer won't take them in. So that is the goal of this. And what I asked our commander in civil process to do is to do a time study on these and come up with an average of what is required. So they came up with about an hour. Now, somewhere a person has a lot of criminal records in different databases, that time can be much longer. But based upon our 5-year average has been 3,200 a year. So 3,200 hours of work with this.
Can you tell me where you're at on this page?
Well, this is just my personal notes.
Oh, okay, never mind.
So I remember what to say and not miss anything.
No, that's okay. That's okay. I thought you were referring to something on here, and I was not.
No, I apologize.
That's okay.
So currently this year we're averaging 324 papers a month, which is about $3,888 a year. So about 2 FTEs to properly do this, and we think this is. I mean, it fits with criminal justice reform. It fits with the goals of the county, and really all of our moral obligation to protect victims to every degree that we can. So I'm extremely comfortable with going forward with a number of 2 FTEs to make this work, make it more efficient, and provide that safety for victims. Are there questions on that one before you want me to go on to the next one and get you out of here for a break?
Yeah, for a break. I don't see any hands up, so go ahead.
Okay. The next one is a little, the information's evolving fast. It's with the expungements, and kind of how this is rolled out, there's several tentacles to this, is the county attorney to a certain degree, both, or their prosecutors, both in, achieving plea deals and in supporting expungements and promoting them to a certain degree within reason. The expungements have picked up prior to any of the legislation. Now, the most current legislation, the cannabis expungements, there was a thought that that might be a temporary increase. What happened is we didn't get the list from the BCA till May. And the way they chose to do those lists is the agency that created the incident report gets the list. But so, for example, we got several hundred, but St. Paul Police got their list. But if that resulted in an arrest that created a jail record for us, we're going to have, and Maplewood Police is the only one thus far that has sent us those records, but there'll be several more expungements on that. The other thing that is coming is there's a board that's being put up. Let me see what the name of that is. Anyway, it's a cannabis expungement board for things that don't otherwise qualify under the initial legislation, where a separate board will look at that, and then we'll start getting those orders.
Is that statewide too?
Yes. And then also next year, the Clean Slate Act goes into effect, and that'll be thousands more, because several more crimes are going to be included in that. Now, the more complicated part of this for our staff is the individual. What gets confused sometimes is that the individual is getting expunged. The individual is not getting expunged, specific charges are. So if a person comes in with 2 or more charges, say on a specific arrest, that record may only have 1 charge that's expungible. So the amount of work going in to extract data out of a record, but then let the record still reside without that data, or extracting narratives out of anything that's narrative collected, becomes extremely time consuming. So to support that work, and once again, the overarching goal is that for people to get employment, housing, et cetera, jobs, I mean, it stands in the way. So getting expunged is, I think, helpful economically for the community. So that's the other one. We think, what I would say on that is 2 full-time employees are what's needed right now, but I think you were here, Commissioner Reinhardt, back when we had the mortgage foreclosure crisis. We all recognized it was a crisis. We needed help immediately. The board gave us 2 FTs for that, but with starring them, I think Janice Rettman used to love to use that term, starring them, and then we went back at some point. So I mean, I would be hopeful on this topic that if we get the 2 FTs and we handle the next year and a half or 2, that we can come back and report to you, and possibly it's a long-term need of only 1 as opposed to 2. So, and I'd be happy to take questions or any direction. If Gloria and I have spoken, I mean, this workshop we were hoping to have in May got moved out of whether there's more information you need and you want to have a workshop, or what next steps you might envision.
Well, I know that there's a workshop that's going to be pulled together with an overall systems analysis, and I assume that this would be part of that, and with the data.
We can include that.
Okay, so yeah, we've got that. We don't have a date on it yet, but we do have that, that we need to have more of an overall systems analysis to figure out how to, well, as you pointed out, AMC is looking at trying to do some things with that as well. So our data is going to be important to be added to that.
Right.
Commissioner McGuire?
Thanks, Madam Chair. I'm not sure. So the county attorney legally does an expungement, but then you have to take it off the record. So explain to me who does what in this, because we need, and if he does all the expungements he thinks he could do, you're going to get even more expungements to handle. So
Well,
he makes sure
no, the
that
number they had
handle
was
them.
quite a bit higher than the county attorney's office.
Right, but they'll get even more then from the county attorney, because you get them from all over the place, right? You get them from every county.
Madam Chair.
You get them off our records.
I see.
Commissioner Ryan, yes.
Just help me understand
That's
what your
correct.
role is and what the county attorney's role is.
Madam Chair, Commissioner McGuire, so when the county attorney gets an expungement, it generally goes before the bench and we get a court order to expunge it. And those court orders are very good in that they generally include every place the data resides, and every person that has data on that particular crime gets that notice from the court. What's a little more cumbersome with the state, we get a list from the BCA, for example, on cannabis expungement, and we're just legally required to do it, so it doesn't really need to touch the county attorney's office, except for if they have data residing in their databases, then they have that issue, but they don't have to execute a legal process because the expungement is in the law. So each one of these different forms of expungements all have their own different path, and it's known when an attorney, I just got one last week came from a law office with the court order to expunge, and they were very clear, every agency they listed that they thought had a record on that person to make sure it was expunged. Some of these other ones where they'll send, cannabis expungement to St. Paul Police. Well, if they ended up booking that person, we have that record, so the record is not really expunged unless they get that to us. So there's a lot more collaborative work that needs to be done with our law enforcement partners to make sure the full spirit of the law is being handled.
Oh, my goodness. So, yeah, so we'll probably all have more questions on that. I appreciate that all the work that you're doing. So you're the ones that really expunge it then. I was thinking the county attorney expunged it.
Madam Chair, Commissioner, so they may have records on these cases themselves, but a lot of the cannabis ones are city attorneys that have them. So the cannabis cases that I'm talking about that would come from St. Paul Police Department for us to expunge if there was an associated booking record, they're also going to go to the city attorney because they're going to have some records of that individual too. It's not prescribed quite as clearly in law as what has to actually happen to make it work
Wherever that
appropriately.
case has touched,
They have to
it has to, in each individual,
So if it's in Ramsey County, does it touch both our county attorney and our sheriff's department?
Not
it could.
necessarily, yeah.
It could, but it maybe
But not
doesn't.
necessarily.
But it also could include and probably would include a municipality.
Right.
So-
Madam Chair, Commissioner, also under those, mandates we were talking about before, obviously the first issue I talked about was, serving court orders and writs and things like that in the statute. And that's kind of an invisible unit to most people. The unit that does the expungements is in our law enforcement center on the first floor, and they have criminal history and warrants that are all executing their duties for the district court, and then gun permits is down there as well, which is our statutory mandate to turn those around in a certain amount of time.
Okay, it is now 4:14, and we really do have to get this wrapped up. We have closing comments, and then we go right in at 5 o'clock for the public hearing. Commissioner Fretham.
I just want to thank the Sheriff's Office. I think in 5 years, this is the best performance measures that I've seen, not only in the amount of information we've received and the conversations that we've had, but also the data that you're showing. There's been consistent growth. These are meaningful metrics, and I appreciate that. I appreciate you walking through kind of this history and getting to a place where we're narrowing down on a number of what you need for that support. And I appreciate that you've put the time in to think about that. I do hope we can continue that partnership and conversation, and that there are ways we can continue to partner. I think there's been some times where things are happening in both the sheriff's office and the county at large that can be duplicative, that we could combine to better support, and I hope we can continue to work towards that. And I just wanted to share my appreciation, and I think this goes a long way, at least for my part, in rebuilding some trust. So thank you.
Thank you.
Did you have closing comments?
Thank you, Madam Chair, Commissioners, for this time today. It was a very thoughtful process, so I want to thank Larry and Lydia for walking us through this process. I'm sure you're getting a lot of thank yous lately this week. But I don't have any closing comments. I just want to say thank you for this process. We appreciate being before you and walking through our performance measures. Yep.
Okay, well, I think I've actually gone over these a few times, but the requests for information was the racial breakdown on the turnover number. The report broken down by gender and race is on the dashboard, and then basically everything that we've talked about when we do the workshop with the system analysis, we'll touch on each of these things, and we can go back, if you need to, you can go back and we can pull out specific questions. But I think you got a pretty good handle on what it is we need, so that looking at the entire system will help inform us on what we need to do in the future.
Exactly. Yeah.
And it will also help inform, and quite frankly, when I look at the list of statutes that have been done, I'm looking to Rena and Mai Chong, you're the vice chair of legislative. These are legislative mandates that don't have money with them.
Mm-hmm.
And so we shouldn't just say, okay, yeah, we'll cover it. We need to put, and I know we have a lot of planks in our budget, in our platform regarding funding for mandates, but these are public safety mandates. Mm-hmm. And if you're serious, if the legislature is serious about trying to help in make our community safer, then they also should put some money in. Now, we know that we're never going to get fully funded, but the fact that our levy has gone up, the property tax portion of our budget has gone up to 45%, is a result, a direct result of mandates. Again, mandates aren't bad because it's to try and level the playing field, it's to try to make people safer, healthier, more secure, protections for kids, and I mean, all the things that are out there. It's not that they're bad, but the good ideas have to be funded. And if that falls to the county, it's our job to make sure that the legislators understand that and that they need to provide more funding. So, thank you. Then for the closing comments here, well, first of all, I really want to say thank you to the whole team. And later today, well, in about 45, not even 45 minutes, will be the first public hearing on the 2025 supplemental budget. It's right here in this courthouse, in this chambers, on the third floor if people are watching and want to come down quickly. And there will be both a virtual and an in-person option for public comment. It does say that you can sign up with the chief clerk at 651-266-9200 or via email at chiefclerk@ramseycounty.us. I would suggest that if you are listening now that you might want to do that through calling the chief clerk's office to get on the list. And obviously, in order to participate virtually, you have to have that they can give you the way to do that when you call in. So again, 651-266-9200. If you want to do it via email, chiefclerk@ramseycounty.us. On Tuesday, September 24th, the board will set the 2025 maximum property tax levy. The second public hearing will be held in December, and we'll get details to you on that. And let's see. So really, as far as the proposed property tax statement, that'll come out in mid to late November. But we will have that date set before that. On Tuesday, December 17th, the county board will give final approval to the 2025 supplemental budget, including any changes approved by the committee, and set the final 2025 property tax levy. With that, if there's no other questions or comments, we are adjourned. Good. Good afternoon. I am opening the Ramsey County Board of Commissioners 2025 Supplemental Budget and Performance Measures Public Hearing. This is the first of two. The second one will be held in December, and we will get early December, and we'll get that information out to you as soon as we have it totally booked. So I want to make a few announcements, and I'm going to read all of this because I want to make sure that we cover everything that we are supposed to do legally, and because this is a very important meeting to hear from people. There is no vote taken for the public hearing today. Ramsey County is a welcoming, accessible, and inclusive organization. The public hearing is a space for the Ramsey County Board of Commissioners to hear from many different points of views. While providing public testimony, we ask that speakers be respectful and refrain from using language that may be harmful to others. Your testimony will become part of the public record for today's public hearing. The public hearing on the proposed ordinance for 2025 supplemental budget and performance measures is now open. The purpose of the meeting is to allow the public an opportunity to comment on the 2025 supplemental budget and performance measures. For those who are here to speak at the public hearing in person or via Zoom, when you are called to speak, please state your name and city of residence before making your comment. You will have 3 minutes to give your testimony. I know that we have one person online, and
well, we had one person sign up to speak in person, but that person is running late. Their party is over there sitting with us, and so I can go online to see if anyone is on Zoom with us that would like to speak. That's on Zoom.
Okay.
We have one guest online. A. Peterson, do you have any public comments that you would like to provide for the public hearing today? If you do, can you raise your virtual hand so it signals to me that you want to speak? No raised hands.
Okay. Do we have any indication on when Ms. Shaber will be here? I'm going to check right now and see if I can get a hold of her. Okay. We will just wait and see what time she's going to be here. Or hopefully she's provided her testimony to others so that they can make do the testimony. We can't really talk about anything else, but we did complete our budget meetings, and I can talk about the schedule. The schedule will be, the maximum levy will be set, I believe it's next week, or is it the week after? On the 24th, September 24th. And as I stated at the beginning, there will be a second public hearing that will be held in early December. And we are working out the final details of that so that we can give everyone the location and the time and what to expect there. I will call a second time for anyone in the audience, anybody in person here, or the person online, or if there's more than one person online at this point that would wish to speak. If you're online, please raise your hand. We will wait to see what the timeline is. Yes. Yes, why don't we do that? Okay. The chief clerk is, since we know that she has prepared, oh. There she is. All right. Okay, I'm going to repeat the instructions so that you have that, and you would go to the podium there, right there to give the, so Well, I'm just going to repeat the entire instructions. There is no vote taken for the public hearing today. Ramsey County is a welcoming, accessible, and inclusive organization. The public hearing is a space for the Ramsey County Board of Commissioners to hear from many different points of view. While providing public testimony, we ask that speakers be respectful and refrain from using language that may be harmful to others. Your testimony will become part of the public record for today's public hearing. The public hearing, well, I've already opened it, so it's already going. The purpose of the meeting is to allow the public an opportunity to comment on the 2025 supplemental budget and performance measures. For those who are here to speak, the public hearing in person, at the public hearing in person or via Zoom, when you are called to speak, please state your name and city of residence before making your comment. You will have a limit of 3 minutes to give your testimony. And I see that Allison Shaber, who did sign up ahead of time, is here to give testimony. Again, please state your name and city of residence, and then you'll have 3 minutes.
My name is Allison Shaber. I'm a resident of North St. Paul. I'm also president of the Ramsey County Deputies Federation. My apologies for being late.
It's okay.
Got caught in a little bit of traffic.
That happens.
I've sent 2 letters to the board that detail our concerns, but I want to highlight a few things to really emphasize how critical this issue is, in hopes to use this opportunity to address it before it becomes a crisis. In the last 2 years, approximately 70 deputies left the Ramsey County Sheriff's Office. This equates to about a 48% turnover rate. 45% of those that left were women and persons of color. 30% left to other neighboring law enforcement agencies. 25% of those 70 retired. Collectively, we've lost decades of experience. The way to address these concerns is by ensuring competitive wages so we don't continue to lose qualified deputies to neighboring law enforcement agencies for higher pay. We know this is true because the Federation sends out exit surveys and we ask deputies why they're leaving. We ask if it's because of wages. We ask if it's because of a better benefits package. We ask them to describe what the benefit package is and also tell us their starting wage. One deputy that recently left, he was going to get an increase of $10 an hour at his new agency. And that was only, that agency was in the metro. So it is a stated priority of Ramsey County to hire females and persons of color. Realistically, without competitive wages, it will ring hollow. As public servants ourselves and community members, we are not strangers to economic challenges. In closing, we are asking the board to pass a higher levy increase that addresses our concerns and issues impacting our members and the residents of Ramsey County. I see I have 50 seconds. I will not go over. Most recently, just yesterday morning, I received in my inbox a resignation letter from someone that has been with us for 3 months, and he is also a person of color. He said he gave permission for me to share parts of this letter. He said, although it was a tough decision to make, the new listed employer provided a signed contract with a number of benefits listed below. He will start making $51.77 an hour in 2024. That's top patrol pay at Roseville Police Department where he's going. Longevity pay at a rate of 6.2% as a 12-year law enforcement veteran. Starting in January of next year, he will make $54.66 an hour. A number of hours get placed in both his sick and comp bank, and he will also receive a $10,000 lateral signing bonus.
Ms. Shaber, your time is up, so if you could wrap it up.
Oh, I'm done. That was actually the end.
Oh, perfect timing. Okay, thank you.
Yes, thank you. Thank you for hearing me.
Thank you. I'm glad that you were able to make it, and I know traffic has been difficult. Okay, I will call 2 more times to see if there's anyone here wishing to speak at the public hearing on the 2025 supplemental budget. Third and final call for whether there is someone either online or in the chambers wishing to speak to provide testimony for the 2025 supplemental budget. Hearing none, I will close the public hearing, but I do want to, I will do that. I do want to make sure that people that are listening know that they can still provide comments. It doesn't have to be in this setting. Through going to the county website and providing testimony. I mean, you could provide comments to commissioners. We'll make sure they get into the public record. The chief clerk will keep the record, all of those. If there's a phone call, that's a little harder to document, but you can do it that way. You can send comments directly to the chief clerk. So please know that there's more opportunities, and we will have another public hearing in December. Thank you. Oh, was I supposed to say? Yeah, sorry. I did do the gavel. Okay. Not as forcefully as I called it to order, but I did.